Bringing our meeting number 68 of the Standing Committee on Health to order. And we're studying Bill C-45, and we're going to focus on, our panel this morning will focus on edible products. We're just waiting for our technical issues to get resolved. But while I have a minute, I want to tell the committee, I've been on a lot of committees, and yesterday was 12 hours straight. And nobody lost their focus, nobody lost their interest, everybody was paying attention. And I thought through this week that all members of the committee have done a really, really good job of asking the right questions and bringing the right issues up. And I'm just really pleased and proud to be part of this committee. So I just wanted to say that. This morning I was thinking about it last night, and an awful lot of committees you go to, people are not focused, they're not, they lose interest at some point, but nobody's lost interest at all through this whole session. It's been quite a marathon. So I thank you all for doing that. It's been quite a week. We're not done yet. We have edibles this morning. So do we have our hookup with Dr. Bandry? Can you hear us, Dr. Bandry?
Can now.
You can, good. Well, we can see you. You look terrific. All right, so to start our panel on edible products, I'm going to, we have three witnesses this morning. Dr. Ryan Bandry by video conference from Maryland. He's associate professor at Johns Hopkins University. And from the Colorado Department of Public Health and Environment, we have Dr. Daniel Vigil, manager, marijuana health monitoring and research. And from Sensible BC, we have Mr. Dana Larson, director. Now we're going to ask each one of you to make a statement that's a maximum of 10 minutes long. And then when we're done the three opening statements, we'll ask questions for the next little while. So we'll start with Dr. Bandry, if you'd like to make a 10-minute introduction.
All right, I probably don't have 10 minutes here, but I'll give you the brief version. So I'm a human cannabinoid researcher at Johns Hopkins. I've been doing cannabis research for 17 years now. And recently I've been focused on evaluating the dose effects of cannabis through different routes of administration, including oral or edible cannabis products. We look at the pharmacokinetics and pharmacodynamic effects of cannabis through this route of administration. And we've also done some product testing research where we evaluate the label accuracy of edible products sold in dispensaries in the U.S.
Say on your opening statement?
That's it.
All right, well, we'll have some questions for you, don't worry. All right, now we'll go to Dr. Daniel Vigil, manager of marijuana health monitoring research at Colorado Department of Public Health and Environment. Thank you for being here.
Thank you, Mr. Chairman, committee. Is this microphone on? Okay.
Yeah.
So I also don't have extensive opening statements. Happy to answer any questions that you have. I'll just say a few brief things. Concerning edibles, as opposed to smokable forms of marijuana, we have recognized a few different concerns that we think are important to address in policy. One is accidental exposure, either by children or by individuals who aren't aware that the product in front of them may have THC in it. The second is overconsumption, primarily by naive users who aren't familiar with the delayed effects of edible products, and then various concerns of contamination, either with microbials or residual solvents or pesticides that perhaps could be concentrated in edible products. Concerning accidental exposure, packaging and the product forms are very important to not appeal to children, and then child-proof packaging is very important. Labeling is also important, both on the product and the package, to make people aware that it's not, for example, a standard candy bar, that there's something different about it. And then for various potential contamination, good laboratory regulations are very important. So I have plenty of information about some of the data that we've seen, et cetera, and again, happy to answer any questions that you have.
Thank you very much. These are the shortest opening statements we've ever had. So, okay, for Sensible BC, Mr. Larson.
Well, thank you very much. I'll take my full 10 minutes. Thanks for having me at this committee. I've been a cannabis activist for all of my adult life. I run a cannabis dispensary, and I probably sold more cannabis than all the other witnesses combined. And it's good to be here today, but I have to say that I have my doubts that this committee will actually act upon the evidence that is being brought before them in the testimony they're hearing. And I say that because I've been at this a long time, and when I first got started as a cannabis activist in the 1990s, the government was introducing the Controlled Drugs and Substances Act to replace the Narcotic Control Act. And at that time, there was a great deal of testimony and hearings, and about 24 groups came forward, and all of them said that prohibition was a failure, the war on drugs was a failure, we should legalize, end prohibition, approach things differently. The only group that supported that legislation was the Canadian Association of Chiefs of Police and the Canadian Pharmaceutical Association. Everyone else was against it. The government said we're going to pass this law and then we'll have a drug policy review afterwards. Well, that review never happened. Canada's Senate took it upon themselves and they issued a comprehensive and detailed report on cannabis, that 5-volume report that remains probably one of the best analysis of cannabis and cannabis policy today in 2002. That report was also completely ignored, and I would in fact encourage committee members to take a look at that Senate report from 2002 because it is an incredible document. And they recommended legalization of cannabis for all Canadians over the age of 16. These were conservative senators, not a bunch of pot smokers, and they recommended legalization for everyone over the age of 16. That was ignored. The year I was born, 1971, the Ledane Commission recommended decriminalizing cannabis possession and cultivation and working towards legalization, and that was also ignored. So for all of my life, I've seen our government listen to testimony, do research, have studies, talk to people, and then ignore the results. And I hope that doesn't happen here today. The Cannabis Act is a bad piece of legislation. It is flawed in a great many ways. It doesn't even decriminalize the joint that I have in my pocket now that I'm going to smoke after this committee hearing. The idea that we're going to have licit and illicit cannabis and that we're going to have the police trying to decide which cannabis is good and which cannabis is not good is simply not going to work. In cities like Vancouver, where that's already effectively decriminalized, we're not going to see much of a change in policy. But in northern areas or First Nations communities or the poor people that are demonized and affected most by cannabis prohibition, you can bet police will be going after them. Where'd you get that cannabis from? That's illicit cannabis. We're going to charge you with possession. It is absurd at a time when we're talking about decriminalizing all drugs that we're still not even decriminalizing cannabis possession under this legislation. Now, I was asked to speak today about edibles, but to me that's a category that's really too restrictive. We should be also discussing hashish, tinctures, capsules, extracts, creams, drops, suppositories, all the many ways that you can use cannabis. At my dispensary, we sell buds and we sell all these other products, and the buds that we sell is less than half of everything that we sell. So when I hear in Ontario they're saying they're going to set up these legal shops right next to the dispensaries to put them out of business, I think, great. It's not going to affect my clients at all. 95% of my customers will continue to shop with me, even if there's a legal shop next door. It's simply not going to have the range of products that are really available and necessary. So as an activist who wants to see better drug laws in Canada, I don't like this at all. But as a business owner, it's great. This is going to keep me and other dispensaries in business for many, many years to come. This will do nothing to shut down dispensaries or affect the black market at all. And, you know, we had a pretty major court case, the Owen Smith case. Kirk Tusaw, who spoke yesterday, was the lead lawyer on that case. And the courts ruled that medical patients have a right to access not only smokable buds, but cannabis in all these other forms as extracts. Health Canada's response was to allow licensed producers to make cannabis extracts with no more than 3% THC, which is a complete disregard of both the letter and the spirit of that court decision. But it's not surprising because that's been the attitude of the government and Health Canada for years. Every time we get a court ruling against to expand the cannabis access, the government and Health Canada takes the most restrictive possible interpretation of that decision. And the result of this is that the government has lost control over cannabis, and they've lost control for many years now. We've been systematically dismantling Canada's cannabis laws for the last 20 years, beginning with the laws against bongs and vaporizers and pipes, which are still on the books under Section 462.2. That law has never been removed, and yet it'd be hard to find a city that doesn't have multiple bong shops in it today. And we did that in the 1990s by simply defying the law, opening up bong shops. There was raids and conflict, kind of like now with dispensaries, but after time, police and communities realized that the war on bongs was a failure, that nobody wanted to see it happen, and they gave up. And as a result, we've effectively legalized bongs and pipes, seed banks, vapor lounges, and we're on the way to doing it with dispensaries and in many cities we already have. So we're not going to follow these laws, and you're creating laws that are simply unenforceable and cannot you're giving the police an impossible task to do with large aspects of this legislation. I'm currently facing charges for giving away cannabis seeds. I've given away over 7 million viable cannabis seeds over the last 2 years. I traveled to 22 cities across Canada the last 2 years giving away seeds. And it was charged in Calgary in 2016 for giving away cannabis seeds. They've set aside a 3-day trial for me at the end of October. 3 days in court in our justice system that is letting alleged murderers and rapists go because they don't have space in our courts, but they're going to make 3 days for me for a trial for giving away low THC cannabis seeds to those who want them. I believe those charges will be dropped before they go to trial, because what a waste of time that would be. But the fact is, our courts cannot handle this massive civil disobedience campaign that Canadians have been launching, and it's simply not going to succeed. And I would like to remind the committee that the origins of Canada's cannabis prohibition and our drug war is not some well-intentioned effort to protect public health or to protect children or any of that. Our war on drugs, the war on opium, and the war on cannabis began as a racist and ignorant effort to eliminate Chinese people and other racial communities from Canada. That's how it started. There's no question about that. And there's no time since 1908 when the Opium Act was passed, or when cannabis prohibition came in the 20s, and today when these laws changed from being racist and ignorant and bigoted to being somehow well-intentioned and good for our communities. These laws are bad in their origins, and they continue to be terrible today. The fact is that the war on drugs is really a war on plants. And cannabis may just be the world's greatest plant. There's no other plant that has the nutritional, industrial, social, and medicinal value that cannabis does. But the other aspects of this war on drugs and the war on plants are the fact that coca leaf, opium poppy, psilocybe mushroom, peyote cactus, these are all also good plants with thousands of years of social and cultural use. And the war on drugs is really a war against these plants and against nature, and it's time that it comes to an end. You want to know who to blame for the fentanyl crisis that we're experiencing across Canada? It's you. It's our parliament that has passed these laws that prohibits reasonable access to opiates. The fentanyl crisis is entirely the fault of Canadian policy. We don't have a drug problem in Canada. We have a prohibition problem in Canada. And when we end prohibition, we will see the vast majority of the problems we associate with drug use go away. Cannabis, in fact, is not a problem. Cannabis is part of the solution. In Vancouver, we now have 2 sites that are offering free or discounted cannabis medicines to opiate users as a substitution project. And there's evidence out of the U.S. showing that American states that have access to dispensaries have less opiate use and less opiate overdose deaths than those who do not. So I believe, from my personal experience and from the research, that cannabis dispensaries are saving lives every day in Canada. I know that my dispensary, people tell me, you helped me get off opiates, you helped me improve my health, you helped save my life. This happens all the time. With alcohol also, a lot of cannabis people find when they're using alcohol, they can get off alcohol by using cannabis. Cannabis is a substitution for more dangerous drugs in so many ways. It's easy to regulate edibles and extracts. Give them child-proof packaging. Make sure that the products are properly labeled and the dosages are correct. That's easy to do. It's not complicated at all. And further, CBD should really be descheduled entirely and removed from the CDSA. CBD is highly beneficial. There's no psychoactivity at all. It's an incredibly safe medicine, and there's no question that CBD should be removed from the CDSA and allowed entirely. But the fact is, we can buy enough alcohol, tobacco, or even aspirin. Without aspirin, you can buy without any age limit at a corner store, and 1 bottle of aspirin can kill you. So the idea that we're treating cannabis so severely and so restrictedly when other more dangerous substances are allowed makes no sense at all, and it really shows the failure of this legislation. So I would urge this committee to go beyond cannabis, to accept that cannabis is a good plant and that prohibition is wrong, to stop handing over this industry to the black black market as you've been doing for so many decades, and to recognize that it's not just cannabis, that the whole war on drugs is an absolute failure, and it's time to legalize and regulate and put policies in place that are based on the science. We've had this research for 40 years or more now. We know that the war on drugs is a failure. We know that cannabis is essentially harmless and certainly less harmful than the alcohol or tobacco that is used every day. So that's what I have to say. Thanks for having me here, and I hope that this committee will listen to the evidence presented and make some serious changes to this legislation. Thank you.
Well, thank you very much. We appreciate your enthusiasm. But we're going to go to questions now, and we're going to start with Mr. Ayoub, and this will most likely be en français. So if you need translation, we have translation facilities there for you. So, Mr. Ayoub, 7 minutes.
Thank you, Mr. Chair. Merci, Monsieur le Président.
Thank you, Mr. Chair. I would like to thank you for your great comments from the get-go. It was a long day yesterday. I was a bit concerned to see that my colleague across the way wasn't there for the end of the day, despite the fact that Mr. Carey always asked for more time to question the witnesses. But he missed, unfortunately, a good part of the evening, so I'm glad to see him here today in good form to ask questions. It was interesting to see in all of the testimony that can be widely varied about the scope and the objective of our goal in decriminalizing and legalizing marijuana. It's to protect youth. We need to ensure that it's done well and that our youth who use marijuana in an uncontrolled fashion, and when we don't know where it comes from, there's no quality control, and we have no idea about its provenance, and organized crime created it. So today we want to talk about edibles and processed products, and youth can be affected significantly by this. I would like to know the opinion of the people in Colorado on labeling, marketing, packaging, and particularly I'd like to know whether edible products increase, or do you think that they can increase the number of consumers of cannabis products because they're more easily accessible, because it's not something that you need to smoke. Most people know now that smoking for you isn't good for you. There are restrictions, but while eating a muffin, I think everyone eats muffins in the morning, and lots of people eat candy. So I'd like to know your thoughts on this, Mr. Vigil and Mr. Vandry.
Go ahead. If you...
Did you say there would be some translation available?
No. The translation is right here. I thought you were fully
I'm very sorry.
bilingual.
No,
you were listening.
Nobody helped me with that.
So, Mr. President, Mr. Chair.
Oh, yeah. Good.
What happened?
What happened?
Sorry,
That's,
yeah, there's nothing
Mr.
here.
Vigil thought he was having full direct translation. He didn't have his hearing. So
There was increased rates of use among youth, and that because smoking is harder to hide than eating, if people will eat more cannabis and have more problems because of that. I think that was the question.
Okay. Okay. Sorry, nobody oriented me.
So, Mr. Vandry, did you have a sense of my question? So maybe meanwhile we can go ahead.
Sure, I got the translation here. So you brought very important points up. I think that testing and quality control is absolutely important in any kind of legislation. And the other thing is, what route or how are these products going to be produced and provided, what vehicle? Is it a muffin? Is it a brownie? Is it a gummy bear? Is it a soda? Currently in the U.S. and in Colorado, you have an infinite amount of consumable products, and the appeal to children is certainly important, and I think that that's clearly in the legislation here and is absolutely paramount to anything that you guys roll out. The other thing is how do you test it? right? Is one method of testing for a brownie. Can you do the same test in a gummy bear and get accurate results? We don't know the answer to that yet. So I think science needs to be done to validate test methods through different vehicles for these products. Packaging is absolutely important to prevent unintended consumption. So a lot of the problems that happen are, and I believe that Colorado has had this issue, and I'll let Mr. Vigil talk about that more, but you get people who consume cannabis containing products and they are not aware of it, and then they have adverse reactions and things of that nature. Education about the time course and the delay in onset of effects, the magnitude of effects is key. The other thing that's actually really important also is education about who should or shouldn't be using cannabis. Now, it's in contrast to our sensible BC friend there, it's not a harmless drug. And people with a certain genetic background or family history of psychosis will respond to these substances differently than other folks. People with cardiovascular disease are at higher risk of cardiovascular problems due to an increase in heart rate and cardiovascular stress. So there are very important considerations that have to be considered when you roll out legalization of a drug like cannabis.
Je peux continuer un peu dans le sens que vous dites.
To continue along those same lines, the fact that we're doing this in steps, because currently the regulations have not yet explored edible products exhaustively to put them to market, but perhaps that might be a subsequent step. Do you think that taking a step-based approach is a good one?
The step is, right? So without seeing exactly what you're talking about, it's hard for me to comment on so if you're going to legalize smokable products and vaporization products first and then approach edibles, it all depends on what you ultimately do with edibles and whether or not there's any public health benefit or harm of ingestible products versus inhalable products. When we're not talking about medicinal use, it takes on a different context. And so the thought process needs to be a little bit different. And so that's the challenge here. So in the context of medicinal use, edible products is easy. You put it in a gel cap.
The question is this more dangerous than smoking? More easy? The access is easier to have to eat edibles than smoke pot?
If it's sold in a store, access is the same. I don't think it's any more or less. The access to the product is going to be determined by how retail sales happen. And so if you're selling smokable products right next to edible products, it's the same. There may be some perception of less harm with edibles versus smokables due to pulmonary concerns. But there's no science
to stop you there. I just want to have the answer from Mr. Vigil.
Sure.
If you can give me a short answer.
Sure. So in Colorado, we see a small portion of marijuana users who use only edibles, but the vast majority smoke, and this goes for adolescents, high school students as well. In our surveys there, the vast majority, their primary mode of use is smoking, and we don't see a large portion who are using vaping or edibles. Sort of the thought was that, as you maybe alluded to, it's easier to hide that and to be doing it during school, et cetera. And aside from a small number of cases, that isn't something that has been widespread.
Okay, time's up. Ms. Gladue, 7 minutes.
Thank you, Chair. And certainly, I think you did a marvelous job yesterday when we had all of our long sessions. Thanks to all the witnesses that are here. I don't know a lot about edibles, so I'm going to try to learn something from you. I've heard a lot of discussion that we should only be allowing edibles that don't appeal to children. But the only edibles I've heard mentioned so far are cookies, candies, gummies, cakes, milkshakes, suckers, and brownies. So my question for you, Mr. Vigil, is what are the edibles that wouldn't appeal to children?
That's a very good question, and I mean, I don't have a clear answer for you. You know, I think packaging is very important because along with education to not leave cookies outside of a package laying out that would obviously be appealing, the types of packaging that a child might want to really get into is important. You know, in Colorado, we had to put in place some regulations sort of after the fact, and so it's you know, it can't be in the shape of humans or animals or fruits, and so that's a start. But where the best line is ultimately is difficult.
Thank you. That's fine.
Sure.
Okay, so in terms of how much of a dose is reasonable, I've heard conversation that people sometimes take too much because of the delay time. So what is the delay time, and how much is a reasonable dose for a person of X weight? Mr. Vandry.
So the delay in time, typically you have an onset of effects after an edible of about 30 minutes. The peak effects happen about an hour and a half later and are sustained until about 3 hours after administration. Total duration of effects will last about 6 to 8 hours. That duration is determined by the dose. Now, exactly what a unit dose is an important question. In Colorado and in other states in the U.S., it's been established at 10 milligrams as a maximum dose, but lower doses are available as well. And it's going to be different from across individuals. Now, body weight isn't necessarily the important characteristic in terms of defining the effect of a dose. There are differences, there are sex differences in response to cannabis where females tend to be more sensitive to its effects than males. And so I don't think that there's enough data to determine what a real, what an appropriate unit dose is. In my lab, we've tested 10, 25, and 50 milligram doses in healthy adults. 10 milligrams produces a drug effect without a lot of impairment, but again, that's healthy young adults. And someone who's 65 or 70, that may be different. Someone who has a certain genetic predisposition where they metabolize the drug differently, that may be different. So again, my studies have been done with a total of 35 people. So it's hard for me to say exactly what that right dose is. Colorado uses 10 milligrams, and perhaps Mr. Vigil can talk about any issues that they've had with that unit dose in Colorado.
Before we go there, I want to ask you one more question. So one of the concerns we've heard about home grow is that there's no quality control. And so the potency can be different. And so if you're baking your brownies at home from your home grow, is there any experience that you have in the relative percentage of overdoses that we see or problems that we see with that?
Well, the issue there is you have to test the product that you're using to make the brownies or whatever it is that you're making. You have to know the potency in order to determine the dose that you're putting into the product. The other thing is you have to either make each individual brownie with a known amount of cannabis, or you have to have some kind of manufacturing process to ensure even distribution of the drug throughout a batch. You can't just throw cannabis in a brownie sheet, cut it up, and expect the same amount to be in each brownie. So, I mean, there are clear manufacturing practices that have to be put in place, testing practices. Now, home grow doesn't have any of that. You know, your home grow person is not going to be testing the potency of their plant material, testing each individual whatever it is that they make. So, you know, that's a crapshoot in terms of dosing. But
Absolutely, out of control.
My guess is that you're not going to roll out at the national level open retail sales of homegrown product. There need to be standards for manufacturing, production, and testing.
Would hope we wouldn't even allow it because of the hazard for the people in the home. Mr. Vigil, do you have any experience from the Colorado timeframe about people in the home grow? Because I know you did do that.
Right, we do allow a large amount of home grow, in particular for medical patients with an extended plant count. And unfortunately, our data is not able to distinguish whether a poison center call or an emergency department visit was related to homegrown or store-bought. I would certainly agree with Mr. Vandry that a regulated market is going to be safer from that standpoint. I think those individuals who are growing at home and making their own concentrates and edible products are very likely fairly experienced with it and less likely to get into problems with having too much. And then I think the last point that I would want to make is that it's the where is the product that more naive users using going to come from, and the more availability on a regulated market, I think the less likelihood you have of that product coming from a black market where it may be much less clear what's in it and potentially more dangerous. So.
And do you have statistics on any of the medical calls resulting from edibles or overdoses from edibles or anything from Colorado?
Yes. So we have seen an increase in poison center calls and emergency department visits related to marijuana following legalization and even somewhat prior with commercialization of medical marijuana. In the poison center calls, we are able to distinguish edible versus smokable. We can't do that right now in the emergency department visits. And for adults, about half, it's about equal numbers, edible and smokable products, which is actually disproportionate because more product is smoked in Colorado. So, so there is some increased concern with edibles.
Relatively from
right.
Edibles.
And then, of course, with children 0 to 8, it's the majority are edible products.
Thank you.
Is it possible that people are just more comfortable going to a hospital and saying they used cannabis when it's legal than it was beforehand? That maybe there's not an increase in actual overdoses, but simply, or like people taking too much, but simply an increase in people who are then going to go to a hospital and talk about it, whereas beforehand they could be criminally charged if they say I was using cannabis or somebody. Is that a possibility or something that you've looked at?
Is it okay to?
Sorry, I just thought I'd toss something in there, but
Time's up. We have to go to Mr. Davies.
Thank you. Mr. Vigil, I think one of the premises of our question is that if we don't legalize edibles, that people aren't going to be using them, manufacturing them, selling them, or distributing them. That's not the case, is it?
No.
No. So it's unlikely to me that whoever is producing those products now, particularly, let's say if there's criminal elements, it's unlikely that they're producing edibles in child-proof packages. Would you agree with that?
I agree, yes.
Yeah. So I take it, and the task force, the Canadian task force that looked at this recommended for a number of reasons that this government legalize edibles, concentrates, and other non-smokable products. Precisely for those reasons, I guess, and I think it's what you're saying, if I have your evidence correct, that it's better to regulate those products so that we can try to control dosage, child-proof packaging, single serving, stamped products to minimize the harm. Is that, do I have that correct?
Yes, that's correct.
And so Colorado, after we did hear evidence that Colorado initially legalized edibles, had some problems with it, understood the problems, came back and brought in further regulations on edibles. Is that correct?
That's correct, yes.
And how's it working now? Have they addressed some of those early concerns that originally happened from the legalization of edibles?
Well, in our most recent year of data for both poison center and emergency department visits, we have had a slight decline. So we hope that that's related to regulation and public education. We can't be certain
Right.
what the causes are, but we have seen a slight decrease and hope that that continues.
Mr. Larson, you sell products now. By the way, when we talk edibles, again, I think we're talking, all I hear is brownies and gummy bears and whatever. You described a range of products that this C45 would retain, would still be illegal. You mentioned creams, sprays, tinctures, patches, tablets. These are all forms of cannabis that C45 would continue to remain illegal. Can you tell us, in terms of the products that you sell, are these products unsafe? Are you finding, do consumers want them? What percentage of your users prefer these products as opposed to smoking cannabis?
It's probably about 60-40 like the extracts towards over buds. Of course, there's also smokable extracts as well, hash and shatter and things like that are also very beneficial, but are used in a smoked format. But I think people are more inclined to use edibles and that when they know it's a safe amount. People do not want to ingest vast amounts of THC and hallucinate. That's not what they're looking for, right? That's why people tend to smoke, is because it's easily titrated. You have the amount what you need, and then you're done. And with edibles, it can be a long wait. But edibles can be very useful for pain relief and for long-term, longer effects, especially medical users who don't want to be smoking constantly. They find the right dosage with an edible or a suppository, by the way, which is an incredible way of using cannabis, very low psychoactivity, good to get a high dose medicinally or otherwise. And when they talk about legalizing, we're going to sell it in liquor stores. I think you're going to sell suppositories and cannabis suppositories in liquor stores. We sell a cannabis cream called MJ Creams. There's no psychoactivity at all. You rub this cream on your skin. It's great for psoriasis and eczema, great for topical pain relief. This could be put on a baby or on anybody of any age. I don't see any reason to have an age limit on a cannabis-infused cream that has no psychoactivity. And so I think we got to broaden the range of things that we're looking at. And at our dispensary, it is very rare for somebody to come back and say, I took too much of the edible and I had a bad experience. We tell people, like doctors do with prescription drugs, start off with a lower dose. If that doesn't work your way up to a higher dose. Try a little bit more at a time until you reach the point where you're getting the effect that you want, and then you've got enough. And if the government's not going to allow edibles and extracts, we're going to continue to sell them through dispensaries, through the black market. They'll be unregulated, but we do our best to make sure these products are safe and labeled, and given the constraints of legality, we do our best. And I think we do a pretty good job already. And a lot of the fear-mongering around edibles and extracts simply hasn't materialized in Vancouver or Toronto or other cities that have dozens and dozens of dispensaries. We're not really seeing a lot of problems coming out of this, and that's an unregulated, self-regulated market. If we have some proper rules in place, problems will be minimal.
I think Mr. Ayub put it well. He talked about we want to limit the use in uncontrolled fashion of products of unknown provenance, and I think. Sorry, Mr. Vandry, you referred to it as a crapshoot. I mean, would we prefer to keep this legal and have Canadians cooking their own edibles in their own kitchen? I mean, without any control over the concentration of the THC, for instance, in a tray of brownies. Like, I fail to understand how that's a preferable public policy approach to edibles than putting it into the hands of tightly regulated market and sold in retail fashion by people who can be advising the customers, as you just point out.
People are going to make their own edibles anyways, even in a fully legalized market. People enjoy making their own edibles. It's fun. It's like growing your own cannabis. It's an enjoyable activity to grow a plant in your garden, then harvest it and use it. People like that. Tomatoes or zucchini or cannabis, people enjoy that. And people are going to make their own edibles even under legalization. Most won't. They'll go buy it in a store because that's easier. But people brew their own wine, they make their own beer, and there's no somebody coming in saying, we're going to check the alcohol level of that beer and make sure it's at the right level. That doesn't happen. And so I think a lot of these concerns are overblown, but I would prefer to see a legally regulated market that's open and accessible for regular Canadians to enter, like it is with other products. But until that day happens, edibles will continue to be available. Extracts will continue to be available. We sell pure CBD tincture and pure isolate of THC and CBD at dispensaries. We're years and years ahead of where the legal system is going to be, and you got a lot of catching up to do.
C45 legalizes dry flower and oil, but I'm not quite sure what that oil will be used for. So what's your understanding, Mr. Larson, of the oil that will be legal under this bill? How will people use it, and can it be vaped?
My understanding is this legislation is only, it's 3% THC is the limit that licensed producers are able to make for their extracts, and I think this is the same thing. So I think there is going to be a lot of problems with this. Vaping is very positive too, by the way. If you have concerns with people smoking, and those concerns are often overblown, but vaporizing eliminates most of those concerns. There's no particulates. It's purely just the active ingredients steamed off the plant. You inhale them. It combines the benefits of smoking, which is a quick action and being able to get your dosage precise without having any smoke involved. So I think vaping should actually be encouraged and be considered a better way of using it. And I really feel that under real legalization, which would mean that Canadian farmers are able to grow high THC cannabis by the thousands of hectares, that is what we're working towards. And when that comes, smoking buds will be less popular, but you'll be able to make extracts of pure THC or CBD or CBG or CBN or the other cannabinoids in any combination you want, and vaporize or use those in a way that I think will be revolutionary and much, much safer than what we're doing now.
Much time is up. Now we go to Ms. Sidhu.
Thank you, Chair. Thank you all being here. Lots of new learning. Never heard about that before. My question to Dr. Wendry. In your recent study on edible products and labeling, you said only 17% of edible products had accurate THC content listed, while 60% were overlabeled. What makes accurate labeling of THC content in edible products so challenging? Is it a result of lack of regulation or producers not having the resources of accurately providing that labeling?
I think it's a combination of the manufacturing practices not being careful enough to put a precise amount of product in each package or in each dose, as well as difficulties in the lack of standards for testing those products.
Thank you. And you said education. Who should be or who shouldn't be using? You also mentioned the cardiovascular stress on the cardiovascular patients. So high THC or low THC mean something, or what type of the education tool need to be providing?
Well, I mean, I think broad education needs to be disseminated regardless. But in terms of THC content, you have to define a dose, and the dose depends on the individual and the reason they're using it. So, right now we're talking about non-medical use. So you have people looking to get intoxicated is my presumption here. So you're likely talking about doses that are higher than what would potentially be needed for medicinal uses. But at what level that is still kind of up for debate and in need of more research. So as any good researcher will tell you, we need more research, but the fact of the matter is there are very few controlled studies of edible dosing with cannabis. And what we've found in our laboratory is we can give the same dose to 35 different people, and half of them tolerate it very well, and the other half get severely impaired. We have some individuals vomit after a really high dose. They consistently get sick when we vary the route of administration. So it doesn't matter as much if they smoke it, vape it, or eat it. At high doses of cannabis, they get the same types of effects, and some people are more sensitive to those effects than others. But again, drawing a parallel with other things like alcohol, you can say the same thing. Some individuals can drink 6 beers and be fine, and others would be throwing up in the corner. So, how you manage that and how you factor that into regulation is you want a unit dose that's low enough that's not going to make most people sick. And let the people that can tolerate higher doses consume more, but do so in a manner that that they know what to expect, and it's consistent across episodes of use. So when you go to a liquor store and you buy a beer, the beer isn't 5% alcohol one time and 10% the next if you're buying the same beer. Now, there's a variety and differences in beer, but it's labeled with the alcohol content on there. And you need a similar setup for cannabis.
And I heard the Colorado using 10 milligram. Is there any way to assure the THC doses are evenly distributed?
So again, Colorado has their system for evaluating and testing those products, and they put the ceiling on there. I'll let Mr. Vigil talk about that process, but as long as you get consistent dosing of 10 milligrams there, and we did not do our testing study in Colorado. It was conducted in California and in Washington State, and that was also conducted only in medicinal or medical cannabis dispensaries, not non-medical retail. So, that was also done several years ago. I don't know where things stand now, but I think that there needs to be a quality control regulatory agency in place to monitor this stuff and to make sure that things are accurately labeled and that the dose is appropriate and all of that. So, quality control is imperative.
Thank you. And my next question to Mr. Vigil. July 2016, Denver Post published a report on 5-fold increase of children's admission to hospital due to ingestion of edibles. So how we can protect our kids? What are the challenges with the packaging? Or we should tell that the kids don't attract those packaging. And what about the food safety? Do you think other jurisdictions combine edible production and food inspector in regulations?
So first concerning children and edibles, to answer an earlier question, the hospital data is a mix, I think, of causes. One is likely some increased exposure, but there's also very likely an increase in willingness to admit to exposure or use. And so, of course, we've mentioned childproof packaging. That's very important, as well as education for parents that this is not okay to leave out, and it can be dangerous if children are exposed. Keep it in the childproof packaging once you get home, and then for appeal. Again, that's not something that I can quickly, just give you a very clear answer on. I think it's very important to come up with good guidelines there, balancing the fact that people want these products, people want a variety of these products, and if restrictions are too limiting, then you'll see products that are outside of the regulated system. So it's a tough balance, and I don't have the clear answer for you on that. Can you remind me your last part of the question?
The food inspector.
Oh, yes. So I think that varies from state to state. In Colorado, any edible production falls under the general food inspection that they do for kitchens that produce any products that go on the shelves. So they are subject to the food safety inspections. In addition, all marijuana products are required to be tested for content of THC, CBD, other cannabinoids, and for any microbial contamination, pesticides, and residual solvents.
Time's up. That completes our first round, and now we go to our 5-minute round, starting with Dr. Carey.
Thank you very much, Mr. Chair, and again, a great panel. Thank you all for being here. I wanted to get right to my questions because we do know that this is rolling out in 288 days. There's not a lot of time, and I think it's a really missed opportunity. We had Colorado here earlier saying that really before you get this rolled out, you should be having your public education program in place, really good factual information. We don't see that there. Data collection should be in place, treatment research, things along the lines. And for the last 2 years, really, the Liberal government hasn't really been doing anything. And again, we're jamming all this into 1 week. And I just want to particularly thank Mr. Larson for being here. I think you're the first person we've had that's on the ground actually integrating and talking to the public about this very important issue and transformative piece of legislation anyway. So I'm going to throw out all my questions, and I'm going to throw them out all to you because I only have 5 minutes. And I've got, I think, 4 main questions I'd like you to answer. First of all, there's a lot of questions about cannabis by parents, educators. What do you do for your clientele for education? And when they have questions for you, do you have scientific, basic pamphlets, things along those lines? Where do you get your product? How do you assure quality control? And I'm curious, what would you say a good age cutoff would be? And I'm not talking for medicinal use, I'm talking just for recreational use. So those are 4 questions. I probably only have 4 minutes left for my time. Would you be able to comment on those 4 questions, please?
Can you give them to me one at a time again so I don't forget all the questions?
First of all, what do you do for your clientele as far as education is concerned?
Okay, I'll just take, so for that one, it depends what they're coming in for, you know, but if we try to guide them to the right product, sometimes people come in, they're experienced with cannabis, they've used it a lot, they're just looking for a particular product, they don't need a lot of guidance. We also get senior citizens who come in, say, I haven't used cannabis in 50 years, my grandson says it'll be good for my arthritis or something. We don't typically stick a joint in their face, we normally give them edible products or CBD-based products or creams or tinctures or things that are going to have less psychoactivity and more of a medicinal effect. So we try to guide them based on what they're looking for and what their experience is. And like other things, we always tell them, start off with a small dose and then work your way up until you get to the point where you're getting the benefits or whatever it is that you're seeking. So that's the kind of guidance we try to give.
It's like written type of guidance?
Mostly oral. We have some written information and pamphlets and things like that too. It depends, but a lot of it's just personal conversations with people and a one-on-one discussion, like you'd have with a pharmacist or a doctor looking for guidance on cannabis. Sometimes they have a doctor's advice going in, but Canadian doctors don't really know a lot about cannabis or the endocannabinoid system, which is part of our body system that the cannabis interacts with. So
do your
mostly
employees have training?
Yeah, we try to give them training. It varies, but we make sure we talk to everybody. And if they can't answer the question, we make sure we have somebody there who can.
Okay. Second question, where do you get your product?
It's from the illegal market by definition. We have no choice. There's no legal place for us to get it. Some of them are people that have been growing cannabis for years. Some of them are licensed under the medical program to grow their own cannabis, and they might have some extra that they Health Canada wants you to destroy it or just dispose of it if you have too much. Well, they dispose of it by selling it to a dispensary. There are many people that make edibles and extracts and things at home, and a lot of them don't meet our standards. The majority of what gets brought to us we reject because it's not the right quality or doesn't meet our needs. But it comes from the black market by definition. But we do our best to make that the lightest shade of gray it can possibly be.
2 more questions. Again, you were talking, you reject a lot of it. What do you do for quality control? And then a really important question I'd like your opinion on age. Okay, for recreational use, what do you think a cutoff age would be?
Sure. Well, for quality control, it's a challenge because we're not able to access Health Canada certified labs. They will test our cannabis if we have someone who's legally allowed to possess, send it in. But if I put on my website, this lab tested our cannabis and here's the results, Health Canada will call that lab and say, you're going to lose your license. You can't test dispensary cannabis. So I can put out whatever results I want, but only I know if I'm telling the truth or not. I can't tell you which lab did the results. And so that leaves us in a very difficult position. We also do our own study. The first thing we do when we get raw buds into our dispensary is look at them under a microscope, and I would encourage members to do the same thing. You can see a lot in terms of mold, mildew, the quality of the trichomes, the resinous glands, if they're there, if they're ripe. That's just the first step. If most of it doesn't pass that, then we will do a taste test on it. Someone will smoke a little bit of it. You can tell if there's chemical contaminants, if it's been over-fertilized. Then we'll send it to a lab if we can, and then after that, if it meets all the standards, we'll put it on our shelves. And with edibles and other products, we've actually found with edibles, we typically supply our producers with our cannabis or with an extract. So we know they're getting a standardized amount, we know where it comes from, and we can give them the same strain or a very similar product to help them standardize what they're making. And a lot of edible makers don't use raw buds. They will use an extract. So they can make something of a known potency and then put that into their product, helping them to standardize the dosages. As to age limits, if I was in charge of the world, I'd make it 16 years old to buy cannabis from a legal place. That being said, I'm happy with the limit being the same as alcohol. That's not a problem. But one thing I see lacking in this legislation is there's no allowance for a parent to give cannabis to their child. You can give alcohol to your children at pretty much any age. A lot of young kids have a half glass of wine with dinner. We don't criminalize those parents. But if that parent were to give their children cannabis or share a joint with their 17-year-old child or something, they could be criminalized and face some serious repercussions. So that, I think, is an issue. To me, the use of cannabis by youth is a family issue and should be determined at the family level. And this legislation doesn't allow for any sort of family decisions on that, which I think is really a big problem.
Great help.
Thank you very much. Thank you for the questions. Now we go to Mr. Carey. Mr. Oliver. We'll get it.
Thank you, and thank you very much for your testimony. This is our last day of a full week of testimony on this bill, and from people in the industry and consumer, well, from different walks of life on it. By the end of this week, we'll have heard from 100 or more different witnesses. So it's been quite excellent. If we'd done this in our normal process, we would have been at it for about 3 months. This has really allowed us to delve deeply into the issues, and it's allowed us to compare and contrast testimony that's often difficult to do when you have it stretched out so much. So edibles is the one that I think when we come to clause by clause, it'll be one that we're really reviewing. I think edibles right now are excluded from the legal definition of marijuana, so they wouldn't be permitted. So I'm just going to give you what I've heard in terms of the pros for including and the cons for excluding, and just ask if there's anything that I'm missing in the analysis of it. So on the positive for including edibles, I've heard public health, that otherwise we're encouraging smoking and ingesting of cannabis through smoking. Edibles give you a healthier alternative for ingesting cannabis. Second, I've heard is that if we don't bring it into the legal market, then it really does allow the black market or the whatever market to really continue and grow in that particular market space. And I think Mr. Larson spoke to that quite pointedly. Those are the two reasons I've heard for inclusion. On the reasons for excluding, I've heard this is a social change, a social experiment for Canada. Go slow, see how what you've got is working before you push on to greater market. Kids' access seems to be, and kids' accidental ingestion seems to be higher with edibles than with products that you need to smoke. It's hard to regulate and hard to inspect, and there's more complexity in edibles than in the sort of more raw plant. Although with the work in Colorado that they've done, I think there's some pretty good and easily adapted regulations that are in place. And the fourth point has been, what the heck? It's easy to make at home. If people want the edibles, they can go get them. So those are the sort of the pros and the cons. Is there anything, I kind of rambled through them quickly, is there anything else you think I should know as we're thinking about the pros and cons of edibles? Anything you'd add to those lists?
Excuse me. Just a very slight clarification on your first point. With edibles, you do avoid any of the possible pulmonary effects of smoking. There is one concern that I think is a little bit greater with edibles, and that is driving. And the fact that with an inhaled product, you can quickly recognize what the effects are and give yourself time to overcome those effects or to get back to a safe place to be driving. But with edibles, it's possible that you would not realize that you haven't felt the full effects and potentially get behind the wheel. So that's...
Duration and speed of the digestion is different.
Right. It looks like Mr. Vandry has something.
Yes. Just go ahead.
So in the laboratory studies that we've done where we acutely dose people with different routes of administration, I think it's important to note that when we give people smoked cannabis versus edible cannabis, the magnitude of drug effects and the types of effects are identical. It's really just the differences in the time course of the effects. So I have not seen any evidence that eating it is more dangerous than smoking it. Nor I would disagree in the argument that you can't perceive the intoxication when you eat it. People are very aware that they're intoxicated. The challenge is in detecting edible cannabis in a driver who's impaired versus not, but that's a problem across the board, independent of route of administration, but is a little bit different in edibles in that you get lower blood concentrations.
So just quickly, would you recommend, one by all three of you, would you recommend Canada include edibles in there allowable, or would you support the slower pace that's been proposed in the legislation? Just if you want each to address it, Mr. Larson.
I support adding edibles and also other extracts as well, hashish and all those kind of things, both smokable and edible. That's got to be part of legalization. You're really only allowing the buds is missing out on a large portion of this, and yeah, so I absolutely think this should be included, and I don't. This go slow thing, we've been going slow since 1971. It's time to act and not to go slow.
Okay. Mr. Vigil?
I think ultimately they should be included, but it's very important to get it right, and if that takes some time and some learning from the smoked market, then I would be in agreement with that.
And sir, Dr.
Yeah, sure. My personal recommendation would be in favor of regulation and quality control over all products. I think that's in the greater public good, rather than just allowing one version and then continuing to have black market product available that you don't know what's in it. I think that makes the most sense.
Thank you.
Thank you very much. Now we go to Mr. Weber.
Thank you, Mr. Chair, and thank you to the panel. My first question to Dr. Vandry. As a cannabis researcher, you mentioned that you evaluate label information on products to determine whether they're accurate or not. That is correct? In Colorado and Washington State, the licensed producers, have you found that their labeling is quite accurate?
So again, I've not conducted any testing in Colorado. The state of Colorado does their own testing, and maybe Mr. Vigil could talk about the outcomes of what the test is that they've done. The testing that I've done in Washington has been limited to medical cannabis dispensaries, which at the time were distinct from non-medical testing dispensaries. I believe at that time that the regulations over products being sold in medical cannabis dispensaries were not very rigorous, and the testing that we found there indicated that most of the products were inaccurately labeled.
Interesting. Mr. Virgil, accidental exposure that you mentioned in your remarks about incidences, do you see a lot of that occurring in your neck of the woods?
So the term "a lot" is I think important to comment on because we have seen an increase, as I mentioned, in both poison center calls and emergency department visits relative to other reasons that people are making those calls.
I'm referring specifically to accidental exposure.
Okay, right. So
children.
Right. So let's focus on the 0 to 8 year age group for accidental exposure, and so poison center calls, about 1 in 10,000 children at the peak in Colorado. There was a call related to marijuana. I'll also mention that that outcomes were not, there weren't severe outcomes related to that. It was the majority of those were just some concern.
Through ingestion of an edible?
Right. Well, so some portion of those were smokable. Children can pick up a bud and put it in their mouth as well. Sure. The majority were edibles.
So your thoughts on home cultivation, 4 plants per household, just your thoughts on that. Do you think that should be allowed?
I think it's going to happen whether you allow it or not. And so again, bringing something into the regulated market is probably better than having it unregulated. In Colorado, for home grows, the real problem that we've run into is extended plant counts and the ability for a caretaker in the medical realm to grow for multiple people, so that you have these very large grows that are, on paper are legal, but are really contributing to black market and diversion.
Mr. Larson, I don't know where BC is going to go with their distribution decisions, whether it's dispensaries or LCBO. I don't even know if they have a liquor control board in BC or not, but you've heard where they're going here in Ontario, and they've already started to shut down some dispensaries and arrest the individuals inside. And it's occurred in in your environment as well, and I'm certain. If the BC government determines that you cannot do this, you indicate that you will continue to have customers shop with you anyways, and I just question that. You will not be able to allow, I don't know, do you have a storefront right now? I have no idea about dispensaries, Mr. Larson, because I've never been in one, and perhaps I'll come and visit yours just to learn some more about it, but I just don't know how you will continue to operate if your government in BC decides to have it in a more controlled environment.
Well, that's an interesting point. Let's make it clear. They are trying their hardest in Ontario to get rid of dispensaries already. They've been trying for a while, and they are failing miserably. And there are dispensaries in every major city in Canada and most minor ones now, just like bong shops. And I told you, bongs are illegal too. And we got raided. People went to jail over bongs big time in the 1990s. The problem that you have enforcing these laws is that the courts are not willing to give us severe penalties. And we have an overburdened justice system. They laid hundreds of charges, dozens of charges in Toronto, and they've only kept a handful of them. On the cannabis culture raid, when they went after Mark and Jody Emery and a few others, not a single one of their suppliers was arrested or charged. They're selling cannabis from many companies who have labeling, websites, phone numbers. You can call them. People sell extracts. They could easily, if they wanted to spend the time and effort, go after these people. Then they're not, because the police and our justice system are not able to handle this kind of mass civil disobedience campaign that we're engaging in. We like the phrase overgrowing the government. There's too many of us willing to go to the end on this that you can't keep up. And do you really want to put me in jail for selling cannabis? Is that where you think I belong? Because I'm going to keep doing it, and that's going to be the only option. I'm going to keep giving away seeds. I'm going to keep using cannabis.
Do you charge tax on your products? GST, PST?
Some dispensaries do, some don't. We don't right now, but we're on the transitioning towards that, and I would be happy to do that. And we're happy to follow reasonable regulations. I'm not an anarchist who doesn't want to follow the rules, but if the rules are saying I can't operate and I can't exist, then of course we're gonna break those rules.
Paying taxes? Do you file?
Oh yeah, we file taxes. All of our staff are registered. We do all the deductions and all those kind of things as best we can. I can't speak for every dispensary. There are hundreds across Canada. Some operate in many different ways than others. But you can't stop us. You don't have the capability in the policing and the courts to deal with what we're doing. That's why it's been so successful, and we're going to keep doing that. So the rules have to take that into consideration, that there is already a vibrant and dynamic cannabis industry, and we are committed to what we're doing, and that needs to be incorporated into legalization, or else you've got to find a way to compete with us and produce better products at a lower price with a higher selection and higher quality. If you do that, we'll go out of business, and I would consider that a victory on my end. If my dispensary can't operate because there's better, cheaper, higher quality cannabis available from a legal source, then I won. I don't need to run a dispensary. I just want cannabis to be legal and available, and so that's how I see it. But until that day comes, as long as my dispensary can provide products that aren't legally available that people want to get, we'll keep doing it.
Well, now I have to stop you. So, Dr. Eyolfson, it's your turn.
Right, thank you very much. I have the disadvantage of being down the list, so that a lot of the questions I've thought of have been asked, so I might have to do basically expanding on some of the stuff we've already talked about. So there may be a bit of repetition. We had some testimony yesterday from some different international experts, and in particular from Great Britain. They're watching us quite closely. And again, we're getting competing testimony from different corners about how to go ahead with this. One of the things pointed out is that this is a fairly new thing we're doing. Only one nation on earth has ever legalized this on a national level. We're number 2. And we've heard a lot of evidence saying that we should take a cautious, stepwise approach. And we are committed to regulating edibles. We just haven't started with that yet. And we understand that Colorado had some challenges. So, Mr. Vigil, I understand you had challenges with edibles in the beginning. Could you expand on some of the problems you had with edibles at the initial rollout, and whether you agree it's a good idea for us to be rolling this out more gradually?
Well, Really, our primary concern initially was seeing an increase in calls to the Poison Center and emergency department visits, and in particular among younger age groups. We had a few cases of overconsumption leading to accidents, and so that was the impetus to try to increase regulation. As to the delay in rolling it out, 288 days, was that it? That doesn't seem like enough time for you to get all of the edible regulations together. I'm not a legislator, so I don't know, but I guess I would recommend erring on the side of giving it more time to not only to work on the legislation, but also for other jurisdictions like Colorado and the other states in the United States that have legalized to continue to learn more. You know, I mentioned that we've seen for 1 year some decrease in those numbers. We'd like to see, you know, what happens with the data that's coming up next spring, and the more of that information that you have, I think the better decisions that you can make.
Thank you very much. Dr. Landry, you talked about packaging yesterday. You want to make it non-appealing and child-proof for edibles, which I would agree. Now, we had a discussion yesterday regarding plain packaging and some of the precedents set in the tobacco industry, and particularly the success that Australia has had with decreasing smoking. Despite the misinformation from the tobacco industry about this, it does appear to have cut down smoking rates. So would you recommend, not just in edibles, but in basically all cannabis products, plain packaging, the way that we're going to be moving, the way Australia has and the way we're going to be moving with tobacco?
I think it would be very wise to learn from the lessons of tobacco and alcohol regulation for cannabis, very clearly. So, I mean, recognizing the harms with overconsumption, recognizing the harms with advertising, it's all relevant here, and it seems silly to recreate the wheel for cannabis, but rather to learn and to use alcohol and tobacco regulation as a model for how to best roll out cannabis. And then also to look at what's currently being done in Uruguay or in the states in the U.S. that have already legalized non-medicinal use. So you have models there, you have regulations on the books in those states and in Uruguay. Look at what they've done, talk to them about what their limitations are. If they could go back and change it, what would they do? And then potentially you could come up with a maybe slightly improved model. You know, the key here is that you really need to establish and you have to have confidence in what your unit dose is going to be and how you're going to test and do the quality control. I think if you solve those issues, then the rest of it should kind of fall in place.
Thank you very much.
Mr. Davies, last question.
Mr. Davies?
Mr. Davies, you're up.
Thank you. Mr. Vigil, how long has Colorado been regulating edibles?
Well, excuse me, it was part of our initial legalization, passed in 2012, and dispensary sales were allowed to begin in January 1st, 2014.
Okay, and it seems that everything I've heard about the experience of legalization of cannabis, whether it's the Netherlands when they did it, or Colorado, Washington, Alaska, is that you legalize, there is a spike in pretty much everything, and then it levels off, and then things drop. Am I correct in that's sort of what happened in terms of the accidental ingestion? Legalize, I would presume more people tried edibles because they're legal. Some people had experiences with it, more poison control calls, leveled off, and now you're seeing a drop. Is that correct?
We're seeing a slight decline from the peak, but it still remains higher than it was
before.
previous. Right.
Yeah.
And by the way, you say everything, but in terms of use, we have not seen increases in youth or adult use.
We heard evidence from Colorado that there was an increase immediately after legalization, and then it started to drop after that. Am I wrong about that?
Not from our excuse me, our primary data sources,
Okay.
no.
Now, in terms of regulations, you said we should go slow. Could we not just adopt Colorado's regulations on edibles? Like, where are the gaping holes in Colorado that we don't know?
Well, we don't think we've perfected it,
No.
you know, and there are limitations within the system. So, for example, our laboratory proficiency testing is. We've had challenges, and a lot of these come from the federal limitations that are things. Particularly pesticides that for all other products are regulated at a federal level, and those resources aren't available to us for cannabis. So there's just a variety of places that we would not say that our system is perfect and adoptable.
No, well, nothing's perfect. We're in politics. But, you know, in terms of getting the major things right, the single servings, the child-proof containers, the no marketing to children, the stamped products, the, you know, some form of, like, regulations about potency and dosage, I presume those are done, aren't they, in Colorado?
Yes.
Yeah. So what are we waiting for? Like, what else don't we know about the regulatory framework in Canada that would make it preferable to leave it totally unregulated right now with none of those things while we wait to learn what about the regulations? I'm puzzled.
You could certainly, excuse me, you could certainly make a reasonable argument to regulate and perhaps be more restrictive at first and allow more later. I think the danger is in looser restrictions that then you would later see that you wanted to tighten up. So I would not unwaveringly argue that you have to wait. I would just say that if you can get very solid regulations in place and do it quickly, then
That's my
it
question.
should be fine.
Does
Yes.
Colorado have solid regulations, or they don't have solid regulations?
I think we, excuse me, I think we have solid regulations. I think we have some room for improvement still.
Sure.
But.
Mr. Larson, I think we've heard lots of evidence about the damage criminalization has done to Canadians, and many of the harms associated with cannabis are, I think, directly related to the criminalization of cannabis, not cannabis itself. Now, C-45, I think we all would acknowledge, makes progress. But it retains a criminalized approach. You know, it's criminal sanctions for possession over 30 grams, criminal sanctions for growing over 4 plants over 100 centimeters, criminal sanctions over selling, punishable by penalties up to 14 years. If criminalization has failed and caused harm, won't C-45 continue to do that, at least to some degree?
Absolutely. It's got more criminalization in this bill than we have already in some areas. And that 14-year penalty also means there's no conditional discharges available as well, which I think is a big concern. And, you know, speaking as a member of the cannabis movement, we don't really need the government's help in getting high-quality cannabis products. We just want the government to stop arresting people. And that really should be the focus of this legislation. It's shameful to me that we haven't decriminalized cannabis possession already, and this wasn't a big priority and hasn't happened yet, but that is the flaw in this legislation, and it's treating cannabis much more severely than alcohol is treated. And yet, by any measure, cannabis is safer than alcohol, and I think that everybody that's testified would agree with that idea. And so if we're going to restrict cannabis more than alcohol, that's driving people towards alcohol. If we're going to restrict cannabis advertising and packaging and all these things more than alcohol is, that means we're saying we want people to drink alcohol instead of using cannabis. And I think it should be the other way around. And the idea that we've made mistakes with alcohol and it's too available, so we're going to tighten up with cannabis, that's absolutely backwards. Cannabis is safer and should be treated like that. And to continue to criminalize people because of the cannabis they have on them or any of this is the wrong way to go entirely.
Thank you.
That completes our normal round of questioning, and so unless there's any inquiry, or did you want to inquire?
Yes, Chair, I'd like to move unanimous consent to have another round because we have about half an hour left.
Okay, do we have unanimous consent for another round? We have unanimous consent. Okay, Mr. McKinnon.
Thank you, Chair. Mr. Larson, I'd like to find the low-hanging fruit, if you will, about edibles. So, in your shop and in your experience with other shops, what do people want? What are the most popular products? So perhaps your top 3 sellers.
It really depends on what they're looking for, you know? Some people just want to feel good and get high, and some people have a medicinal need, or they've got pain, or they've got cancer or systemic ailment, and they need a different kind of treatment. So it really depends. But edibles are less used recreationally because of the fact they can be stronger, and because of the difficulty of titrating the dose. Most people that I know that use cannabis smoke it primarily. Edibles and extract, and also we use extracts as well, something that I keep trying to bring up that isn't part of this conversation. Things like shatter or hash or other forms of inhalable cannabis that are made, those are also very popular as well. And they allow you to smoke less cannabis to get the same effect. If we're concerned about smoking, you have one hit off one thing, or you got to smoke a whole bunch of something else. Probably the stronger one is the safer one in that regard.
If we're trying to talk about edibles here. I mean,
right. Okay. So with edibles, I mean, so the question is, what do people seek, or why are they taking edibles?
No, what are the most popular?
Most popular edibles are things that taste good. People like treats. They don't really want to take capsules or things if they can have something that's yummy. We definitely sell things that are more delicious, more than things that are less tasty. Absolutely. And that's just human nature.
Really come up with a legislation that says, well, let's regulate treats. So we need something a little more specific, if you can.
You can put cannabis into all kinds of food products, right? Some people like to buy infused butter so they can add it to their own food and put it on toast or put it into foods themselves.
Do you sell a lot of infused butter?
Yeah, we sell infused butter, we sell infused oils, and we sell different kinds of edible products. We sell savory things as well, but normally they're kind of snacky type foods.
What are your top 3 sellers of?
Sorry, say that again?
What are your top 3 products, edible products that you sell?
Think about that a little bit. We sell some drops that are very popular. It's not really an edible, but it's a drop that's made with infused hemp seed oil. It's like an edible. I would say that cookies are incredibly popular, and people like different kinds of cookies. And we sell a fair amount of CBD products as well that have very low or no psychoactivity but have medicinal benefit. And CBD edibles are becoming more and more popular as well.
Okay. Home grow. So one of the concerns with home grow, personal cultivation, I guess, is potential for diversion to the illegal market. Do you see that the regulations around the limitations on number of plants and so forth will, firstly, are they necessary to prevent that diversion, and will they in fact prevent that diversion?
Well, it depends what you mean by diversion. It's hard to sell the cannabis you're going to get from 4 1-meter tall plants. You're not going to get that much. But certainly sharing it with your friends, I think that'll happen. And if you really want to stop people from diverting cannabis, make it cheap. The only reason people grow and sell cannabis is because it's very expensive and very profitable. When this plant is worth $5 to $10 a gram, doesn't matter if it's legal or not. If I can grow a plant in my home that's worth $1,000 and then sell it, people are going to do that. The way to stop diversion and to get people to not be doing that is simply to make cannabis much more affordable, make the price lower to where it should be for a natural product. It's the only plant that we sell by the gram and not by the pound. And so I would like to see cannabis be $1 a gram. gram or something like that, which is still an incredibly high price for a little bit of plant matter, but that would eliminate the vast majority of diversion if there's no profit in it. But as long as, if legal cannabis maintains the same price structure as illegal cannabis, then the illegal market will continue, because that's just how it's going to be, because of the profitability. And so that's the real question. But I think that most people growing 4 plants at home are going to grow it for themselves or to share with their friends and family, and they're not going to be selling it because the profit margin isn't that great. For a few plants, you're going to want to have a bigger grow to really satisfy the underground market. And I think that's where most of the underground market will remain.
So let's go back to packaging, if I have time. So the edible products that you sell, what's the packaging like? Are these like home cooked products, or are they manufactured in some way?
It's sort of halfway between those things. You know, we strive for a professional product, but it's very difficult to access mainstream bakeries or places to make products if you're going to be making cannabis products. So as a result, we are forced into this kind of area where they're made at home or in a small scale. We use childproof packaging. We do our best to label our products with an accurate level of the cannabinoids that are in there, although that's a challenge, both simply because of the testing available and because dispensaries can't fully access that kind of testing.
What do you think of?
Okay, now we go to Dr. Carey.
Thank you very much, Mr. Chair. I'll be sharing my time with my colleague. But again, Mr. Larson, I'd like to direct the question to you. Again, thanks for being here. And obviously, you're very knowledgeable. And I would think your input and your knowledge about how things are today in Canada on the ground is very important. And I'm curious, as far as yourself or anybody involved in the production distribution field, was anyone you know consulted in reference to the rollout of this as a public policy or the drafting of this bill? Was there any consultation done by the government with anybody that you would know?
No, you mean the task force that was initially put together and that kind of thing? I wasn't, I mean, some people were, I wasn't invited to speak at that task force. Some of my allies or friends will, but I found that just sort of regular cannabis users aren't really in part of this discussion so much. I mean, I use cannabis every day. I used cannabis this morning before I came here, and I'm going to use some afterwards when we're done. And I think that voice is perhaps missing, the typical users. But no, I haven't seen a lot of consultation among the cannabis community in that way.
Thank you. I'd like to move that pursuant to Standing Order 1082, a minimum of 6 meetings be added to the committee's current study of Bill C-45, an act respecting cannabis, and to amend the Controlled Drugs and Substances Act, the Criminal Code, and other acts, and that these meetings be scheduled following the appearance of the Minister of Health, Justice, and Public Safety on the week of September 18th.
Dr. Elson.
I move that the debate be now adjourned.
Okay, we have a vote on that now, so on that issue. So, pardon?
The adjourn should be voted on right away.
Yeah. Okay, so we're going to have a vote on that, on Dr. Elfson's motion. So all in favor of adjournment on that issue, on that debate? All in favor? Pardon? A recorded vote? Okay, all those in favor of the motion?
In favor of the motion?
Of the motion to end debate?
Adjourn debate.
Adjourn debate. Yeah. So I have to, you have to signal your vote. So are you recording this?
I think it was a recorded vote, so I'm just going to say the name.
It's a recorded vote, yeah.
Monsieur Ayoub?
Mr. Ayoub.
Dr. Yelson?
Yes.
Mr. McKinnon?
Yes.
Mr. Oliver?
Yes.
Ms. Sidhu? Dr. Carey? Ms. Gladue? Mr. Weber? Mr. Davies?
No.
Yes pour 5, nays contre 4.
All right, motion is succeeded, and so we've adjourned the debate on that issue. So we go back to the regular, you have a minute and a half to go.
Good. All right, then I want to talk about childproof packaging. So will childproof packaging keep 12 to 17-year-olds from being able to open those packages, Mr. Vigil?
Absolutely not. No.
All right, so it's absolutely no protection at all. So what kind of recommendations would you have? We're trying with this bill to keep cannabis out of the hands of young children. And so the concern is when people bring edibles into the house, that they are attractive. I mean, they're candies or cookies or suckers. They're all the things that kids would want to have. Should they be locking them up, in light of the overdose situations that we saw in Colorado?
Yes, I think they should. As far as regulation, we don't regulate to that degree for products that people bring home. There is regulation that for home grows they have to be locked in a locked area if anyone under 21 is in the home. And really within that age range, it becomes much more important, the education for parents and others who care for children or have children around, that if they're using these products, that they should keep them locked up. And then, of course, education for children about possible dangers of using them.
Very good. How much time do I have?
28 seconds.
All right. Well, then I'll just end with a comment. And Mr. Larson, with all due respect, I find your lack of respect for the rule of law in this country disturbing, because it's clear that it doesn't matter what we come with in C-45. You're going to do whatever you like and obey whichever laws you like, and I don't personally approve of that. Thank you.
I believe in the child rights.
Okay, that's time's up. Now we go to Mr. Davies.
Thank you. Ms. Larson, I want to thank you for being here. You're the only dispensary owner that we have heard from out of all those witnesses we heard this week. You're the only person involved in the actual edible market who actually is familiar with the products on a day-to-day commercial basis, and I think it's very valuable to have your perspective here. I guess my first question to you, Mr. Larson, is that if we don't legalize edibles, there will be no way to test the THC levels, the CBD levels, all the other different compounds. So products will still be consumed by Canadians, it appears to me, who will have no real assurance of the content, since as you said, you can't send these products to accredited Health Canada labs to make sure that the products are what they say they are. Am I missing something there?
No, that's all accurate.
Okay. Now, in terms of, you mentioned the issue of decriminalizing now. Have you faced any legal charges or any people that are patronizing your store? Have they faced any criminal enforcement actions against them? And if not, how has the present criminalized environment affected you and the customers who come into your store?
Well, Vancouver's had a more progressive attitude towards cannabis for quite a while, and so possession arrests are very, very rare in Vancouver compared to other jurisdictions. You'll be hearing from the Hillary Black, who started Vancouver's first dispensary. That was about 20 years ago. We opened ours in 2008. We were the third one in the city. Now there's quite a few. And for us in Vancouver, I've been breaking cannabis laws every day for pretty much all my life, and the first time I've ever been charged was for giving away low THC cannabis seeds in Calgary last year. But it really varies by jurisdiction, and what we enjoy in Vancouver is certainly not the same as the rest of the country. The further north you go in Canada, the rate of possession and trafficking charges increase drastically, and I believe that's largely because our First Nations population also increases drastically the further north you go. So it really varies across the country how these laws are enforced, which is another example of how it's not just. I can do something in Vancouver, which I can get away with, but someone in another part of the country does the same thing could find themselves in a very serious legal situation.
Now, we heard Mr. Weber commented that he had never been in a dispensary, and I think he's probably not alone on this committee. I have the benefit of being in Vancouver, where I've had the ability to tour several dispensaries, including the Compassion Club and some licensed facilities. We as parliamentarians are studying this bill, and we have to make recommendations to this bill about all sorts of issues, but we have not toured dispensaries. We have not toured licensed producer facilities, Compassion Clubs. Do you think that it would be helpful for the parliamentarians in this committee to actually get out in the community and tour some of these facilities, in order to help us evaluate the whether this bill is good as it is or whether it could be amended?
I think that would be very worthwhile, and I think to get an understanding of what's really happening and of the limitations of the laws that you're trying to pass and the limitations of the ability to enforce the laws you're trying to pass, I think it'd be very important to see what's actually happening at the grassroots level, and also really to see the people that are benefiting from accessing dispensaries and how it improves their lives and how it benefits our local communities. There's all kinds of dispensaries. I'm not saying everyone is run perfectly by any means, but from what I see, people are glad to have dispensaries. They benefit them, and they provide a lot of positive results. And I think it would be very worthwhile to see what's actually happening at the grassroots level and what people are doing, and understand that the laws that you're passing, the current cannabis laws, are already being ignored pretty much all across the country to varying degrees. If you're not going to take that into consideration when you pass these new laws, they're going to be a failure, because we will continue to ignore these laws, and the courts will back us up on that. And you talk about the rule of law, and you know, some people would say that we have a moral obligation to break unjust laws, and then when laws are punishing people who do not deserve to be punished, when laws are based on racial bigotry and ignorance with how these laws were founded, that we have a moral duty to break those laws. And I personally am glad that I'm able to provide cannabis medicines to those who need it. I believe I am improving people's lives every day, and we will continue to do so.
Some have suggested that once this legislation is enforced and it legalizes simple possession and a few other things, that we as a parliament should take steps to pardon those who have been convicted of crimes that this legislation will no longer render a crime. What's your view on that?
I think we should go further than that. I actually would like, if I was in charge, I would put GST on cannabis, and for the first few years, I'd put that money into a fund to make reparations to those Canadians who have been unjustly imprisoned or had their lives negatively affected by cannabis prohibition. And I really think that the legalization of cannabis should begin with an apology to the cannabis culture and to cannabis users for 100 years of punishment and incarceration and harassment and demonization that was entirely undeserved. Not for me personally, but for the people in Canada who have suffered from this, I would like to see not only a pardon, but an apology and some kind of restitution made, because these laws have been unjust from the beginning, and they remain so today. And we've known this for decades, that these laws do not work, that they're a failure, and it's a real shame that people are still being arrested every single day. A guy spent 3 nights in jail recently for a couple of grams of cannabis in Canada. That should be shocking to the conscience of parliamentarians, that these laws are in place, putting people in prison for jail for 3 days for a couple of grams. And you know, they say the time of the greatest growth of cannabis use in Canada was in the 1960s, at a time when it was a 6-month mandatory sentence for possession and a 7-year mandatory minimum sentence for growing or importing any quantity of cannabis, and that was the time of the highest increase of cannabis use in our country's history. The idea that these laws have an impact on people's behavior, that if you say you can't smoke cannabis anymore, we're all going to stop, that's entirely backwards. Now we're living under mandatory minimums that were passed by Stephen Harper in Canada. That hasn't stopped the proliferation of dispensaries at all. And so I think you need to acknowledge the limitations of what Parliament and the police can do in this kind of a situation, and write laws, craft laws that acknowledge that and take that into consideration.
Time is up, Mr. Davies. Now we go to Mr. Oliver.
Great. Thank you very much. You know, again, one of the advantages of this model that we're using, which I think has been an excellent model for us to hear from many witnesses in a condensed time frame, I think this is the 7th time we've actually been able to do another round of questions, which often in our normal setup we're not allowed to, we don't have time to do. So it's been a good process for us. I had a town hall in my riding of Oakville, and had a good 100+ people turn up. Just people, general public, that turned out to talk about the legislation, talk about pros and cons. And one gentleman really hit home with me. He was really concerned about secondhand smoke from marijuana, worried that if he was exposed to it and he got in a car and drove, would he have, you know, would he show trace elements, worried about different health aspects of it. So I think, Dr. Vandry, you had done a study on secondhand smoke from cannabis on non-smokers. Could you just share with the committee some of your findings from that study?
Ran a research study where we exposed people to secondhand cannabis smoke under different conditions. One was ventilated room environment, one was an unventilated environment, and then within the unventilated environment, we varied the potency of the cannabis that people were smoking. We found a substantial impact of room ventilation on the amount of exposure. In terms of drug testing, whether someone would test positive or not after exposure depended on how you were testing and what cutoffs were used, but we did find that in an unventilated environment, positive tests would be possible for both urine and blood, as well as actually saliva or oral fluid. The duration of time for where you could be positive depended on how you tested and what cutoff you used. But in order to become positive there under those circumstances, it was really limited to that unventilated environment where the room air was dense with smoke. When the air conditioning or the HVAC system was turned on, people were not impaired and were generally tested negative. So I think that, secondhand smoke exposure is a real concern. It's a real thing, but it's hard to be impacted by that unknowingly. I think indoor smoking, secondhand smoke regulations are appropriate the same way they are for tobacco use. We've not done the parallel study with vaporization, so we don't really know the level of secondhand exposure with vaped cannabis versus smoked. And then there's obvious limitations beyond that. For the study that we did, we exposed people for 1 hour, one time. That doesn't tell us anything about what happens if they're exposed for a longer period of time or a shorter period of time, but repeatedly. I think, again, this is an area where more science is needed, but I think that our study demonstrated that you can get slight intoxication and test positive in an extreme exposure environment.
Thank you very much. Those are my questions. Thank you. That's my question.
Well, that completes our additional round and our normal round, and on behalf of the committee, I want to thank all the panelists. I mean, you brought great perspective and different perspectives than we've heard, and we appreciate them very much. And with that, I will suspend the meeting until, when's our next meeting? 10:45. Get it right this time. And I want to say that I walked down Spark Street the other night in a cloud of smoke, and I think if somebody had tested me, I would have tested positive by the time I got to the end of the street. But thank you very much, and we'll suspend the meeting. Our standing committee, meeting number 68, standing committee on health, and we're studying C45, an act respecting cannabis, and we're now going to focus our panel on medicinal marijuana. And our witnesses today are from the BC Compassion Club Society, Hilary Black, founder, and Marcel van de Beek, administrator. From the Canadians for Fair Access to Medical Marijuana are Jonathan Zaiz, Executive Director, and Daphne Elisma, Quebec Representative. And from the Department of Health, we have Jacqueline Bogdan, Assistant Deputy Minister, Cannabis Legislation and Regulation Branch, and David Pellman, Executive Director, Office of Medicinal Cannabis. And we're going to ask each organization to have an opening statement of 10 minutes, and you can share it with each other, but the maximum is 10 minutes per organization. And we'll start with the BC Compassion Club Society.
Good morning, and thank you for having me here today. My name is Hilary Black, and I'm the founder of the first medical cannabis dispensary in the country, founded in 1997. In the interest of disclosure, I am also employed by a licensed producer, but I'm here today representing the BC Compassion Club Society, and thank you for having me. Cannabis legalization will affect some of the most vulnerable members of Canadian society, critically and chronically ill patients. We are offering you 7 recommendations in your submission to assist you in prioritizing patient needs. My comments today are focused on 3 main areas: transitioning the BC Compassion Club Society into the legal market, facilitating affordability, and supporting research. The submission additionally addresses the need for a legal range of products and advertising education restrictions. My colleague Marcel van der Beek will be making some comments about the need to eliminate barriers for small-scale growers. We have been distributing medicinal cannabis openly and safely for over 20 years. We are a nonprofit society with over 11,000 registered patients. We have a subsidized wellness center. Last year alone, we provided 3,400 holistic treatments like massage, counseling, clinical herbalism, and nutritional counseling for little or no cost to our membership. We are a frontlines harm reduction organization. Our clients are often marginalized, have numerous diagnoses, mental health issues, and substance issues. They are falling through the cracks of the healthcare system until we catch them. We have developed the gold standard of education. We know how to maximize benefits and minimize risks and avoid adverse effects. We offer each member a 60 to 90-minute intake session, an intake and education session. This is not possible in a pharmacy. Our community supports us, our neighbors, businesses, local police, healthcare practitioners, and patient organizations. We are a community. We have Christmas parties, picnics, and neighborhood cleanups. The courts have repeatedly commended our work. In 2002, the Senate Committee on Illegal Drugs toured our facility and recommended our model should be replicated across the country. I was nominated by Senator Pierre-Claude Nolan, may he rest in peace, and received a Diamond Jubilee recognizing our significant contribution to Canada. Our model is enshrined into Vancouver city bylaws with incentives to encourage the replication of our services because our practitioners have up to a 3-year wait list. Members of the task force visited us last September. You are all also invited to come and visit us. And when they released their report, Anne McClellan said, "What we learned there, putting aside certain issues of illegality, is that there can be a holistic, wellness-based, street-level approach that serves generally a highly marginalized population, and that this is a model that the report references and suggests the government should take a look at going forward." Despite this extensive recognition from many levels of government, as cannabis is legalized, we are at risk of becoming more criminalized than we were for the past 20 years. We have a massive responsibility to ensure the health care of our members is not interrupted, and we respectfully suggest that you share that responsibility with us. We are a historical medical cannabis institution. We implore you to do everything in your power to protect the roots of this industry. Washington and Colorado prioritize transitioning long-standing medical cannabis dispensaries into the new framework, and we should be following suit. For decades, I have watched patients struggle, choosing between purchasing the medicine that allows them to function and other necessities, like having groceries in their fridge. The problem is the status of cannabis. It's not an approved medicine. Access has been granted through the courts. It is in a category of 1 and not treated like other medications, although many patients access it through physician authorization. This status is problematic for both tax and insurance. Both of these could be solved by creating a fast-tracked regulatory pathway for cannabis to be an approved drug or medicine. For good reason, we do not tax other prescription medications. The courts have stated legislation imposing tax on medical cannabis resulted in confusion and uncertainty and needs work in Hedges versus Canada. Another solution is amending the Excise Tax Act to ensure medical cannabis is zero-rated like other medical necessities and prescription medicines to relieve this unjust financial burden. I'd like to introduce to you Ms. Munia Lababi, who has worked at the House of Commons as a parliamentary assistant to MP Peter Julian for over 12 years. She has been prescribed cannabis for her medical conditions diagnosed while employed by the House of Commons, including Crohn's disease, osteoarthritis, and cervical degenerative disc disease. She exhausted standard medical treatments for these devastating conditions, which proved to be ineffective and have harmful side effects. Cannabis immediately eliminated the need for immunosuppressants, steroids, nonsteroidal anti-inflammatories, and other pain medications. It relieves her symptoms, which include nausea, insomnia, debilitating, unrelenting neuropathic and chronic pain. Without cannabis, she can't eat, she can't sleep, she can't function. The costs of her medication are unaffordable, but she cannot go without it. Her family has racked up thousands of dollars in debt in order to afford her prescribed medical cannabis. Even though medical cannabis lacks a drug identification number, Sun Life, responsible for the administration of claims under the Public Service Healthcare Plan, informed Munia that they are set up and ready to cover the costs of this necessary therapy once it is included in her plan. Now I'd like to introduce you to Mandy McKnight. She's employed by the Canada Revenue Agency. Her son Liam is 9 years old and diagnosed with Dravet syndrome, a catastrophic form of epilepsy for which there is currently no cure and the prognosis is unknown. Before trying cannabis, Liam had tried over 10 anti-epileptic medications that failed to control his seizures. He was still suffering up to 80 seizures a day. The side effects from the benzodiazepines and barbiturates were severe, including brain atrophy. Since being prescribed cannabis when he was just 5 years old, Liam is doing remarkably well, and his seizures are more controlled than on any other medication. The cost to the family is over $1,000 a month, plus HST. The alternative therapies, which are less effective and come with terrible side effects, cost between $2,500 and $3,000 a month, but they are covered. Both Mandy and Munia have had health claims for coverage rejected by their employer. Give medical cannabis a drug identification number or something akin to it, perhaps a cannabis identification number, to facilitate fair taxation and insurance. Take care of patients and Canada's public servants. It's the right thing to do. You could lead this government, the country, and the world by including cannabis in the Federal Public Health Services Care Plan. Treat patients with the dignity, compassion, and support that they deserve. We have an opportunity to be world leaders, expanding the evidence base of benefits and the safety profile of medical cannabis. We are facing an opiate and overdose crisis, and cannabis has tremendous potential as a harm reduction tool. We urge you to invest significant resources in human clinical research in cannabis and cannabinoids, prioritizing researching the potential of cannabis in managing pain and as a harm reduction tool for addiction and substance abuse. The Compassion Club has required tremendous experience with people struggling with problematic substance use and using cannabis as a harm reduction tool. We have witnessed the potential of high-potency edibles and resins being substituted for recreational and medical opiates, methadone, alcohol, and cocaine. This country needs solutions to the opiate epidemic, and cannabis has incredible potential. We implore this committee to do everything in its power to transition the community-based, long-standing, frontline harm reduction organization, the Compassion Club, and other long-standing medical cannabis dispensaries that pioneered the medical cannabis movement and industry into the new regulatory framework. Please consider the 7 recommendations in this submission to improve the care of patients. Thank you, and I'd like to introduce you to my colleague Marcel Van de Beek, who will be making some brief comments.
Good morning. My name is Marcel Van de Beek. My roles during the 19 years at the BC Compassion Club Society have included frontline dispensing of medicinal cannabis for 5 years, administrative for 15 years, and purchasing for 17 years. I've been working with the suppliers of the BC Compassion Club to ensure consistent supply of high-quality medicinal cannabis to our membership. As my colleague Hillary said, we are a registered not-for-profit society focused on providing holistic health care for those who most need it. We work with small-scale growers who cultivate specifically for our members at below-market pricing. They have cultivated specialty strains and have amassed a tremendous amount of expertise, including organic cultivation methods. None are related to organized crime, and all have taken on great personal risk to help us meet the needs of our members. We ensure the ideological values of the suppliers we work with, and we reject the producers who are solely profit motivated. We have a strict cap on pricing which weeds out those who are not aligned with our mission, vision, and values, including asking them for smalls and donations. For example, we have a cultivator named Joe who lived with a serious disability, grew organic cannabis for us. He used to donate thousands of dollars worth of cannabis every Christmas to help us gift it to our members in order to help alleviate their financial hardship during the holiday season. He used the small profits to fund a summer camp for disabled children. Sadly, he was raided by the RCMP. He was never charged, but as a result, he was forced to end his summer camp. These are the good, honest, hard-working, law-abiding Canadians this government is looking at as the criminals who must have the industry taken out of their hands. In fact, they're the people you should be bringing out of the shadows and into the light. The current process for applying to be a licensed producer is inaccessible financially to small-scale producers and to small business people, which is part of what is needed to fill the supply shortages and illicit production. The pioneers of the medical cannabis movement and industry will not be included in the legal market unless you dissolve the onerous barriers to becoming licensed. Thank you for the opportunity to speak to your committee today, and we look forward to your questions.
And thank you for your comments. Now we're going to move to the Canadians for Fair Access to Medical Marijuana. Mr. Zaid, 10 minutes.
Thank you, Mr. Chairman, and to the Standing Committee for your invitation to appear here today. We will be speaking on behalf of two organizations, Canadians for Fair Access to Medical Marijuana, also known as CFAM, and the Arthritis Society. I am the founder and executive director of CFAM, a national nonprofit organization focused on the needs of medical cannabis patients. The Arthritis Society, Canada's principal health charity providing education, programs, and support to the over 4.6 million Canadians living with arthritis. Over the past 2 years, the organizations have collaborated extensively on important issues surrounding medical cannabis research, access, and affordability. The brief submitted to the committee is a joint submission between the two groups, and any follow-up can be done with myself or Janet Yale, CEO of the Arthritis Society. You may recall Janet recently appeared before this committee on other issues, including national pharmacare. I'd also like to introduce Daphne Elisma, CFAM's Quebec representative and a member of our Patient Advisory Board. She'll present in French momentarily. First, I'd like to share a bit about my personal story. So much of what we hear about cannabis is focused on the harms and risks, which of course are important issues, but my experience and the experience of many other patients is quite the opposite. On April 22, 2007, at the age of 14, I woke up with a constant headache that still remains today 24/7. This neurological condition, known as new daily persistent headache, is said to be one of the hardest pain conditions to treat. After trying over 40 prescription medications and all other therapies, I was near ready to give up. I had no quality of life. I could not leave the house due to noise, sensitivity, and low energy. I dropped out of grade 8 and struggled throughout high school. I finally turned to medical cannabis. It helped reduce painful flare-ups and allowed me to sleep. Although not a cure, the effective symptom management enabled me to concentrate and be successful in my academic studies. I advocated for insurance coverage and was the first in Canada to get successful insurance coverage for medical cannabis in this manner. Medical cannabis patients are often looked at as stereotypical stoners. Yet to myself, Daphne, and the patients we represent, effective symptom management translates to increased quality of life and functionality. Cannabis is a medicine. There are over 200,000 authorizations for the use of cannabis as a therapy to manage a variety of health conditions, including seizures, pain, insomnia, nausea and vomiting, and side effects from prescription medications. Although there is legal access to medical cannabis, there are still many challenges associated with its use. We need more research. Access to various product forms and retail distribution are important issues. And one of the most pressing concerns facing patients remains to be affordability. As the government progresses with legalization, one of the primary goals is to reduce consumption. Although laudable for recreational purposes, the government's goal ought not to be to restrict access to medical cannabis, a medicine, but rather to ensure a safe, reliable, and affordable supply for those who medically require it. There are 3 issues that we will be highlighting today: the importance of a distinct regulatory framework, research, and affordability, which Daphne will speak to. Although we need more research, a recent review by the U.S. National Academies found substantial evidence for the use of cannabinoids in conditions including chronic pain, MS, and chemotherapy-induced nausea. The two most studied cannabinoids are THC and CBD. THC, the cannabinoid that causes the stereotypical high associated with cannabis, has medical properties including analgesia. CBD, a non-impairing cannabinoid which has been shown to have anti-inflammatory and anticonvulsant effects, also limits the impairment and side effects caused by THC. Many patients use these two cannabinoids in combination to gain the most effective symptom management while limiting potential of impairment. Again, for most people using cannabis for medical purposes, this is not about getting high, but rather effective symptom management and increased quality of life. Cannabis is a legitimate medication, and it must be treated that way. And it's important that it be treated that way in a distinct regulatory framework. In crafting Bill C-45, we want to commend the government for recognizing the need to maintain a separate and distinct regulatory approach for medical cannabis, and we want to make sure that this is maintained. Beyond the government's constitutional requirements to provide reasonable access to cannabis for medical purposes, we believe cannabis and patients' needs are best suited to be addressed in a distinct regulatory framework. And moving forward, beyond Bill C-45, it is important that the government prioritizes and adequately supports the needs of patients by addressing their unmet needs. And of course, research is a very important issue. There is an enormous deficit of properly funded research in Canadian clinical trials into the therapeutic use of medical cannabis. This creates barriers to patient access as many physicians express reluctance to authorize medical cannabis in the absence of robust peer-reviewed research. The lack of scientific and clinical research has also been cited by Health Canada as a key reason why medical cannabis is not yet regulated as a therapeutic product, which affects the ability of patients to access medical cannabis through private or public drug plans. In particular, more research is needed in terms of dose, indication, and form. To that end, we have asked, as part of Budget 18, for the federal government to commit $25 million over 5 years to support medical cannabis research. This investment will go a long way towards expanding the evidence base for medical cannabis, and it's a small amount compared to the $274 million already proposed for enforcement. And although we fully support enforcement and research into the risks associated with recreational cannabis use, we believe it's necessary for the federal government to invest research specific to the medical use of cannabis. This is an urgent and vital step towards further understanding and recognizing the legitimate medical use of cannabis and ensuring the sustainability of a distinct regulatory framework. And in terms of improving access, we believe in addition to the continuation of mail order and personal production, pharmacies should have exclusive authority to retail medical cannabis and further product forms should be made available. Sales through pharmacies would go towards improving affordability, including the elimination of sales tax based on the Excise Tax Act and increasing the potential of insurance coverage. Pharmacists will help enable that patients across the country are able to receive reliable education on the safe and effective use from trained healthcare professionals with regulatory oversight. While retail and distribution decisions are largely provincial competencies, in order for pharmacy distribution to happen, the access to cannabis for medical purposes regulations will need to be amended. I will now pass it to Daphne to discuss affordability.
Après plus d'une décennie au sein de Santé Canada et en
After over a decade at Health Canada and in my capacity as a legal expert, I advocate for patients who use medicinal marijuana. In fact, I myself use CBD successfully to treat complex regional pain syndrome following a breast cancer treatment. The issue of affordability represents a major one for patients, the patients that we represent today, because medicinal marijuana is the most effective medication to treat their condition. We feel that that medical marijuana should be exempt from tax. When a patient procures a prescription medication for medical needs, the medication is exempt under federal legislation. Because medicinal marijuana meets these criteria, the government should make it free of sales tax as well, making it more affordable. We are asking for the adoption of policies and programs that facilitate the reimbursement of medicinal marijuana under public and private plans. We recommend that the government approve cannabis as a therapeutical product, assigning it a medication identification number and facilitating its reimbursement. In summary, patients who use cannabis to alleviate their physical and psychological conditions feel discriminated against. The government is drawing a distinction between these patients and those who use conventional medications such as opioids to treat the same condition. Patients often feel obliged to use an opiate instead of cannabis because of its lack of affordability. Taxation and a lack of reimbursement of medical marijuana represent an excessive constraint for patients. The improvement of the rights of patients who use medicinal marijuana must remain at the heart of these discussions. I thank the committee members for this opportunity to address myself to you today.
And now we go to Ms. Bogdan. Welcome back.
Thank you, Mr. Chair. Thank you for the opportunity to appear before the committee again this morning. I will ask the committee's understanding. My voice, I got a bit of a cold in the last few days, so my voice is not as good as on Monday, but we'll do the best that we can. As public servants, my colleague and I, Mr. David Pellman, who's responsible for the Office of Medical Cannabis, as public servants, we're responsible for administering on behalf of Health Canada, the current regulatory framework that enables Canadians to have access to cannabis for medical purposes. Mr. Chair, I'd like to provide the committee with an overview of the regulatory framework focusing on 4 areas. One is how the current framework is designed, how it works, and the number of Canadians who presently benefit from it. 2, I will outline the robust requirements and controls that apply to licensed production of cannabis and that are designed to protect public health and safety. 3, I will describe some of the key improvements that Health Canada has made to the program over the last 6 months. And finally, I'll outline why and how this framework would be preserved under the proposed Cannabis Act that is before you. Mr. Chair, Canada has had a system of access to cannabis for medical purposes in some form since the late 1990s. The regulatory regime was put in place following a court decision that determined that the Government of Canada must provide some lawful means for Canadians to have access and possess cannabis for medical purposes. The framework has evolved considerably over time as the government has introduced improvements and has responded to a number of court challenges and decisions. Most recently, in April 2016, the federal court determined that the regulatory framework that was in place did not provide individuals with reasonable access to cannabis for medical purposes. In this instance, reasonable access was defined as having access to available and affordable cannabis. In response to this decision, Health Canada introduced a new regulatory framework, which is called the Access to Cannabis for Medical Purposes Regulations, a little over a year ago. Under this new regime, Canadians who have the authorization of their healthcare practitioner can access cannabis in one of 3 ways: by purchasing quality-controlled cannabis from a federally licensed producer. Individuals register directly with the licensed producer, and the product is delivered securely to their home, either through the mail or by courier. Individuals also have the option to register with Health Canada to produce a limited amount of cannabis at home, or to designate someone to produce it for them. As I mentioned, Canadians must have the authorization of their healthcare practitioner in order to access cannabis for medical purposes. Health Canada believes that the decision to use cannabis for medical purposes is one that is best made by a healthcare practitioner and his or her patient. Health Canada provides information designed specifically for healthcare practitioners on its website. The department also works closely with provincial and territorial regulatory authorities, which in turn provide guidance to the healthcare practitioners in their jurisdiction. Healthcare practitioners are authorizing cannabis as a treatment for a wide range of symptoms associated with medical conditions, including nausea in patients undergoing chemotherapy, loss of appetite and weight loss associated with HIV/AIDS, and pain and spasticity associated with multiple sclerosis and arthritis. At this time, under the new regulations, there are more than 210,000 active authorizations for the use of cannabis for medical purposes. Of this number, 200,000 active registrations are with the federally licensed producers, and individuals purchase their product directly from them. 10,000 individuals are registered with Health Canada to produce a limited amount of cannabis at home, or to designate someone to do it for them. The number of client registrations with licensed producers is continuing to grow at a rate of approximately 9% a month since licensed production began in 2013. The number of healthcare practitioners that are authorizing the use of cannabis has also grown steadily. There are now 10,000 healthcare practitioners authorizing use, which has doubled since June 2015. Mr. Chair, I would now like to describe briefly the system regulated production of cannabis in Canada. There are currently 58 producers that are licensed to produce cannabis for medical purposes. These producers are the only legal commercial source for regulated quality controlled cannabis for medical purposes in Canada. The regulatory framework sets out a series of strict requirements that must be met to protect the health and safety of Canadians and the integrity of the legal system. For example, licensed producers are required to use good production practices in their facilities, such as a sanitary program and having a dedicated person responsible for quality assurance. They must test each and every lot for mold, bacteria, and other potential contaminants before those products can be released for sale to the public. Licensed producers must also test each lot for THC and CBD potency, and those results must be displayed on the label. In terms of preventing diversion to the illegal market and ensuring the integrity of the legal system, all license holders, directors of corporation, and all senior personnel in the facility must have a security clearance. This security and clearance involves a criminal record check as well as a law enforcement record check to identify any known associations or affiliations with organized crime. In addition, all facilities must have physical security and inventory control measures to prevent theft or diversion. These standards and controls are backed by rigorous compliance and enforcement. Last year, Health Canada inspected each facility an average of 7 to 8 times, conducting roughly 275 inspections. These inspections verify that good production practices are being met, the test results for all products that are produced, that only authorized pesticides are being used, and they review inventory records and the security control measures that are in place in these facilities. I will also note that Canada's system of regulated production of cannabis is recognized internationally. We receive frequent visits and calls from other countries for advice on our patient-focused approach, strict licensing regime, and our compliance and enforcement program. Mr. Chair, I will now outline some recent improvements to help ensure that Canadians continue to have reasonable access to cannabis and can have confidence in the quality-controlled supply of cannabis for medical purposes. In May this year, Health Canada announced that it will require all licensed producers to conduct mandatory testing of all cannabis products for the presence of unauthorized pesticides. In addition, Health Canada is conducting unannounced inspections of all licensed producers and randomly testing lots and products for unauthorized pesticides. Also, in May this year, Health Canada added additional resources and introduced a number of improvements to streamline the licensing of producers and enable increased production of cannabis while maintaining quality control and oversight. These measures will also help ensure that a legal, quality-controlled supply of cannabis would be available should the proposed Cannabis Act be approved by Parliament. Mr. Chair, the question of whether to retain a separate framework for access to cannabis for medical purposes was a key question that the government asked the task force of experts on cannabis legalization and regulation to consider. The task force consulted broadly, as you know, and extensively with experts in public health, law enforcement, patients and advocates, including the others who have joined me at the table today, as well as licensed producers. During these consultations, the task force heard how cannabis is making a difference to Canadians living with serious health challenges, such as cancer, HIV/AIDS, multiple sclerosis, arthritis, and fibromyalgia. They also heard about the role that cannabis can play in pain management and palliative care and the relief that cannabis offers to children with severe forms of epilepsy. Based on their findings, the task force recommended that the government maintain a separate medical access framework to support patients. It also recommended that the government monitor and evaluate patients' reasonable access during the implementation of this new legislation and evaluate within 5 years. The government has accepted the advice of the task force, and the proposed Cannabis Act that is before you will enable the framework to continue. In closing, Mr. Chair, I wish to emphasize that Health Canada is committed to enabling Canadians to have reasonable access to cannabis for medical purposes. We will continue to monitor closely, as we do today, and be prepared to take additional measures if necessary. Finally, we will continue to seek the feedback of patients and producers to continuously improve how we administer and ensure that Canadians are well served by the program. And we would be happy to answer your questions. Thank you.
Thank you very much. All right, now we'll go to our first round of 7-minute questions, and we'll start with Mr. McKinnon.
Thank you, Chair. My first question is for Ms. Bogdan. Mr. Zaid has, in his presentation, has asked for a drug identification number to be assigned to cannabis. I was wondering how that would work, whether there are issues with that, and what would be involved.
Thank you for that question. Cannabis can be classified as a therapeutic drug under the Food and Drugs Act. If a company wishes to market a drug in Canada, there is a process that they can go through to apply to do so. And Health Canada would review the evidence that is put forward to verify the product's safety, efficacy, and quality. Part of the process involves presenting results of preclinical and clinical studies that have been conducted either in Canada or overseas, and details regarding the production and the packaging of the drug and a number of other aspects. So at this time, cannabis itself, either in its dried, fresh, or oil form, has not been authorized as a therapeutic product. No company has brought forward an application or the clinical evidence that would be required. However, I would point out that a number of cannabis-based drugs, there are in fact 2, have been approved, have undergone the market authorization process, have received a DIN, and as such are available for sale and would be eligible for reimbursement from plans.
Okay, so apart from those 2 products, I mean, a producer or manufacturer hasn't come forward and said, listen, we want a DIN for this product, and here is the evidence, and so on and so forth. Okay. Mr. Zaid, can you give us any feedback regarding that? Have you talked to people about applying for such an identification number?
Yeah, so we'd absolutely love to see a drug identification number application put forward by a drug company, but one of the issues surrounding cannabis and what makes it unique is that it's a plant. It's not a patentable molecule, and that's typically what the Therapeutic Drug Directorate regulates. So when talking about cannabis, there's a wide range of indications. So really, it does come back to the research. We really need to focus on medical cannabis-specific research. And the government has an obligation, we believe, in this role, because of the limited patentability of cannabis, to really incentivize research and ensure that we have the research needed to get to that DIN. But really, in the interim, we do believe cannabis should be assigned a DIN or something equivalent to start facilitating reimbursement, as it's such a vital issue for patients across the country.
It sounds like there's not enough research, and it just needs people to enter the formal process to make that happen. And you're not aware of anybody having started such a process?
In terms of the application process, but there are definitely some small-scale clinical trials ongoing by some of the licensed producers, but it's not nearly to the degree that we would like to see it. We'd also like to see the $25 million invested to CIHR so that they can grant it out so that it's unbiased research, not necessarily sponsored by drug companies as well. So really it does come back to the research and again, the patentability as well as really the wide range of indications means that there's a lot of research to be done, expensive clinical research. The Arthritis Society, about a couple of years ago, held a forum, brought all the researchers together, and created a report that set out a list of priorities. So now we have the priorities, we know what we need to study, we really just need the funding to enable us to do that.
I think Ms. Black would like to respond to this. Is that correct?
Well, I mean, part of the, there is quite a lot of great research around medical cannabis. It's large-scale human clinical trials that is really where the dearth of research is. And we have to remember that we're talking about a plant that's been prohibited for almost 100 years. So people that have been wanting to research it, it's been impossible to find a legal, consistent supply. It's very onerous and takes an extremely long time to get licensing, even for laboratories. So one of the things that this government can do besides funding research is to encourage, facilitate, and expedite it in any way that's in your power to do so.
I mean, you say there's a lot of research out there, though, but unless someone starts a process for an application, it's not going to do anything to achieve a drug identification number.
I mean, as Jonathan said, there is some complications around cannabis because it isn't patentable. But, you know, my understanding would be that if the government allocated some resources and from your side encouraged research into the medical applications of cannabis rather than holding it back, that we would be able to start seeing more progress.
I see.
Comment there, did you?
If I could offer, you know, one, I perhaps should have said that in my first answer to the committee member's question, Mr. Chair, is that, you know, the proposed Cannabis Act would provide greater flexibility for the minister to authorize different types of cannabis research than we do now. And what I mean by that is, you know, it would improve the current process, which requires individuals to seek an exemption in order to be able to do this kind of research. So I think, you know, one of the virtues of the proposed legislation is that it will enable and facilitate research. And I perhaps should have mentioned that from the outset.
Ms. Black, I believe you're asking for prescriptions to be issued instead of authorizations, and you feel that it would be better, give better access to the product. Is that correct?
Well, because the current medical regulations, the ACMPR, we call the authorization to cannabis an authorization rather than calling it a prescription, because this is like the chicken and the egg, back to the fact that it's not an approved medicine, and so we can't technically call it a prescription because it isn't actually an approved medicine. But by calling it an authorization and not a prescription, that is the answer that many people come to on the dead end of trying to either get insurance coverage, and the reason why the tax courts said that GST is applicable to medical cannabis.
My understanding, though, is that doctors are reluctant to issue prescriptions because they don't have the research to back them up. They don't know the specific medical consequences of particular potencies and so forth, so that they would, I suspect they would be less likely to issue a prescription than they would issue an authorization.
I mean, I am not a physician, but I do communicate with many physicians regularly, and I would suggest that the authorization form that physicians currently have to fill out actually takes more time and is more onerous than filling out a prescription on a prescription pad. So I think whether we call it a prescription or an authorization, it's not going to address the issue of the research and education that is needed for physicians across the country.
Thanks very much. We'll go to Mr. Weber.
Mr. Chair, and thank you to the panel for being here today. And I also want to thank Ms. Black and Mr. Vanderbeek for the work that you do and you have done for the last 20 years. I am a strong advocate for medical marijuana. My wife, at 37 years old, diagnosed stage 4 breast cancer, going through incredible chemotherapy and radiation, and the nausea was intense. It was uncontrollable, to the point where there was desperation. We had to go to the illicit market to get marijuana, to try it, and it worked. It worked for her nausea. Of course, back then, we had no idea what was in it. Obviously, there was strong THC in it, which caused a lot of bad experiences, but it took away her nausea. So to be able to come to an outlet where they can prescribe at the proper marijuana for patients who suffer like that, I think is vital to Canadians. And so I, again, am a strong advocate there. One question I have is you talked about some of your young patients, and of course, Mr. Zaid being a young individual as well, requiring marijuana. I'm happy that you found something that helps your headaches, by the way. And I ask you both, are you not concerned about the strong scientific evidence of the correlation between use as a youth and mental issues because of your developing brain? Maybe I'll start with Mr. Zaid.
First of all, yeah, of course I'm concerned about that. I mean, but I think it's a different context when we're speaking about medical use from other recreational use. I tried 40 prescription medications. Not one of those medications was ever studied in my condition. No research whatsoever. They had side effects that included death, included cognitive impairment, right? And these were given to me without any of these types of questions. So I think it comes back to when you're suffering a medical condition, there's risks to alternative treatments. There's risks to not having effective treatments. So for me, the risks really weren't comparable to the benefits that it could afford me. And I think that's the issue with lots of patients. And the second aspect I would propose is also, we talk a lot about cannabis as a whole, but really there's hundreds of chemicals within the plant itself. THC does have some research that is concerning regarding adolescent brain development, but lots of the pediatric patients are on pure CBD, and that research isn't correlated to the brain development. So with those two aspects, the medical context as well as different cannabinoids that may be being used, I think there is definitely potential among young people.
Is it the CBD that helps you in your headaches? Or is it a mixture of both, or is it the THC? What has helped you?
Yeah, so it's a mixture. During the day, I usually use mainly CBD. I'm on cannabis right now. I don't think anyone would think I'm impaired. Most people wouldn't think I have a very severe chronic illness either, right? I have effective symptom management. I'm not high. I use a bit of THC at night. It helps me sleep, and that's such an important thing to having a healthy lifestyle. So overall, it's really effective to improving my quality of life.
Ms. Elisma, you mentioned that you're a cancer survivor, and you continue to use CBD. You mentioned in your presentation. I understand that marijuana is good for nausea and such, but why would you continue to take it after your treatments?
Une chose que j'ai pas mentionnée dans mon introduction tout à l'heure, c'est que
one thing that I didn't mention in my introduction earlier was that in addition to my medication for chronic pain, I also developed migraines, which are very persistent. So CBD, well, my treatment is CBD, but there's also THC, which improves my quality of life. And currently, I have no problem with migraines. They've completely disappeared since I started this treatment. Before, I was using a number of different prescription medications, like naproxen, very powerful medications that created difficulties, health problems. And so when I turned to medicinal marijuana, it really greatly helped me have a better quality of life. So it's a treatment that I wish to continue.
Bogdan, you described licensed producers and the strict requirements that they have to adhere to, and I had the opportunity to tour a licensed facility north of Calgary, which you described it accurately. It was like entering a federal prison to get in there to begin with. But yes, sanitary requirements. You can eat off the floor. It was that clean and very, very impressive anyways. And I encourage all our members to, if you have the opportunity to tour one of these licensed producers. With respect to a comment you made about strict clearance for licensed producers, we've had a number of presentations here where people have recommended that we allow individuals who have had past experience, perhaps even convicted marijuana convictions, to allow them to apply for licenses and be accepted for that. Can I ask what your thoughts are on that?
I think the government puts in place we have a process around the security clearances that is in place principally for two reasons, right? One is to protect the integrity of the system, of the legal system as it stands now. And also to protect it against diversion. So very consciously have made decisions around the requirements for security clearances for all of the key individuals in the organizations. And it's an important feature of the system and would continue to be going forward if we want to ensure that the system isn't infiltrated by organized crime. So while we are certainly aware of the positions that others have put forward, and those will be taken into consideration as the regulations are designed in the future, I think we also need to remember the objectives that the government has in protecting the integrity of the system.
Great. Okay.
Go to Mr. Davies.
Chair, thank you to all the witnesses for being here. Mr. Zaid, in what form do you ingest your cannabis?
I mainly ingest via vaporization as well as some capsules. I find personally it's the most effective for me, but I definitely would like to try other product forms, including sublingual tinctures and creams for nerve pain. These products aren't available within the system, and there was a Supreme Court case that ruled that patients should have access to a diverse range of products. Health Canada responded to that by allowing the sale of oils and capsules, but there's limited potency in the capsules, which is a big problem, and there's still not basic products like creams available. So we would like to see a wider range of products.
Madame Elisma, how do you ingest your cannabis? Do you smoke it or do you take it in some other form?
Like Mr. Zaid, I use a vaporizer, and I also take it in oil form, which I purchase from legally, and it helps me manage my pain symptoms. So I also use the dried form sometimes. Sometimes I smoke it, depending on my daily needs. But mainly, I vape it, and I use it in oil form. Thank you.
You testified about the licensed producers. There's you call it a strict licensing regime. You test for pesticides and mold. You test for CBD, THC levels. You test for sanitation and safety. There's inspections. None of that is being done for edible manufacturers today, is it?
Well, what licensed producers under the current system are allowed to produce is dried cannabis and cannabis oil,
right,
which can come in many forms.
No, I understand that. So
right.
Edibles are not part of that regime. None of that testing regime you described applies to anybody making edibles in this country right now. Am I correct in that?
You mean an individual who is allowed to produce a limited amount of cannabis at home?
Anybody who's making edibles products for sale in this country, illegally or otherwise, are not subjected to that testing regime, is what I'm trying to establish.
Well, no.
Right. Now, Ms. Black, one of your recommendations is, I quote, ensure legal access to cannabis products in all of its various forms and potencies, including but not limited to herbal cannabis, capsules, tinctures, topicals, resins, and finished edible products. Otherwise, patients will continue to access them in the unregulated market. This move would bring federal policy in line with the recent Supreme Court ruling R. and Smith 2015. Can you elaborate on that and maybe explain the reference to the Smith case?
Certainly. You heard from Kirk Tousaw yesterday evening. I wish that he was here today to speak in more detail about that case. My understanding is that the spirit of that ruling essentially ensured that there's charter protection for patients to use cannabis in all of its forms. And we see that at our organization, that we have a very broad range of forms that cannabis can be used in, many of which have been named here. And I think that if all of those products are not not included in the legal market moving forward, if these regulations don't follow the spirit of that Supreme Court ruling, even though it's about patients, but applying it to the recreational market, that again, we're just going to have all of those products being produced in an unregulated environment. One of my greatest concerns is that some cannabis concentrates for inhalation are made with carcinogenic solvents currently. Like butane is actually a solvent that people use to make inhalable extracts. And if it's not produced correctly, it can have carcinogenic remains left in the product. So in fact, potent inhaled products are one of the most important things for the government to regulate.
Now, in terms of the BC Compassion Club Society, what percentage of products are your patients and customers purchasing that are not, that fall into the edible, concentrate, and non-smokable form?
I would say probably roughly about 30%. However, on the edibles, since the City of Vancouver had demanded essentially that everybody stop having edibles for sale, we stopped carrying them. We wanted to obviously stay compliant with the city bylaws. So let's say in the last couple of years that number has been a little hard to figure out, but yeah, I'd say roughly 30-35%.
And we've heard some testimony on labeling products. I'm wondering what advice you'd give this committee on what kind of information should be on a package to help a consumer, I guess, make an informed choice of the cannabis product they may choose.
I have some concerns about plain packaging requirements. One being that, again, it will give an advantage to unregulated producers to be able to, create colorful or attractive packaging. Anything that you restrict in the legal market that the unregulated market can do, you're going to create an advantage. In our experience, it's very important to be able to have some product information. And also, I think that there is some sort of branding that's necessary for consumers to be able to distinguish about who the producer is, what the company is that they're buying cannabis from. So I think that this is a place where this committee will need to really find a balance between labeling restrictions and also being reasonable about it. Again, if we look at the way that we're able to package alcohol, which we know is more harmful than cannabis, that you're able to have product information and some branding, some fonts, some colors on the packaging. I think that if we want to restrict things like cartoons or things that would really specifically, draw the attention of children, I think that's reasonable.
Thank you. And dispensaries versus pharmacies. Do you have any opinion on the?
Well, this is a very complex issue. The pharmacies have, the governing bodies of the pharmacies for a long time have said that they are very opposed to medical cannabis, and it's not until quite recently that they have come along realizing that there's quite a large and profitable business to be had being a distributor of medical cannabis. So I do believe that cannabis should be in pharmacies. I think that that's one way to give equal access to patients across the country, but I absolutely do not think it should be exclusively in pharmacies. Last year, I had the privilege of organizing a special meeting of patients for the Task Force on Legalization with CFAM and the Arthritis Society. And we had a wonderful half-day meeting with a diverse group of patients, and there was only a few of them who wanted to only access cannabis within a pharmacy. Mandy McKnight, who is here, will talk to you about the problems that she has when she goes to get her pharmaceuticals for Liam in a pharmacy, and how what she really wants is something like what the Compassion Club has, which is a specialized medical cannabis storefront where people can come. We will spend 60 to 90 minutes educating them. We will spend the time talking about all of the different possible products and how to take them very safely. And we have the experience and the expertise and the care to take care of medical cannabis patients in a way that I think is superior to what any pharmacy can provide.
Thank you.
Okay, thanks very much, Mr. Davies. Now we go to Mr. Ayoub.
Yes, thank you, Mr. Chair. I'm going to ask the question in French, so if you need the here, please do so. Je voudrais commencer par Monsieur Van de Beek.
I would like to start with Mr. Van der Beek. He mentioned earlier that while you don't do production, but you sell cannabis. And how do you ensure that you have a price below the market? What is the price of cannabis currently per gram?
Roughly about $4.84 a gram. Normally we purchase by the pound, so it's prorated.
OK. Donc, merci pour le...
Thank you for that answer. I've heard a lot between $10 a gram and more at different levels, but this is an important point to ensure that we remove the black market, the illegal market in organized crime. You mentioned that you have providers who are clear, who are not members of organized crime, and that's good that you have moved in this sense. That's what I've understood.
Madame Bogdan, question pour vous.
Ms. Bogdan, a question for you. Among the producers who are authorized, you said there are 58 of them. You said you have 275 inspections that you carry out. Have you made any observations of infiltration or breaches by organized crime? Are there any producers who have had their licenses withdrawn or amended following the issue of infiltration of organized crime?
Mr. Chair, for the question, no. The answer is no. And I think part of that is in the design of the system, the very strict controls that we have up front in relation to security and who can be involved in the industry.
J'ai une autre question suite à votre réponse.
I have another question to follow up on your answer. If I'm not mistaken, Mr. Rick Barnum, the commissioner of the organized crime in the division at the OPP, mentioned earlier that it's certain that organized crime has infiltrated cannabis producers, licensed cannabis producers. He seemed to be very adamant in his testimony earlier this week. What is your response to that?
Categorically say with respect to the licensed producers that would be untrue to our knowledge, and that if anyone had evidence to the contrary, I think it would be very important to bring that to the attention of the RCMP and others, and ultimately ourselves, if there was a concern of that kind.
Okay. Donc, il y a lieu.
So perhaps he should have done more in-depth research on the issue. I think it's concerning, potentially. Another thing, and without asking questions, if I correctly understood what Ms. Elisma, Mr. Zaid, and Mr. Black they are seeking a bin number. No requests were made by anyone, no industry, no producer. Is cannabis in a class of its own? It is a vegetable. It is a plant product. It's medicinal to a certain point. We need more research to provide more administrative proof, and some scientific evidence has been shown. What is preventing us, and what would be your recommendations? What is preventing us from amending the regulations to have a tailor-made process for cannabis? What would be your recommendations to the minister to make a change to the process to allow doctors to prescribe this and to not have a long authorization form to fill out? Do we need something shorter? What do you recommend?
That's a question that actually the task force itself, the task force on cannabis legalization, considered in its deliberations on the medical access system, given the input and feedback that it received from patients and advocates about whether there couldn't be a separate pathway considered in order to be able to authorize these drugs, or a different way to do it. I think that after careful consideration and deliberation, that the task force came to the conclusion that the system that exists now can work. that the government should do what it can to encourage research, including by making the changes that it is making through this legislation that would encourage research at the clinical, preclinical, or clinical level at universities, or research that might be funded by licensed producers. That the system that we have works, and that by encouraging research, we will probably see increased research in those areas that would lead to market authorization for cannabis in its dried or other forms.
On est encore jusqu'à maintenant.
Up till now, we're seeing that this has been a failure, or there's a problem because no producers have made this request, because I'm assuming that there were likely failure. They suspect they would be a failure before they even applied, and they're taking it for granted. So they're not submitting the application. Therefore, there's no bin number, and doctors can't prescribe it for medical purposes. And I think that we'll never be able to solve this if we don't change something in this process to allow, well, it's already been proven to have medical benefits, but it seems that there's a gap in the administrative process, and for a few years now, we still don't have a solution a few years later. And I think that this is a gap that needs to be addressed quickly. That's my recommendation if I were in your place.
Sure. So perhaps what I would offer for the committee is that while cannabis for medical purposes has been used, as the other panelists acknowledged, for a very long time, the system that we have in place in Canada, the regulated system of access, has only been around. It was only created at the very end of 2013. So we are 3 years in to the establishment and to growing and developing a licensed industry that's capable of producing quality-controlled cannabis. I think it's reasonable to appreciate that it will take a bit more time. As other panelists have indicated, licensed producers have, in their own right, been funding research in conjunction with universities across the country. We do have, I think, close to 12 universities that are undertaking research, preclinical, clinical, and other research that in the area of cannabis for medical purposes. So it's emerging, it's starting. Perhaps we can give it time to see if it will succeed. The process we have in place for approval of drugs, it works. So I think we can.
Thank you. Yes.
Okay.
Time's up. That completes our first round of 7-minute questions. We'll now go to a round of 5-minute questions, and we're going to start with Ms. Gladue.
Thank you, Chair, and thank you to all of our witnesses. I'm well acquainted with the excellent controls in the medical cannabis regime. Now, a question for Ms. Brogdon. We had a witness last night allege that because of the way we've implemented medical marijuana in Canada, it actually is causing us to violate 3 international treaties. Is that even true?
I guess acknowledge, of course, that Canada is signatory to 3 international conventions, and quite aware of our obligations and take those obligations quite seriously. With this new legislation, I think the government has made pretty clear that its intention is to put public health and safety first. That's why it's seeking to put in place a new, more effective control framework. We recognize, of course, that there will be questions raised about our international obligations. I think our focus right now at this point in time, given that the legislation has only been introduced and the study has just begun in Parliament, which is an important part of our democratic process, our focus right now is on reaching out to those international partners, explaining the content of the legislation, what the government's objectives are, and what it is that we're seeking to do so that is well understood. And I think that we're also trying to help our partners understand the situation that Canada has in Canada, that exists in Canada today, in terms of youth use, in terms of the illegal market and what that represents. And that is, I think, the focus of our efforts at this point in time.
Okay, so you don't think we're out of compliance now? It's just a question of whether the legislation will complicate that.
I'm not the best person that's not my background, to express an opinion or advise you on whether we are or we aren't in compliance at this point.
Okay. Well, let me switch gears then. One of the things that we've heard consistently is that we need to have public awareness and education on cannabis and on its impacts, and it should be directed at parents, it should be directed at youth. So what is the current status of the development of the public awareness program within the Department of Health and the rollout?
Okay, thank you for that question. So proactive public education and awareness activities, is very important, and the government, considers that a central feature of its approach to protecting health and safety and minimizing the risks of cannabis use. That's why the government made an initial investment in the most recent budget of $9.6 million, so that we could begin those public education and awareness activities now. A significant focus of our efforts at this point in time are to reach out to young people and to parents of young people and others who influence them, to encourage them to have conversations about the risks of cannabis use and the dangers to their safety of driving or driving with others who might be impaired.
Specific programs, like are there specific packages that people can access or?
Sure. Well, one good example, which you might have heard about earlier this week, would be from Drug Free Kids Canada. Health Canada has been working with them. They produced a quite excellent guide.
Yeah, we heard about them because
parents.
they've gone to 100,000, I think, parents.
Yes.
That.
Yeah, they have.
Okay.
They have.
What about the young people, the education for them?
Education for them. So we have produced a number of information pieces for them that's available on our website. We've been promoting that through social media since last January with a very high take-up rate through all of the ways that we most commonly kids like to get their information on their mobile devices. So we're very cognizant that we need to do that. We're in the midst of preparing some educational videos now that would be available on YouTube, which is also another way that kids really like to be able to get that kind of information. Really being focused on presenting the facts. We've done some public opinion research on young people and how they like to get information. They really want to have the facts and make up their own mind. They don't want preachy messages. So we're going to make every effort to actually engage youth in the further development of our campaign.
Okay, very good. Thanks. One last question, and this one I think for Ms. Black. So one of the concerns I have is that when recreational cannabis becomes legal, and it sort of looks to me like the same situation that happens when pharmaceutical drugs that used to be behind the counter end up being available in all the pharmacies anywhere, and then health benefit companies quit covering them. Do you think there is a potential for that to happen with medical cannabis?
I'm afraid I don't totally understand your question because cannabis doesn't currently have any coverage. So can you reframe the question for me so I can try to do a better job of answering it?
This is news to me then. So no health benefit company will reimburse.
There's very few. Jonathan is a bit more of an expert in it. There's a small handful of patients across the country that have managed to advocate for themselves to acquire cost coverage for their medical cannabis, but it's very rare, which is why a lot of the recommendations that Jonathan and I are both making are to make systematic changes, including my suggestion that the federal government include medical cannabis in the health plan for your own employees as a leadership initiative, because this is one of the greatest struggles that patients are facing. I mean, there are 2 federal employees in the room today who are going, massively into debt and looking at remortgaging their homes to be able to acquire the amount of medicine that they need.
Okay, very good. Thank you. Got time?
Thank you very much. We'll now go to Ms. Sidhu.
My questions to Ms. Bogdan. You said the cannabis could be classified as a therapeutic product with the drug identification number if a business applies. Is this a hard process to apply for?
Is it a hard process to apply for?
Mm-hmm. We heard from our witnesses earlier there's educational certificate when they are doing it. Is there any system set up for them when they are applying for that license? Or, I imagine more companies might be willing to do so. They can apply, but is there any system set up there? They have to is educating for the
on how to apply to market a drug in Canada, do you mean?
Yeah, to take a license when they are doing. When they are applying for that.
When they apply for that
license.
So when they're applying to market the drug, I have to say I'm not responsible for that program in particular. So
Is there any educational campaign?
To help companies apply? I don't believe so, but I would imagine, I'm almost certain that there would be information available on Health Canada's website about how to apply to seek a market authorization and the requirements that companies have to fulfill in submitting the application. I mentioned some of the requirements already, the need for preclinical and clinical studies. So that's the actual research that will demonstrate the efficacy and the quality and the safety of the product. And they also have to provide details on how it will be produced, how it will be packaged, labeled, and additional information about the therapeutic claims and any side effects of the drugs. So those are the kinds of things they need to submit. But I'm sure that there is information that's available to them, and public servants are usually pretty good at helping people when they need information to apply. So I would imagine that we try to be as helpful as we can.
And I also heard the authorization number and DIN number. So is there any, right now on DIN number, there's a prescription fee. So authorization number, is there any fee available? Like when medicinal marijuana, if they got the DIN number, is there any extra prescription fee will be there?
So right now under the...
When it's going to be legal after that, I'm talking.
Will there be an additional fee? Maybe I'll answer your question by saying how it is now. So now if a person wishes to access cannabis for medical purposes, they go to their doctor and they get a document which the doctor will fill out, and we provide an example, or we'll take something as long as they give the right information. And that's a medical authorization. So it's not a prescription. As Ms. Black was explaining earlier, a prescription can only be used for a drug that is authorized for sale in Canada, right? So we have an equivalent, which is a document that the doctor signs that clearly indicates how much they're authorized to use, and we'll sign and date that and for what period of time. And that is what an individual would take to a licensed producer to register and then be able to access cannabis.
Next question is the maintain quality control. Is there any recall process in place?
In the event that there's necessary, absolutely. There are rules in the regulations that would give Health Canada the power, if it needed to require a mandatory recall. In most of the instances of recalls that we've seen since the system began, those recalls, when companies discover instances or concerns, they will undertake a voluntary recall. They're quite conscious of their obligations under the regulations and not putting public health and safety at risk, and so they will initiate those recalls, as a precautionary measure. In any instances that we've uncovered through our inspections, that's how it's happened.
So how we can regulate the similar price? Like someone say it's a $4.54 a gram, and we also heard it's a $10 per gram. So how we can regulate the similar price? Is there any system in the place?
Right. In terms of the price prices of licensed producers, so I guess the first thing I would say is that we keep a very close eye on availability, pricing, and the variety of cannabis that's available in the market. Licensed producers are required to report to us, I think David will help me, on a monthly basis. Yeah. On a monthly basis, and it's through that collecting of systematic data and a number of other sources that we keep an eye on what is going on. In terms of the price that's available now from suppliers, the average price is about $9 But licensed producers offer a range of products that can be between $4 and $18 per gram, depending on what the product is and the format in which it is sold. Thank you.
Thanks very much. Now we go to Dr. Carey.
Thank you very much, Mr. Chair. And again, thank you very much for the witnesses for being here today. Very, very good testimony. And I want to express the importance, like you pointed out, the difference between medicinal marijuana and the recreational marijuana, because I think everybody around the table here, we want to make sure that we ensure the health and safety of Canadians. But many people using medicinal marijuana are very ill. And before this business, I'm a chiropractor, and I saw a lot of people with chronic pain after years of whether it's just non-steroidal anti-inflammatories. They've chosen to move into marijuana with much less side effects and much better results. So there's definitely a really good role here in our healthcare system. But again, looking about the health and safety of Canadians, I know people have brought up home cultivation and quality control inspection. I know Health Canada, even a huge bureaucracy, we've had issues, mentioned recalls. There's been marijuana made available to patients that had fungicides, pesticides, carcinogens in it. And the worry is, even with medicinal marijuana, there seems to be a challenge to make sure that that's inspected and make sure it's safe. So I wanted to ask you about homegrown and about quality control, because really, how do you manage that? And should there be, or is there a difference between home growing for medicinal use and home growing for recreational use? Do you have comments on that?
So in terms of medicinal use, we definitely have comments. Health Canada has taken steps over the past 6 months or year or so to allow patients who are authorized to home grow to be able to submit their products to a lab for testing. Of course, there's issues with affordability. Testing at a lab is difficult for patients, and lots of people are producing at home because of affordability, so it's inaccessible in lots of ways, even though we do commend them for taking that step, because before patients had no testing abilities. And in terms of the health and safety risks, I would say that lots of this, as we move out of prohibition, should fall under bylaws, safety codes, those kinds of things, to ensure people are having safe wirings, but and no fire risk. But it definitely can be done safely. It just, people need to have proper education on how to do so.
All right, Madame Black, do you have a comment on that or no?
No, I think Jonathan covered it.
That one of the things we've heard, we heard from Colorado, and when we're talking about recreational use. The comment was made when we did it, we're like flying a plane while building it. And one of the things they asked us to do, or advised us to do, is not to do the same, slow down, make sure that you get it right. They recommended that we have things in place like public education, baseline data and data collection abilities, treatment research. And I notice in your recommendations, both of you are recommending more money for research. And really, with 288 days, a lot of the witnesses are kind of wondering, is this an opportunity lost? I was wondering if you could comment, because you are on the ground, you're helping patients. Do you have access to programs through Health Canada or the government if you're trying to educate your patients? If it's anything from how to do a proper homegrown, for example, or how to utilize it? Data collection, so that when you're dealing with patients, you can actually say patient A has had, vaporized marijuana versus smoked marijuana versus edible marijuana. What are the dosages? What kind of effects are out there? And looking at this as a baseline so that the recreational market can utilize that data and make sure that it's even safer labeling and recommendations moving forward. Are you guys having access to those type of programs or funds right at this time?
So at this time for the Compassion Club, no, we've been engaged in civil disobedience for 20 years. And so we don't engage in official research with the government in any way. We don't receive any kind of government subsidies. And just speaking of subsidies, I just want to segue a little bit to just let you know that the employees at the Compassion Club generally earn less than $25,000 a year. So, we're talking about people that are really working for very little to provide these additional healthcare services. In terms of data collection, because we haven't had access to cannabinoid testing, we haven't been able to collect data that will give us correlations between cannabinoid profiles and symptom management. What we are able to do within our own, sort of little bubble is that we keep immaculate records of what the clients are consuming. So anything that a patient is consuming, we know all the way back until if they registered with us 18 years ago, we have a profile on them of every single thing, every time they ever procured something from us. And if they have any feedback for us about what worked for them or what didn't work, it can get put down in their patient profile. Now, we haven't, brought all of that data together, but we've been creating it in a way that we can really create specialized patient service on a one-on-one basis. But I would say that we are an organization that is ripe for working with a research organization. We, having the huge patient base and the incredible amount of experience that we have.
I think you have valuable experience there, and like I said, there's 288 days left before this moves in. And it's just, I think you would agree then with Colorado, it would be good if we had these resources and baseline data available as we move forward, eh?
Well, and I think even more so than data, what's important is the common sense education around maximizing benefits and minimizing risk.
Yes.
And that's a place where we have a tremendous body of knowledge, and there are, pretty simple recommendations that you can give people around how to avoid adverse effects with ingesting cannabis, how to make sure you're not driving impaired, how to make sure that you're not operating machinery while impaired. These are things that we have been navigating for 20 years.
Thank you.
Okay, now we go to Mr. Oliver.
Thank you very much. The questioning, Ms. Bogdan, around, we heard from witness after witness after witness. It's been a long journey since we saw you Monday morning. But the importance of public education on this and getting it going now is absolutely paramount. So it's great to hear the initiatives that are there. And you're right, there was a very good presentation from the one group, and they had produced quite an excellent document, which I'm going to take home with me and use, because the way they had you speaking to youth about marijuana was a very thoughtful approach. So thank you for that. Bill C-45 is quiet, though, on public education. Some jurisdictions, I think, suggested that they were sort of mandated to take a percentage of the proceeds from the sale of marijuana or cannabis for education. Are you happy with C-45 as it is now? And I guess the educational component, the public health message, resides elsewhere in the health department and will be a continuing, ongoing strategy for health, or does it need to be in the bill itself, do you think?
Thank you for that question. As I said in the answer to a question from another member, the public education is a very important part of the government strategy. A public health approach, taking a public health approach to cannabis or tobacco, is about maximizing public education and minimizing the risks of use. So, in answer to my question of one of the other honourable members, I talked about, sort of the work that we have underway now, right, to talk to young Canadians about cannabis use, to make sure that they're thinking about the health risks. That's the part of the work that we're doing now. Our work will turn in the weeks and months ahead, planning for the prospective, if this bill is passed by Parliament, to do as other members have suggested and other witnesses before this committee, and perhaps working, in concert with other partners who have this to get additional information out.
I'd encourage you, whether the bill passes or not, given the prevalence of the use of marijuana in youth, the more you're doing and health is doing, getting those public messages out, the better. And the sooner and the more, the better. I just wanted to change. So I understand from the BC Compassion Club Society, their recommendation number 5, that edibles are not illegal, are not yet a permitted form from the licensed manufacturers. Is that right?
Well, this is where there's some Licensed producers are able to distribute cannabis oil that is not for inhalation, but that is used for consumption.
Yes.
So you can take the oil directly
So you can buy the
on
oil
a
in
spoon
mint,
or a syringe, or you can take it home and produce baked goods out
But
of
in
it.
terms of some of the other things we've heard from other jurisdictions like Colorado, where there's quite a robust
No,
market.
when we talk
you know.
about edible products other than infused oils, they are not currently allowed from the licensed producers.
So one of the concerns, this has been a very prevalent concern raised by witnesses, that edibles should be part of Bill C-45, and for some very good public health reasons. One, because otherwise people are primarily going to be smoking and inhaling, and because the black market or the other market has competing goods in this area. So what we heard, I think, on Monday was that it was too soon, that the experience from Colorado was that launching edibles would take some time, and there was complex regulation, so it wasn't included. But it's been 3 years now, and I'm sure that the medical marijuana users have been advocating for, manufactured edibles for some time now, for 3 or 4 years. So it leads me to wonder what's happened. Like, why hasn't health addressed this? Or you just don't think it's an important component of the market? Or why haven't you addressed it for the medical marijuana group, and then you would have had the regulations and things ready for recreational?
I guess what I would offer is that the enabling the production of cannabis oil, when the licensed industry first began, it was only for dried cannabis. And enabling licensed producers to begin producing cannabis oil is a relatively recent feature of the system, addition to the system, in part in response to a federal court decision. It would be the summer of 2015, I believe. A year before I started this job, if I got that right. So we have really focused on, we put those regulations in place, which allow producers to produce cannabis oil, as Ms. Black mentioned, in a variety of different forms, and have been working with those who are interested in increasing the supply of that. So I think that has really been a focus, is, enabling those licensed producers that want to increase that.
But I think you'd agree that
it's available.
Colorado, I know you've been down there, they have an incredibly diverse range of edible products.
Absolutely.
And why haven't you allowed that to develop, or why hasn't Health Canada come out with guidelines around that for at least the medical marijuana consumption?
Well, as I said, we haven't contemplated, authorizing a broader range of products.
And why is that?
Why is that? I think we were focused on enabling, the cannabis oil. And building that industry, putting those regulations in place. We were focused on that. Our minds might have turned to looking at other products. And then with the change of government and a commitment to legalize and strictly regulate it, I think we've put some energy and attention into that, supporting the government on that.
So there's no other reason why you wouldn't be proceeding with edible products, then? There's no other...
No, absolutely not. I mean, that is, I think we recognize, as many of the witnesses before this committee have this week, that we should be doing everything possible to enable people to consume cannabis in ways that will be safer methods of consumption, and will minimize the harms. That is why this legislation contemplates bringing into force regulations for products, such as edibles or concentrates and other things. I think, so that's contemplated by this bill.
Great. Thank you very much.
Sorry.
Mr. Davies. Well, Ms. Bogdan, the curiosity to me is that, yes, the legislation contemplates edibles, but it doesn't legalize it. And we're the Health Committee, you're the ADM of Health. Is it not the case that smoking cannabis is the least healthy way of ingesting cannabis?
Absolutely.
Yet, ironically, that's C-45. The focus of it is to break out, first and foremost, smoking cannabis, which is the least healthy way to do it, and leaving edibles and other products that are many patients prefer because they don't have to smoke. We're leaving that for a future day down the road. That strikes me as perverse from a health point of view.
So. Could I respond to that?
Yes, please.
Okay.
Yeah.
So the legislation contemplates a range of products when the legislation comes into force, there will be both dried, which, as some of the panelists here today have acknowledged, people are consuming it by vaporizing and things like that. But more importantly, it will also enable people to access cannabis oil, which is produced under strict regulated circumstances. You can ingest it either by drinking it. You can put it in your tea. People can bake it into baked goods. There are many different ways that they consume it, but it's very important that as of next July, people will have access to a regulated, quality-controlled supply of cannabis oil, which is a healthier way to, if they choose to ingest it, if they choose to use cannabis, a healthier way to do that.
My understanding is that the problems with the oil when it comes to vaping is that the THC percentage of 3% mean that vaporizing that THC at that concentration is not sufficient to give people the concentration of THC that they'll need. And the other thing, of course, is by leaving that oil to be produced by Canadians, I guess, in their kitchens, we really don't control then the mold and the sanitation and the concentration and dosage, the child-proof containers that those products may end up in, I guess is my point. But
Could I respond to that,
I'm going to
Mr.
just
Chair?
turn Ms. Bogdan, because I want to have a couple of questions for Ms. Black in my limited time. Ms. Black, I wanted to ask you about advertising. One of your recommendations is to ensure that advertising restrictions do not unduly limit the capacity for service providers to provide education and convey product characteristics and help instill consumer confidence in this new regulation. Now, we've heard some testimony that really sets a very, very dire message to this committee about advertising. And, we don't want it in sports facilities. We don't want it on billboards. We don't want to convey lifestyle advertising. I understand that. What is your testimony? What do you mean by your recommendation?
Thank you for the question. Before I answer it, may I clarify something for your previous question?
Yes.
So the restrictions, as I understand them, I just want to be clear that the restrictions in the oils that are currently available, they're not for vaporizing. So those are for ingestion only. I also just wanted to make a comment that we sort of like that. Inhalation is a very important mode of administration, and it can be done very safely when a vaporizer is used properly. I want to make sure that we're not demonizing it in terms of patients. Using inhalation and the immediate onset of symptom relief is very important. My understanding is that the restrictions in the ACMPR currently is 30 milligrams of THC per milliliter. I'm not quite sure where the 3% number came from, and 30 milligrams of THC is quite a lot. When I'm teaching patients how to use cannabis for the first time, if they're using oil, I have them start with 2.5 milligrams and wait till the next day before they increase it. So I just wanted to clarify that. In terms of advertising, I mean, from the Compassion Club perspective, we would like to be able to do more patient outreach. We have always worked very hard to be compliant with every bylaw, every little law we can possibly be compliant with while we break the big ones. So we don't do any patient outreach into other patient groups that could really benefit from our services because we don't want to be contravening any of the advertising regulations. 2 years ago, we received a letter from Health Canada that was fairly heavy-handed in terms of informing us that the menu that we had on our website and on our telephone line, that if we didn't immediately cease and desist, there was going to be $1 million worth of fines and years in jail. And so we immediately complied. So most of the other unregulated dispensaries in Vancouver and the online ones have not complied in the same way that we have. And as a result, we are losing revenue quite significantly, which is impacting our ability to provide patient services. And I would suggest that the same thing will happen for the legal market. If the legal market is handcuffed in terms of being able to talk about the effects of the products, or to be able to talk about the qualities of the products, or even the nature of the company who has produced them, that you're going to give a substantial advantage to players that are producing cannabis in an unregulated market.
Thank you. Just quickly, so is vape... Oh,
sorry, time's up. But I do want to give Ms. Bogdan a chance to answer a question. I think you You wanted to make a comment a while ago?
Actually, I think Ms. Black provided the precision that I wanted to. That the cannabis oil is quality controlled and it's actually ingested. It wouldn't be inhaled. That people are available, and the 30 milligrams per milliliter, and that is actually a significant quality controlled dose that would be available.
That brings to an end our normal circuit of questions. But I had a question for Ms. Black. What, in your opinion, why will nobody apply to have medical marijuana listed and assigned a number?
So this is not my area of expertise, but from a layperson, my understanding is that when you are applying for a drug approval status and you have to go through human clinical trials, that you have to do that with each individual active ingredient in the medicine that you're looking to get approval for. So cannabis has over 80 active cannabinoids, and then there's a whole other class of active ingredients called terpenoids or terpenes, which are responsible for the flavor and the smell that distinguish the strains. But we're starting to understand, emerging evidence is showing us that the terpenes also interact with our endocannabinoid system and have therapeutic effects. So my understanding is that cannabis is a very complex plant, and it doesn't fit easily into the pathway of the way that we regulate pharmaceutical medicines, which are often single active ingredients. So it's a plant, it has many of these different active ingredients, and again, not my area of expertise, but I also understand that you have to go through clinical trials for each one of the indications that you're looking for approval for, and cannabis is used for such an incredibly wide range of symptoms.
Okay, thanks
So
very much.
maybe we'll be able to put our heads together and see if we can come up with a solution and find a way forward.
Well, if we can help you, we'd like to do that. Now, I'm getting all kinds of signals from over here, hand signals and...
You know what I'm going to say. We have some time remaining, and so I would like to seek unanimous consent. Now, here's the twist, to have each party have 5 minutes to ask questions.
Each party to have 5 minutes to ask questions. Well, if you want to, we'll go back to the original round one, which is 5-minute questions.
I would accept that amendment.
Is there unanimous consent? No unanimous consent, so we can't.
All right.
All right, well, that brings to a close our meeting, and again, I want to, on behalf of the committee, you're great witnesses, and I especially want to thank Mr. Zaid and Madame Elisma for sharing your personal stories with us, because these are the stories that really mean something to us, and you've made a difference. You've made a difference here by coming today and testifying, so I want to thank you all for your testimony on behalf of all the members of the committee. So I hereby suspend the meeting, and when do we come back?
1:45.
1:45, we're back. Only good. To order. This is meeting number 68 of the Standing Committee on Health in the 42nd Parliament. And pursuant to order reference of Thursday, June the 8th, we're studying an act respecting cannabis. And we welcome our guests. Our focus of our meeting, on this panel, is the municipalities and the impact on municipalities and the challenges they will face. And for witnesses, we have from the Alberta Urban Municipalities Association, we have Ms. Lisa Holmes, President. Welcome. From Cannabis Culture, we have Jody Emery and Mark Emery. Welcome. And by video conference from the Federation of Canadian Municipalities, we have Brock Carlton, Chief Executive Officer, who's in Fort McMurray, along with his friend Bill Karsten, the second Vice President and also Councillor from the Municipality of Halifax. By video conference, they're both at Fort McMurray, and we'll be hearing from you shortly. But the way we start is we offer each organization 10 minutes for an opening statement. And then we go to questions. So we'll start in the order that I introduced you with the Alberta Urban Municipalities Association. Mayor Emery, if you would give us your thoughts for 10 minutes.
Thank you very much. Good afternoon, and thank you for the opportunity to address your committee today. My name is Lisa Holmes. I am the Mayor of Morinville, Alberta, and the President of the Alberta Urban Municipalities Association, which is also known as AUMA. AUMA is an association of all urban municipalities in Alberta, spanning all types of villages, towns, and cities, including Edmonton and Calgary, who collectively are home to almost 90% of Alberta's population. AUMA was the first provincial association of municipalities in Canada to take action on addressing the potential health and safety implications coming from the legalization of cannabis. Several years ago, we struck a working group to develop recommendations relating to medical cannabis production facilities and actions to address illegal grow-ops. Since then, and since the announcement of the government's desire to legalize cannabis, we have been working with other associations across Canada to proactively identify the importance of an integrated approach between the federal, provincial, and municipal governments on the implementation of Bill C-45. It is our desire to find ways for our three levels of government to collectively ensure appropriate systems are in place to educate the public, restrict inappropriate usage, address health and safety issues, and enable coordinated enforcement. Our concern is with the timing of these conversations taking place. AUMA strongly supports a slower timeline for implementing this legislation, given the complex nature of the health and safety issues that need to be resolved and the need for comprehensive and coordinated legislation by all three levels of government. The speed at which the federal government intends to move ahead puts our local communities at risk. The federal government must lead this process at a much more measured pace and allow both provincial and municipal governments to work together to create an appropriate framework for each province. The provincial regulations, including those related to alcohol and drugs, traffic safety and employment standards, need to be developed well in advance of the federal implementation date. To be frank, with this issue, we do not feel at AUMA that municipalities are being treated as an equal partner at the planning table. And it is imperative that all three levels of government should be given appropriate time and support in order to prepare all of the required regulations and bylaws that are necessary for the areas we are each responsible for. Municipalities will be at the front line of this. We are the level of government that's within the local community. We are operating closest to the people, and we will be the ones that have to implement, enforce, and address the impacts of this new regulatory regime. Our members are concerned about the downloading of these new duties related to cannabis legislation without accompanying resources to ensure that the duties, particularly enforcement, can be effectively conducted. Funding and resources must be made available to municipalities to develop capacity and to offset administrative costs around licensing, education, inspection, and enforcement. Equipment and training costs related to enforcement must be fully funded through either a cannabis tax or by the federal or provincial government, so costs are not downloaded onto our local communities. With respect to health and safety matters, AUMA supports the federal task force recommendation around minimum age of purchase, advertising and promotion, packaging and labeling, and public education strategies. That being said, provided municipal governments are engaged in any of these matters impacting them, as legislation and regulations are developed. Public education with respect to potential risks and harms of cannabis must be a political and policy priority for this federal government. We support early and intensive public education as well as an approach to packaging, marketing, and advertising similar to that of tobacco in order to limit the appeal of cannabis to youth. These health and safety issues span the production, distribution, and consumption of cannabis. For example, municipalities had been advocating for sufficient fire and building code changes to regulate the growth of cannabis, particularly in residential properties, so that current and prospective property owners are protected from the adverse effects that a home grow can create. As well, the sale of cannabis products need to be carefully considered to ensure it eliminates the illegal drug market, while not occurring in a way that is dangerous to youth or others in our communities. Municipalities will work with you to do that by setting out restrictions on where cannabis is publicly consumed. But however, around 96% of the urban municipalities in Alberta have yet to enact bylaws or policies that regulate the use of cannabis in their communities, because the lack of information and certainty around what will be included in the regulations, both federally and provincially, don't allow us to move forward. And most of the municipalities that have started to work on this have only extended their current policy and bylaw around smoking to include smoking cannabis products. There is a significant amount of work we have to do, and municipalities will be left with little or no time after the federal and provincial frameworks are adopted in order to put our own bylaws and policies in place that are necessary to keep our communities safe. Again, it is our belief that production, distribution, and consumption of cannabis raises significant health and safety concerns in the local community. Given that actual enforcement will take place at the local level, the federal government should engage with municipal governments and police forces to determine the best method of achieving their overarching objective to minimize harm. AUMA did a survey of our membership and found the #1 issue that urban municipalities in Alberta are concerned about regarding this legislation is public safety issues, such as impaired driving and policing and enforcement. Given the limitations within the current testing available for cannabis impairment, AUMA believes the additional rules to discourage drug-impaired driving, such as a per-se limit, should not be put into place until there is a robust body of evidence and reliable testing mechanism to support the measurement of impairment at a time a person is driving. We recommend the federal government invest in research to better link drug levels with impairment and crash risk, and a national comprehensive public education strategy to send a clear message that cannabis causes impairment and the best way to avoid driving impaired is not to consume. In Alberta, our protective services do not just include the RCMP, but also municipal police forces, community peace officers, and bylaw officers. All of these groups must be a component of the enforcement activities and require funded training and equipment relating to traffic safety, so they can detain potential offenders until other law enforcement agencies can validate and, if necessary, lay charges. The training and equipment required is very expensive, and that is not a cost our municipalities, especially the small ones, can absorb. It is concerning to us as municipal elected officials to hear from the RCMP that we contract to police our communities that they will not have enough time to train their officers before the July 2018 implementation date. Without that training and the equipment necessary for the enforcement of these regulations, the laws and bylaws, there is a lack of confidence from Alberta municipalities that we can meet one of our core mandates, ensuring the highest degree of safety and security for our community. Again, I offer our suggestion that the federal government take a measured and phased-in approach to cannabis legislation. This approach is essential, as we are working within a complex environment. And although many of us are trying to predict what will happen, none of us can claim to know exactly what outcomes will arise as a result of this legislation. This approach will provide opportunity to adjust strategies as required after all 3 levels of government and the stakeholders have the time to assess how this legislation and corresponding regulations will impact them. Our main ask is simple: slow down, learn from other jurisdictions, and provide time for all of us to get this right the first time. I appreciate this opportunity to bring forward the comments from AUMA, and I'm available if you have questions. Thank you.
Thank you, Mayor Holmes. Now we go to cannabis culture for 10 minutes. I believe, Mark Emery, you're going to open for 5 minutes and then share 5 minutes. Okay.
I look forward to the 5, Mr. Chair. And thank you for inviting us. We are from Cannabis Culture, which is an activist organization since 1994 that's been dedicated to overgrowing this government, which in our language is to legalize this government. I said overgrow, not the throw. And It's important, all due respect that this is the Health Committee, but marijuana is one of the safest substances on earth. And I walk down Spark Street, and it's safer than every product they're selling there. It's safer than candy. It's safer than eating at McDonald's. It's safer than prescription drugs, tobacco, alcohol, all of which is commonly available on this street. It's safer than cheerleading in high school. It's safer than football in high school. It's safer than hockey in high school. You could rarely make a more safe choice than choosing to use cannabis for whatever reason. And that's why I think it's wholly unworthy of a parliament to spend a whole week discussing the health concerns of a substance that has not killed anybody while being supplied by the free market, some call it the black market, for the last 50 years. Imagine, can you conceptualize any other product that hasn't killed anyone in 50 years? Cars kill people all the time, alcohol, tobacco, prescription drugs, foods kill people, obesity kills people. Everything you do in the society out there, exercising your own bodily autonomy, guaranteed to us by the Supreme Court in the Morgentaler case, to control our own bodies, there are few things you could take that are not more harmful than cannabis. In fact, even government-approved water in Walkerton, Ontario, has killed 8 people. So water is more dangerous than marijuana, realistically. This should be at the Justice Committee. And the reason is I've been in 36 prisons and jails for pot. I was exiled by my own government for 5 years to the United States for selling seeds by mail. Can you imagine? This country was founded on agriculture and farming, and yet I spent 5 years in jail, co-authorized by my own government, because I sent seeds to willing adults to plant plants. We've come to this. The Justice Committee should be looking at this because 2,400,000 Canadians have been criminalized with charges of cannabis offenses since 1965. There is nothing else in this country remotely close to 2.4 million people getting charged for doing something they love, which is growing or selling or consuming marijuana, and harming no one else. If we've got organized crime in there, it's because you created it. Had you not criminalized marijuana, nobody would be handling marijuana except organized, regular retailers in our usual business regime. So you're the problem. You're at fault. We've had prohibition for 93 years. I've never seen Parliament modernize it or ameliorate the terrible things in any of that time. I spent 3 months in Saskatoon Correctional for passing one joint. I was sent to the United States for 5 years for sending seeds to Americans. And we have done every manner of disobedience. Like I say, I've been arrested probably at least 27 or 8 times, and I've been jailed 36 times. I've been jailed in 9 out of 10 provinces for my activism. I've seen prisons in this country. And we need to get rid of this criminalization. And the legalization that everybody really wanted when we thought we were electing Mr. Trudeau and his platform was simply the way it was brought in. In 1923, the Justice Minister got up in the Parliament and said, "Mr. Speaker, we've added a new drug to the schedule." And that was it. No other discussion, nothing else. So you can legalize it in the exact same way. Mr. Speaker, we've removed cannabis from the schedule. That's the only legalization that's really permissible. It's the only one that's really legalization. Everything else is a recriminalization. In fact, I dare say there are more criminal offenses in the new Cannabis Act than there currently are in the existing legislation. So you're actually broadening it to include more people with more offenses, and virtually everybody who needs to be legalized, all the growers in this country, all the sellers, and all the consumers, they will still be criminalized under this Cannabis Act. Only licensed producers, a very small minority, are going to be allowed to grow marijuana. You can't possess marijuana that doesn't even come from a licensed producer or some Ontario government monopoly or Quebec government monopoly or New Brunswick government monopoly as they're going. So now, before at least we were only criminalized. Now we're going to be criminalized and exploited by our own governments. We're going to be used as a cash cow, having our own culture usurped from us and handed over to a bunch of bureaucrats and politicians who probably never smoked pot in their life, don't understand anything about these people, don't understand anything about us, and it's a total insult to about 5 million Canadians who adore this plant, love this plant, use this plant, consume it, sell it, grow it, and have been involved their whole lives like I have in this plant. And to listen to this kind of discussion, the government that's oppressed us is going to come and be our liberators and hand us and dole us out like we're children. Children, we're being condescended to in the worst possible way. We're adults. We make choices. If you're concerned about children, great, deal with that. But for most of the country who smokes marijuana, they're 18 years to 80 years old. Thank you, Mr. Casey. That's 5 minutes. I'll let my wife continue. She's going to tell you how great marijuana is.
I'd like to thank you for inviting me to speak here. And I represent, I believe, the victims of prohibition while I'm here. We've heard from a lot of experts and bureaucrats and a lot of people who have a lot to say, and it's fantastic that we're having this discussion. The idea that we're sitting here today talking about legalization in this country, it means a lot to me personally. I campaigned for the Liberals as a nomination candidate because I believed in legalization. Because not only am I currently a victim of prohibition myself, out on bail before you here after being arrested 6 months ago. But prior to that, I was a drug war widow. I spent years with my husband taken away from me and imprisoned in a foreign country he had never been to, with the Drug Enforcement Administration saying very clearly it was because of his legalization activism and because he gave millions of dollars to legalization reform groups around the world. That's the DEA's own chief, Karen Tandy, and it's a press release you can easily see. So he says it was for seeds, but the U.S. government says it was for legalization activism. We're here to talk about legalizing cannabis, which means we should not have any law enforcement concerns. If it's going to be legal, law enforcement should be able to focus on actual crimes with real victims like rape, assault, murder, theft. I have law enforcement family members. My aunt and uncle are in Alberta with the RCMP and work with MAD. My sister is also with the Vancouver Police Department. I care about law enforcement. I care about the laws. I care about this country and our citizens. But our country and these laws and our citizens are harmed by this prohibition and by any criminalization of cannabis. Even if cannabis was dangerous, even if it killed people every day and contributed to rape and assault and murder of our young adults all across this country like alcohol does, it shouldn't be illegal. We should have the free choice to consume or grow or share a plant that isn't just benign or neutral. As you've heard, it actually helps people. It actually saves lives. And I know we only have a few minutes here, but I want to try and cite, if you'll read my brief, I submitted 10 pages, reduced to 5. But let's look at the actual health impact of cannabis. The American Journal of Medicine in 2013 and the Journal of Health Economics in 2017 said cannabis use reduces obesity. It results in healthier, thinner consumers. The Journal of American Medical Association in 2015 said cannabis is medicine. The Journal of the American Medical Association in 2012 said a 20-year study found no damage to lungs from cannabis. This is backed up by Dr. Donald Tashkin, whom the U.S. government asked to prove it causes lung cancer. They found it actually prevents it. You can go to cancer.gov. The U.S. government says that cannabis and cannabinoids attack and kill cancer cells. They shrink brain cancer cells. That's the Journal of Molecular Cancer Therapies of 2014. You've got the American Journal of Public Health in 2014 saying that cannabis access reduces suicide rates. My father took his life when I was 9. This gold necklace here was his. I was on antidepressants for many years, and they caused me harm. And we heard just yesterday that antidepressants increase suicide rates by 33%. That's why I got off of antidepressants, and I use cannabis instead. I use legal cannabis because I'm out on bail, so I'm not allowed to go to a dispensary, but I'm going to just show you here. This is a marijuana joint. This is what we're here to talk about. This is cannabis, and it's not hurting anybody. But I've been inside the U.S. prison system, and I'll tell you, I didn't cry for myself or my husband as victims of prohibition. I cried for the children and the mothers and the families who were there visiting their loved ones, the little babies who saw their daddy on the other side of the visiting room. And they said, why is my daddy here? He didn't hurt anybody. They say prisoners are bad, but my dad, he's not bad, is he? And the moms are trying not to cry, and these little kids are saying, Mom, please don't cry, please be brave. These are the victims of cannabis prohibition. Cannabis prohibition has far more victims and far more devastation than cannabis ever could. And right now we do have a drug crisis in this country. It's the opioid crisis. None of you here have not heard of it. And you have the United States National Institute on Drug Abuse saying that cannabis dispensaries reduce opioid deaths. You've got so much evidence showing that even the Harvard study of Frontiers in Pharmacology says it improves cognitive functioning. The American Psychological Association in 2015 said teens, even chronic users, do not have later issues. The British Journal, they find cannabis is the safest substance. So I get emotional here because I followed the law. Every year my husband was incarcerated, I had to cross that U.S. border, knowing they could ask me if I used pot and I could be denied the ability to see my husband. And I managed to get through because I followed the rules as closely as I could. And then we decided to engage in peaceful civil disobedience, just like Dr. Henry Morgentaler, who received the Order of Canada for breaking the law to provide a much-needed service. Civil disobedience is the only way we've managed to change these laws in this country with respect to cannabis.
I really appreciate your passion and your commitment to this, and you're going to have lots of chance to answer questions and provide information. But I have to move along to the other speakers.
Absolutely.
But we appreciate your contribution. Okay, now we're going to go to the Federation of Canadian Municipalities for 10 minutes. I'm not sure, are you going to divide the time, or is one Mr. Karsten? All right.
Yes.
Welcome.
Thank you very much. Thank you very much, Mr. Chair, and thank you for having us here today. And certainly, we also want to thank you for the important work that you and your committee are doing. As we know, Mr. Chair, we are here today to discuss the legislative and regulatory realities of legalizing recreational cannabis in this country. Because there's no doubt you will agree, this needs to roll out safely and effectively for all Canadians. And there's absolutely, however, nothing automatic about this. This will require strong coordination across all orders of government, and the role of local governments, I believe, is critical. FCM's National Board, Mr. Chair, met this week in Wood Buffalo, Alberta, and trust me when I say that Bill C-45 loomed high on the agenda. Further to that meeting, I have clear recommendations to share with you today, but before I do that, and this is how we'll sort of share a little wee bit of the 10 minutes, I would like to introduce to you FCM's Chief Executive Officer, Brock Carleton, and I'd like to pass the next few minutes over to him.
Right.
Brock?
Thanks very much, Bill. As you may know, FCM's 2,000 member municipalities represent 90% of Canadians in every region and province and territory, big cities, rural towns, and northern and remote areas. Our communities are where people live, work, raise their families. Often when federal plans move forward, this is where the rubber hits the road. De toute évidence, c'est dans nos collectivités.
Clearly, it is in our communities that cannabis will be sold and used. Municipal governments will be therefore on the front lines when regulations will come into force throughout Canada. FCM members are already your eyes and ears. We know how cannabis regulations are applied, both for medicinal and illicit marijuana in a rapidly evolving market. And we know how changes can either improve or upset cities and municipalities across Canada. Canadians need this local expertise to help create legislation on recreational cannabis use. On the local level, enforcing this new legislation will be a monumental task. And this task will hinge greatly on upcoming measures taken by federal and provincial governments. And this is another reason why we have to make sure that municipalities participate in this process and they know what to expect.
Time and again, when the federal government systematically engages with local governments, Canadians win. It's true for infrastructure, for economic growth, for public safety, and it will be true for recreational cannabis. It's important to understand that FCM is ready and a willing partner in moving forward safely and effectively. And now I'd like to turn it back to Vice President Karsten to talk about our specific recommendations.
Great. Thank you very much, Brock. Mr. Chair, before I get started, should you or your committee hear some background noise, we are here in Wood Buffalo, and the building we're at is going to have a huge rally tonight for, what do you call those?
Monster trucks.
Monster trucks, okay? So they're doing a little wee bit of construction here. Again, thank you, Brock. Committee members, the fact is that passing Bill C-45 will trigger an extensive implementation process across all orders of government. And I'd like to place emphasis on what our member from Alberta said, all orders of government. Municipalities will have to adapt local bylaws, rules, and programs as a direct result for things like zoning, land use, business licensing, enforcement, and much more. But much of this work will stem from regulatory frameworks that federal and provincial and territorial governments still have to design and build. FCM is pleased and proud that we have published a legalization primer for our members from coast to coast to coast, and a fuller guideline and guidebook is being initiated and is on its way to our members. These tools will help our municipalities from coast to coast to coast get moving on issues that they can address immediately and build work plans for the remainder. But for the work plans to succeed, Mr. Chair, municipalities need clarity and engagement on a whole range of various issues. So our first recommendation is that federal government coordinate with all orders of government to develop its regulatory framework for Bill C-45. The key, we believe, to meeting a July 2018 launch timeline safely and effectively, and again I emphasize safely and effectively, will be concurrent legislative, regulatory, and bylaw development by all orders of government. We'll inch forward locally based on what we see our federal, provincial, and territory partners doing. And those partners still have important decisions to make in areas such as minimum age for consumption and what kind of retail distribution model to use. There's also much uncertainty in the area of shared responsibility for shared impact that I would like to share with you. Just a short list, things like the personal cultivation issue, workplace health and safety issues, public education, nuisance issues, municipal zoning, municipal authority to zone in cases where federal production facilities may exist, and actually others that we just haven't mentioned and listed here today. The federal government has formalized its consultation with the provinces and territories through a working group. We understand that, and that is a great first step. However, FCM would welcome sustained municipal engagement with this group to align the needs of all governments. As part of this coordination, our second recommendation then, sir, to you and your committee is to prioritize decision points that prevent local governments from moving forward with implementation work. To prioritize those decision points are critical to us safely and effectively moving this forward. There are areas where decisions at the federal, provincial, or territorial levels will drive the local response, such as provincial retail distribution models, rules around personal cultivation, as I've mentioned, First Nation and municipal boundary overlaps, which has been raised by some of our members, the authority to prohibit cannabis use and sales where applicable, and municipal options if cannabis becomes legal federally without provincial or territorial laws and regulations in place. We believe that the federal government should proactively engage with all orders of government in the coming months to ensure roles and responsibilities are very, very clearly defined. So, Mr. Chair, our third recommendation is for federal funding to defray startup costs of local implementation. There's absolutely no doubt that there is an expectation that municipalities will be on the front lines of enforcing issues such as local zoning, density bonusing, or density bylaws rather, things like rules around minimum age of purchase, personal cultivation, issues like position limits, smoking restrictions, and public nuisance complaints, which are bound to happen. Also, as alluded to earlier from the other presentation, safety concerns related to the building code. We believe these are appropriate roles for municipalities and municipalities alone. However, growing into them will definitely impose immediate costs. Municipalities just generally don't have the fiscal flexibility to invest what's needed on the required timeline. And I'm pleased to point out, Mr. Chair, that one of your committee members is in fact a former councillor in a municipality, and that your government and other members of Parliament have also served in that capacity. The federal task force acknowledged that implementation will require new capacity, and it urged federal leadership to ensure all governments grow this capacity before legislation comes into force. Before cannabis revenues start flowing, I will point out that we were pleased to announce that the government did announce funding this week for training. So, Mr. Chair, our fourth recommendation is for a smart revenue sharing model that includes all orders of government. Administration enforcement will impose ongoing costs on local governments. We are looking at additional staff time, resources for training, for public health, for licensing administration, for bylaws, etc. So there's a lot more we could add, obviously. We are equally as passionate about our points and our information as other speakers. So our final recommendation to ensure that slower than hoped cannabis revenues don't jeopardize the regime's safety and effectiveness is, in fact, our final recommendation. A primary objective of the Cannabis Act is to deter criminal activity. And as experts say, the way to starve the black market is to keep the price of legal cannabis low. For this reason, the Parliamentary Budget Officer warns that revenue from cannabis sales may start out small, between 356 and 959 million per year. But local governments, regardless of what that number is, will still face the significant administrative and enforcement costs. And so we need to know that federal support will be available if cannabis revenues takes time to catch up. Really, Mr. Chair, we can summarize our recommendations in two ideas. The federal government should engage municipalities in building its regulatory frameworks and revenue models, and any cannabis regime sustainability depends on equipping local governments with the tools they need to administer and enforce it, out of the gate and long term. We're proud that the municipal sector has a track record of delivering local solutions to national challenges. We look forward to working with the federal government throughout the progression of the Cannabis Act. We thank you for your time, and we also would be happy to take any questions that you may have. Thank you.
Thank you for your presentation and all your points of view. And now we'll go to questions. We'll have a 7-minute question round, and we'll start with Dr. Elson.
Right. Thank you, Chair. Thank you all for coming. I commend the FCM and the AUMA for their work on this. Quite frankly, I'm happy to see that you, both your organizations, had the foresight to be thinking of this beforehand and to be coming here to talk to us about this and to help give us input as to how this needs to be done. In contrast to the provinces, which have reported in the press that they will have trouble meeting our timeline, we invited all of them. All but Saskatchewan declined to appear here, and of the only one that showed up, Saskatchewan said that it wasn't a priority for them at all, and they wouldn't be doing anything on this except for the fact that we have a timeline on them and that they have to deal with it. So in contrast to what we've seen in the input from the provinces, I thank you for, as I say, your foresight in thinking about this beforehand and coming here today. Now, as for the costs, I was going to quote some of the figures, but you already talked about that as to what we have committed to help with law enforcement and training, because we do understand that there's going to be costs to this borne by law enforcement and provinces and municipalities, which is why we've committed to. And I keep having to look at these numbers because I can never commit them to memory, but it's 274 for law enforcement and border efforts, and another 161 million for the training of frontline officers in recognizing impaired driving, because we know that this is going to stretch your resources without this. There's going to be other costs as well, but right now, as the system goes, we have people who are being arrested, charged in courts. We know that's expensive. We know that's costing a lot of money. I'll start with you, Ms. Holmes. Would you not agree that that money is going to be saved to the system? Is that not going to be a substantial saving to our system when we're no longer arresting people for simple and charging them for simple possession?
Well, to be honest, I don't particularly see myself as an expert in the number of cases that would be for a criminal court in Alberta. So I can't say whether or not there would be a significant cost. I just know that in the concern that we have addressed the fact that we think that there will be costs when it comes to enforcement in regards to training and equipment. But beyond that, there will be additional costs as well. And I mean, an example I can give the committee is in smaller municipalities, they have a completely different capacity to be able to absorb these type of legislative changes than in a large city. So in that case, we're going to need to have training for even just municipal councillors on how to create the bylaws that they're going to have to put into place in order to have this happen. So there is cost beyond just enforcement. But that being said, I would anticipate there would be savings. I just can't answer appropriately for whether or not what the amount would be.
Certainly. Okay. And from the Federation of Canadian Municipalities, what are your thoughts on that? Do you see... Go ahead.
Yes, thank you very much. A little delay here. We apologize for that. Much rather be in Ottawa there with you, but can't pull that off today. So our position is that legalization simply will not reduce the workload of our local police services. In fact, with the different issues coming forward, we'll expand them. So to break down what savings there may be, that work really hasn't been done. But overall, we believe that there will be significant costs associated with enforcing all the new rules, such as impaired driving, personal cultivation, possession limits, providing cannabis to minors, those type of issues. So, you know, at the end of the day, we do believe that there's significant cost increases.
So you don't think there's going to be... but you say it's going to increase the workload despite the fact that officers are not going to be arresting for simple possession?
We really do truly believe that based on the other issues that compound their workload.
What would be examples of the things that would increase their workload under this that would more than counterbalance the savings in workload from arresting people for possession?
So, yes, thank you for that. And you know, we have given considerable thought to that. Certainly the impaired driving issue and the testing that needs to be done when it comes to capital costs, equipment that may need to be bought. We certainly do recognize that the federal government has contributed some money, and that's appreciated. But really, we don't believe that that's going to cover all those costs.
Okay, yeah, and that's understandable. Now, another question regarding, again, let's talk about impaired driving. We do know that impaired driving due to cannabis right now is an issue. It's to
add some information when you're finished about impaired driving.
Okay, I want to finish this line of questioning first. We have some issue. You know, we do know it's an issue, and we know it's out there. Right now, we don't have the tools to deal with it, despite the fact that we know it's widespread, and we don't even quite know the extent of it. Would this not be an advantage to your law enforcement officials and to your municipalities that we are now introducing we're now introducing a way to deal with a problem that we haven't really been equipped to deal with up to now? I'll start with you.
So the way that I look at it when it comes to impaired driving is, yes, we do have an issue with it now, but as right now, the average person considers that cannabis is illegal. So when we have it legalized, then I think the public education campaign in regards to looking at impaired driving is going to be key, because there will be an increase, there's no question. And the concern that we have is that we are not confident that there is going to be technology in place on July 1st that will be able to implement into our local police detachments to be able to deal with this. And to give an example, like you were saying about the increase in workload, from what I have been told by RCMP officials in Alberta, an example of how it would impact Morinville is if someone was pulled over suspected of being impaired on cannabis by community peace officer who is able to enforce traffic law, they would then have to call the RCMP in to be able to take that person to a hospital to get a blood test to determine whether or not they are, because as of right now, we don't have technology in place to do any sort of roadside screening. So there would be a workload of having an RCMP officer, of which I only have 9 in a municipality of 10,000, that would have to go and sit in a hospital in a different municipality waiting to find out whether or not the person is impaired. That's as far as I understand it. So there is a significant concern that I have over the increase that we're going to see in impaired driving, the lack of education around it in the public, and then the idea that I don't have information that I've received that we have proper enforcement tools available.
You won't see an increase in impaired driving because of cannabis.
Time's up, but Ms. Emery, you wanted to make a comment?
I understand driving and cannabis is a major issue and a concern, and I am not advocating impaired driving. But the National Highway Traffic Safety Administration of the United States released a report in 2015 that called Drug and Alcohol Crash Risk and did not find an increase in crash risk associated with THC. And even more recently, the American Journal of Public Health, as we are here at the Health Committee, in 2017, July, very recent, please look this up, that changes in motor vehicle crash fatality rates for Washington and Colorado were not statistically different from those in similar states without recreational marijuana legalization. And we do know that police, this is recent studies, so please do look this up. And I'm not encouraging impaired driving, but the vast majority of cannabis consumers are not driving impaired. Their judgment is not impaired like with alcohol. With alcohol, you think you can drive and you know you can't. With cannabis, you know when you can't and you won't drive. But we also have to consider the hundreds of thousands of medical marijuana patients in this country who are unable to drive or contribute or work if they don't use cannabis. So if you criminalize those who drive under the influence of cannabis, you're going to criminalize every patient and poor medical user across this country. What we're also finding is that this targeted harassment, as we've admitted, would require taking someone to a hospital, using a needle, drawing their blood against their will when they don't get to give consent. And for what? To prove that they've consumed cannabis or to prove that they're impaired? Because impairment is proven by performance. Whether you're driving behind the wheel on pharmaceutical drugs that say do not operate heavy machinery or vehicles while using these pills, whether you're angry because you had a fight, or whether you're texting. Texting is proven to increase crashes. We know it. It happened immediately. You can immediately say, cell phones and texting create distracted driving, create increased crashes on the road. It's demonstrable, it's proven. Cannabis, you can't prove it. And that's why the police and law enforcement are falling all over trying to figure out how do we find a test? How do we set a blood limit? And as an official endorser of Washington State's Initiative 502 campaign, I was part of the legalization along with my husband's prosecutor, so you can find common ground with people who worked against you before. But they admitted that they only had a blood level for cannabis because doing so would encourage the public to support that initiative. What we have to acknowledge is that decades of prohibition and misinformation generated by the government and fear about driving cannabis is actually discouraging people from finding out the truth about cannabis. And as I said, American Journal of Public Health 2017 studied this extensively. National Highway Traffic Safety Administration. Cannabis is not a crisis for the roads. Police should be focusing on alcohol and truly dangerous drugs.
Thank you very much. Now we go to Ms. Gladue.
Thank you, Chair, and thank you to our witnesses. Of course, that's contrary to testimony that we heard from Washington, where impaired drug driving increased from 8% to 17% when they legalized. Colorado, that saw a 32% increase, and the increase overall in the U.S. in fatalities due to drug driving. However, my question is for Ms. Holmes. I thought you very nicely pointed out the difficulty in the rushing that's happening with this legislation. With only 288 days left before the government wants to legalize marijuana, we actually have to finish updating C-45, and then the provinces have to come with their legislation that chooses in the areas that we've given flexibility what they're going to do, and then municipalities have to decide how they're going to implement that, all without any funding in all the areas that you've talked about. So the first and most important thing that we heard was public education has to come to parents and youth as well as to society about the hazards of impaired drug driving. And I wondered how much public education has the federal government provided to your municipality, and how much funding for this initiative have they provided?
At this point, specifically to the town of Morinville, we have not received public education funds or any sort of tools. That being said, I know AUMA has been working hard at developing toolkits, and so has the FCM, in order to support municipalities in these areas, as we feel like it is also a local issue as much as it is a federal one.
Thank you. Now, my question is for Bill Karsten with respect to home grow. We heard testimony that there's a lot of concern with home grow. Some of the issues mentioned are 24 times more likely to have fires, issues with mold, electricity stealing, and one issue that was raised where it was an issue of people that are property owners in Ontario or Quebec, where you would not be able to prevent somebody that was renting from you from growing cannabis or smoking or consuming cannabis on your premises. Is this a similar concern to the ones you were indicating?
Well, thank you very much for the question. So personal cultivation is an area that could have many new implications for municipalities across the country, and those need to be properly understood. At this point, it's not clear how this aspect of legislation will be managed, but we foresee municipalities having to respond to health and safety, and as well as you alluded to, nuisance type of concerns. So the message that I'd like to go back to, and that's much like on the other question, I don't think necessarily this should be a debate about, the impaired driving, or in fact, determining all of these things at the committee level. I believe that what we need to send as an organization of municipalities from coast to coast is the message that we need to be involved. We will only know how to tackle these problems, even though we've started. FCM is proud, as I've said, to send out a primer to all of our members, and a guidebook or guideline will be coming out. But we need to be involved with the federal government and understand we do deal on a national level with the federal government now. We've had several meetings and so on, our staff, but we need to be involved in the regulatory framework.
The other question I have has to do with treatment. We've heard a lot about how there's an expectation that, especially with youth, there's a 30% greater increase in schizophrenia, psychotic disorders, depression, and in fact that there are folks that are actually addicted to cannabis, and we need treatment for that. So how well are the municipalities across Canada set up to address the increase that's expected?
Thank you again so much for that question. Obviously, it's a very important question. We unfortunately are not the sector experts on that particular issue. I would hope that provincially each province is looking through their public health folks and their health departments as to how to best deal with that. We really don't have the expertise here.
Same question.
So as it stands, the municipalities in Alberta are not responsible, in essence, for that type of issue because it is health related. That being said, every single issue is a local issue, and everything will rest and lie at our feet when it comes to the end of it. So we will have to work through our FCSS, our Family Community Support Services departments, in order to find some sort of tools to be able to work through this. But we'll just be offering to the province the same thing we're offering to you, is that we will work with them on anything that they need to make sure that they have the regulations in place in order for those things to be addressed.
Okay, and one more municipal question, then I'm going to turn to the Emerys. Do you municipalities feel that you have enough flexibility under C45 to choose where marijuana can be sold and consumed?
So I would certainly address it this way, that again, that's one of the issues that we have looked at, but not understanding what the retail model is going to be from province to province. This is where it becomes somewhat, again, important, and I don't like to sound truthfully like a worn out recording, but we need to have the information, we need to be involved. So being a councillor in Halifax, yes, we've started that, some of that work, but in fact some of that work we're doing is actually quite costly, because we're doing work that we don't know if we're going to utilize or not. So crucially important for me to continue that theme that we can be ready. We've said that from the offset, that we believe as Federation of Canadian Municipalities that we can in fact be ready as willing and able partners.
Okay, I'm running out of time. Can I get an answer from Ms. Holmes on this one, on the flexibility?
Sure. As it stands right now, we again, as Bill was saying, we don't know the details around what we will be able to do. We're hoping, working with the province, that we will be able to establish some municipalities some autonomy in regards to where the facilities will be located, where production facilities will go. There is also the question that there's municipalities in Alberta that do not want to have either production or distribution facilities in their municipality.
Okay.
And so we're asking for that.
And to the Emerys, if C-45 is passed in its current form, will you abide by this new law or continue in civil disobedience?
I'm choosing to follow the law as much as I can because I only engaged in opening up dispensaries last year in April, and that's what I'm currently charged with. I do face potentially life in prison as I sit here before you, which would certainly cost the taxpayers a lot more. I do want to add that with municipalities, we should be looking at allowing the storefronts to operate similar to caffeine, which is an addictive stimulant drug that I can get for free right in the back of the room, or like alcohol. If I want to open a bar or a restaurant and provide alcohol or a craft brewery, the municipal regulations and licensing shouldn't be that restrictive or prohibitive or even costly if done right.
Good.
Mr. Davies.
Thank you to all the witnesses for being here. I want to just start by saying, you know, since the Ledane Commission in the early 70s, the issue of legalization of cannabis has been on the public policy agenda for decades, and I have no illusions that we wouldn't be sitting here today talking about a form of I'm going to call it decriminalization, not legalization, of cannabis without the work of many people who have sacrificed a lot. And I think you, Mr. Emery, and you, Ms. Emery, I can't think of any two people who are more important to hear from on this legislation than from you. I know you've dedicated your lives to this subject and at great personal cost and sacrifice, so I want to just make that comment. Ms. Emery, I want to start with you about just the broad scheme of the bill. You have described this bill as this is not legalization, it's prohibition 2.0. Can you please explain that?
Well, there are three reasons why Canadians came around to support legalization. Number one is that we shouldn't criminalize our fellow Canadians who are otherwise law-abiding. They should not be banned from traveling to the United States or lose their job for failing a drug test or have their kids taken away by Children's Aid. None of that criminalization or harm should happen to peaceful, nonviolent Canadians. Number two, this industry already exists. It's worth billions of dollars. The Fraser Institute and many others have analyzed it and said cannabis should be legal because it already exists. It's already being grown and sold and shared and consumed. It's in every movie and TV show. It's everywhere. It's normalized, except for with the government. So we should allow the existing industry to come out of the shadows and into the light. The third reason to legalize is that law enforcement has spent billions of dollars, billions of our tax dollars on going after people for pot. I'd much prefer that go towards healthcare or education or social housing or anything, or allowing our law enforcement to focus on serious crimes that have victims. But Bill C-45, as it's presented, will not offer amnesty or pardons to people who have been convicted. It will not allow people like my husband and myself to be free from a criminal record. It will not allow the existing industry to transition into legality. In fact, it introduces tougher new penalties and prohibits those who have been victimized by prohibition from being allowed to transition. So we're being locked out from participating and locked up for being unable to participate. The third reason for marijuana legalization being law enforcement spending, well, Friday we saw an announcement of $250 million of additional tax dollars going towards marijuana law enforcement. Well, legalization is supposed to mean you no longer have to enforce a law against it. We know that marijuana law enforcement is extremely costly, and many police officers don't even want to enforce the law, which is why they often don't charge some people, but do charge others. And as Mr. Bill Blair, who is not with us right now, has admitted himself, marijuana prohibition and law enforcement targets people who are of color, the Indigenous groups, the poor, the marginalized. So this bill will not legalize anything that we've been fighting for it.
Other witnesses have pointed out that the bill still contains a criminalized model where if you have more than 30 grams of possession in a public place, you can be subject to criminal sanction. If you have more than 4 plants over 100 centimeters, you can be arrested and serve time selling and other kinds of offenses. Mr. Emery, Justin Trudeau, our Prime Minister, is quoted as saying on getting it right, he said, quote, "We have to create an entire system that controls and regulates marijuana that will include medical marijuana and properly licensed dispensaries." Are we getting it right?
Oh, goodness, no. It's all wrong. And in fact, to answer your colleague's question, will I continue to break the law? Absolutely. Because breaking the law is the only way the cannabis culture has gotten any kind of improvement in their status over the last 20 years. For example, this Parliament banned all books and magazines about marijuana in 1987. That law lasted 7 years until I and some colleagues started distributing books and magazines in front of police stations, and we finally got charged giving out pamphlets to high school students, and we went to Judge J. Ellen MacDonald in the Ontario Superior Court, and she struck that down. So then I started, distributing pamphlets and encouraging everybody to sell bongs and pipes, which were all illegal. And now we have a thriving industry across Canada. And I started selling seeds, which were illegal and probably still are illegal. And I sold millions of them to Americans and Canadians. So we could bypass this government, because the only way to really make pot legal, I thought, was if marijuana was everywhere and everybody had it, then the government would be helpless, which is really why we're here, because we won. We've accomplished that. Marijuana's everywhere. People are growing it. There's stores opening. We don't care if we go to jail. We don't care if you charge us. We're going to do our thing because we love cannabis and we're in the cannabis culture. So I'm going to continue to break these laws because it's terrible. It criminalizes everybody who is supposed to be legalized and then enriches the government monopolies that are being proposed and these wealthy stock market production companies who don't have any relationship to cannabis but just raise money on the stock market, somehow get hand in glove with the Liberal government, and now they're operating and selling marijuana even though people I know who've been doing it 10, 20, 30 years are not going to be offered any such invitation.
I just want, because I'm really curious about your opinion on this. We've already heard Ontario, I think you mentioned Quebec and maybe possibly New Brunswick,
yes,
are moving to a government monopoly system,
yes,
that will clearly freeze out dispensaries. I'm just wondering what you think about that. I mean, will
they can't be. That won't be supportable. I will encourage everybody to boycott the government stores. We will physically try and stop people from going in. We're going to advise them that they're traitors if they go to the government shops, because these are the people that have oppressed us for 50 years. You're going to give your money to the very enemy that's beaten us, killed our animals when they raid us, rounded up our kids, took away our cash, took away our plants, took away our livelihoods. Are you kidding me? We can never let the government be the profiteers of marijuana after all the years that they've abused us, exploited us, and persecuted. It's pure sadism. This cannabis law is pure sadism, the one you're proposing and the one that we've had for 50 years. It's just punishing Canadians for no valid reason.
Move to production, because the task force said that decisions on production, distribution, and retail have clear implications for businesses hoping to enter the cannabis industry, including how to ensure a diversity of participants. It is apparent that there is significant interest and speculation about the potential for new revenues. Supply chain management has significant implications for consumers and communities. Price, product quality, and accessibility can all be affected depending on what route the government chooses to take. So they recommended use licensing and production controls to encourage a diverse, competitive market that also includes small producers. Do you see C-45 accomplishing that recommendation?
Bill C-45 accomplishes no objective whatsoever that is desirable. And the thing is, it's staring us all in the face. If we want the price to plummet where money's not even a factor with marijuana, if we want all Canadians to be treated fairly before the law, if we want to restore civil liberties, if we want to take away all that police power we've given the police for 30, 40 years to wiretap, to surveil, to pose as drug dealers, to do all this sort of stuff that's costing billions of dollars, then just take cannabis out of the schedule. Just remove it from the schedule. Tell everybody that otherwise you have to be law-abiding, peaceful, pay your taxes, pay your employees well, obey all municipal regulations, but basically just treat it like any other normal industry. After all, it hasn't killed anybody for 50 years. There isn't any other industry in this country that's like that. They all put out pollution that kills, or the cars that kill, or the foods that kill, or their drugs that kill, or their tobaccos that kill, or alcohol that kills. Heck, everything is killing Canadians except cannabis, and you want to treat it like it's plutonium. It's insane.
I'd like to add that with one of the major issues of C-45 is that the federal government does control the production. Now, you've all heard of BC Bud. Cannabis has been growing all across this country for a very long time, and the provinces deserve and should have the power and the ability to license their own production agents themselves. If the provinces have to wait on the federal government to supply cannabis, the provincial government stores are going to not have any product on the shelf. We saw Nevada declared a state of emergency, asking for more pot growers to come forward because they sold out in 1 week. And we're seeing it happen all over the world. So you need a lot of supply. You need it everywhere. You need to allow municipalities to license their own craft growers and like craft breweries. You need to allow provinces to do it. And you need to allow the federal government to let it happen. But if the production is controlled federally, distribution provincially, storefronts and policing municipally, of course you've got a big disaster coming. But
only government could think of that plan. Only government. The marketplace would look at that and go in horror. That'll never work.
Also, I'd like to add that if you do allow the provinces the control over setting up pot monopolies, we could call it, instead of allowing Canadian citizens, innovators, entrepreneurs, small business owners, instead of allowing them to create jobs, create tax revenue, and give back to the community, you're going to force every taxpayer to subsidize a multi-hundred-million-dollar government bureaucracy that the government itself admits they will not be able to make money from. They're going to lose money. And again, they don't even know what the product is. Why can they not allow the people who have grown and sold and love this plant, why can't they allow us to come forward and come out of the shadows? Why do you continue to criminalize us?
What do you have against us for 50 years
We
as
have
the
to
big
move
thing?
to Mr. McKinnon now. Thanks very much. Mr. McKinnon.
Thank you, and thank you. I think we'll move to municipal issues for a while. Mayor Karsten, you spoke in terms of needing extensive implementation process, coordinating with all levels of government and so forth. Certainly that's been underway ever since this process began. I know that Parliamentary Secretary Blair has consulted across the country and both to provincial partners as well as municipal. So I think that is underway. Other things like prioritizing decision points, federal funding, and so forth are really out of the scope for what this committee is commissioned to do. Our job is to examine the Bill C-45, which deals really with the treatment of marijuana in terms of whether it's legal or not. It doesn't deal with impairment issues. Impairment issues are dealt with in C-46, which study is going to be underway soon. C-46 does provide additional mechanism, additional tools for detecting and processing impairment situations. So, and I'd like to actually correct the record. Ms. Gledu said that in Colorado the impaired driving rate increased. We have a letter from the governor of Colorado to, and the Attorney General for Colorado to the Attorney General of the United States, saying that in the first 6 months of 2017, impairment actually increased or decreased by 21%. And I take note of Ms. Emery's reference to the National Highway Safety Board, which indicates not a major increase, at least in impairment offenses. So I would suggest that impairment is probably not the issue to talk about in respect to legalization. I guess I'm going to be more specific now. I mean, right now, I know in British Columbia we have situations where growers, illicit growers, will take over, will rent a property and turn it into a grow-op, which is not appropriate for the property, not appropriate for the landlord, and so grow-op, policing grow-op does become an issue. So I think that with this new legislation, that sort of thing will cease. So I would suggest to you that that's a case where this legislation will reduce the load on municipalities, and I would ask all three of you witnesses to, if you would like to testify to that or relation to that. Starting with Mayor Karsten, please.
Great. Thank you very much, Mr. McKinnon. And I have to suggest right up front, thank you very much for the promotion. I'm a councillor in the city of Halifax, and Mayor Mike Savage, former member of Parliament, would not be pleased with me suggesting that I'm the mayor of Halifax. So,
always another election.
Yeah, that's right. Touche. Sir, thank you for those comments. And you know, one thing about the Federation of Canadian Municipalities, we have great respect for the work that the federal government's doing on all files. And I certainly wouldn't want to be combative in responding to your points. They're well taken. The issue, I think, in terms of when you suggest that, yes, we have talked and have had meetings with folks like Mr. Blair, et cetera, we view those more as preliminary consultations as opposed to the ability to really, truly sit down at the table and understand this as it evolves week by week by week. So that's still a message that we have in terms of needing to be at the table and involved all the time. Very interesting point that you make in terms of, yes, the variance between the two companion pieces of legislation, B46, B45, or C45 and C46. We will, in fact, be providing additional information on FCM's position in a forthcoming submission to the House of Justice Committee. So that will be specifically on C46.
Actually, Mayor Holmes, please.
I would concur with Councillor Carson's. I think that there is a significant difference between actually sitting at the table as a partner versus being asked for information as a stakeholder, which is what I consider municipalities are doing. In regards to our invitation here or the meetings we've had with Mr. Blair, we receive a lot of information at the meetings we have with different parliamentarians, but we don't actually get to have a conversation about what our ideas are and how we think things can move forward. Legislation is set, regulations are set, we offer our input through a survey or some sort of letter. So we're really asking for a different model. We're asking for the opportunity to sit at the table and tell you about the concerns that we have, and that's not just with the federal government, it's with the province as well. In Alberta, they've created the Cannabis Secretariat, which is a group of administration from the different ministries, but again, we are just asked to come and present to them what our concerns are. There's no dialogue back and forth. So that's where I think that the issue was. In regards to building code safety, we definitely are advocating to the province of Alberta that they make significant changes, and that will allow us, once they've done that, to change the bylaws that we have to be able to enforce those changes. So it's just part of that.
I guess the point I'm trying to make here is that we need to get this legislation done as correct as we can make it, so that we have a defined terrain from which to proceed for defining building code changes, for defining provincial regulations, for working out the retail model, which will be a provincial responsibility as well. Mm-hmm. So, but until we get this right, or as right as we can get it, we all this stuff kind of hangs in the balance, right? So.
I have a good solution. Our Canadian farmers currently grow cannabis on thousands and thousands of acres in Saskatchewan, Manitoba, and Alberta, and it's just, they use it for seeds, but it's the same plant, it's marijuana. They can grow this marijuana, they can grow marijuana that would sell in our stores or any stores for $20,000 a metric ton. That's 2 cents a gram. So it could be sold for $1 or $2 a gram, but a tremendous profit to all our farmers across the prairies who have enormous amounts of land that can be used to grow marijuana. At that point, no one would grow it in their home. Growing in your home is expensive. It requires electricity. It's an unnecessary use of urban space. Essentially, if you just legalize marijuana the way you're supposed to, let anybody grow it who's in a position to grow it on an economy of scale, the price will plummet. No one will grow in their home anymore. None of us would. I'm looking for the day when legalization takes all the money out of marijuana. It's so common.
Thank you. I'd like to hear from Mayor Holmes, please.
I know one concern, of course, is grow-ops in houses. Now,
pardon me? I'd like to hear from Mayor Holmes.
Oh, I'm so sorry. I thought you put me.
So I believe what the concern that I've got in regards to this is the information, yes, it does need to be brought forward to this committee and you need to make decisions. And then the province will make their decisions and municipalities will make their decisions. What we're saying is that things are done in a silo, that the province is not here. They're not discussing these changes with you. So Alberta specifically, because that's why I'm here, will have to come at some point and take what you've done and interpret it in whatever's going to happen to them. And then there's going to be things specifically to Alberta we're going to have to deal with at the municipal level. So the ask that we have is that we have those conversations together, that we try to get everything in place before July. And the way that it's working right now and the timing, we don't anticipate that will happen. The conversations will happen here, the province will get around to getting it done when they can, and then it'll become July and we won't have anything ready at the municipal level.
Well, we did invite them, so.
Time's up, Mr. McKinnon. Thanks very much. That completes our first round of 7-minute questions. Now we're going to go to the second round with 5-minute questions, starting with Dr. Carey.
Thank you very much, Mr. Chair, and again, thanks to all our witnesses. This has been a great panel. I guess I'm looking at 288 days, and you know, this started out as an election promise, and I think it was very poorly thought out. At the end of the day, I think everyone, all the witnesses, you know, they want to look after the health and safety of Canadians, particularly our kids. We've heard from other jurisdictions, and what I'm really seeing is a disconnect here. In the United States with Colorado and Oregon, it seems it was the people up. It was you know, referendums and moved up through the process. Here we've got a government that wants to do top down. And Mayor Holmes, we've heard that a lot. In other words, the municipality or the jurisdictions that have done this are telling us quite clearly, before you do this, okay, make sure you have public education in place, data collection, you've got research and development, treatment prevention, workplace safety, all of these things in place. And it seems that the government doesn't realize a lot of that stuff they're downloading to the provinces, the territories, the municipalities, and Indigenous people without giving them the back and forth, like you were saying, to be a partner at the table. So the federal government doesn't even have its law in place, and now they're expecting everybody, the status quo on the ground, to adapt, and everybody just to fall in line, and we're going to be happy July 1st, we'll get this all figured out. So I was wondering, like, are there any programs that municipalities can actually go to the government? They made these announcements, and they're great at announcements, but is there any practical things that you can work with? Because the cost of this, I can't even imagine what it's going to be costing you guys. But for these things, public education, data collection, are there any programs you can actually get funds and help from the federal government to implement what you need to have implemented in just 288 days?
As far as I know, no. That the thing that we're most concerned about is the enforcement side, and then there is not the ability for us to have funding except for what was announced last week. So there's concerns in regards to public education, absolutely. Also, just like I said, capacity for staff, people to understand that are making the decisions, what the impact will be. And there is also, there's a general just discussion on the fact that this is an interesting topic, but it's actually not the #1 priority of municipalities in Alberta. Right. But it's the #1 thing I talk about, because I think people have the most misinformation about this. They just don't understand what they're going to deal with, and they're scared that this deadline's looming, and they're not going to have their communities and their citizens protected in time.
Well, even if you look at some of the science out there, I think it was Mrs. Emery brought about these, is it per se limits or something, if they'll even hold up in court. Now, you say you have 9 RCMP officers, and my understanding is they have officers called designated, what is it, DREs? I forget what it stands for, recognition experts that have been seen by the Supreme Court. And these are trained officers that deal with impairment. So whether you're impaired on alcohol or cannabis or prescription drugs or glue or gasoline, that seems to be the issue. But there's no money put forward. They've announced it. But to have these officers on the ground, because we don't even know if these blood levels, what they mean, or if they're ever going to do anything. What do you foresee the costing for your officers and the training that needs to be done on the ground? Do you see a time limit that you could actually get these things in place that we need to do before this rolls out to protect the health and safety of Canadians?
The concern that I have is that I'm not sure that the technology exists. I haven't been told whether or not it is there. And if it does, then that's fine. Then we need to have the technology purchased and rolled out into each municipality along with the training. We were assured at a meeting with Mr. Blair that the training is being brought forward from the United States and adapted to Canadian needs, and then will be presented to the RCMP. What I have been advocating for, though, here is that we need to make sure that that extends into all levels of enforcement in a municipality and ensure that every single person that will be discussing or having a conversation with someone they believe is impaired will be trained to do it respectfully, and that we won't be in a circumstance where someone will be pulled off the street by someone who doesn't understand what the changes are.
Well, I wanted to, thank you very much for that, ask Mr. Emery, the way that they're rolling this out, like I've heard from some people that say this is actually going to make things worse. And we've been hearing from a lot of people, if they're going to go down this route, to slow down, make sure you're not going to make things worse, that this is going to be doable for the provinces and territories and people on the ground that are distributing marijuana, the medical marijuana market, things like that. Do you think there's any room for decriminalization? Like if we started right away and just said, okay, look, let's breathe for a moment. Let's decriminalize it, certain amount, maybe make it a ticketable offense for now or whatever the comfort is. There any room for anything like that?
Our objective is that there should be no punishment of any kind for the use of cannabis, any more than there is for responsible use of alcohol or a home brew in your own home. I can own a vineyard. With my criminal record, I can't seemingly be able to get a license to produce marijuana, but I can still go out and start my own brewery. I can still start my own vineyard. I can do a lot of things with alcohol, tobacco, and a number of harmful substances that I'm now going to be not permitted under this law to participate in the marijuana industry. One thing you did mention was public education. I sure hope a public education campaign is not going to be done by the same government that lied to the Canadian public for 50 years and demonized us to make people fear us when there was nothing to fear about cannabis users or cannabis growers. And if it were legal, we wouldn't be growing in homes or in facilities we've rented from other people. It would be grown out on our Canadian farms, and we'd let our Canadian farmers grow it and supply us. Soon CBD is going to be in everything you buy. It's going to be in your yogurt, your milk, because it's non-psychoactive and it's a cannabinoid product that's just immeasurably valuable to everybody. It's anti-anxiety, and everybody's stressed out and anxious, and it calms you and it soothes the body, and it's not psychoactive. It's an aspect of marijuana that if you took it every day, your life would be greatly improved, and you're going to see it industrialized in our foods. Like anything you consume daily eventually is going to have CBD. So we're going to see an enormous amount of innovation, but we need to free the market properly in order for all this to happen. Let our farmers grow it. Let them extract it. Let us put it in our foods, the CBD. And you won't be growing in homes anymore. Very few people will be smoking it after about 10, 20 years because much more sophisticated techniques are going to come along so people can benefit.
Time's up. Now we go to His Worship Mayor Ayoub.
Thank you, Mr. Chair. I'm going to ask the question in French, so if you want to take the hearings, please.
Clearly, as a former mayor, I'd like to say hi to my colleagues. We don't forget our roots. But in my situation, I've learned that using cannabis in my region involves 45% of young people aged 15 to 24. I'm from a region north of Montreal, and the percentage of users is 35% for this age group. We also need to have objectives, and we have to meet them to make sure we can address urgent situations. I'm not looking at the advantages or the dangers of marijuana, as there are many. There's a whole range of topics involved in that. But what many people have said is that for kids up to 25 years of age, it's dangerous to use marijuana. And that's exactly why we have regulation coming for legalization. Is to stop young people from using marijuana as much as possible. And they are using it right now from people who produce marijuana, and we don't know what's in it. Organized crime often provides most of this product. So my colleagues, other mayors, when citizens and parents come to see you and they tell you half of my family might be smoking marijuana, and I have no way of controlling this situation. Do you feel there's a sense of urgency when someone asks you that? I'd like to know your opinion on that, Ms. Mayor.
Holmes, you're...
So I agree with you, and I actually have to say that it doesn't take someone coming to talk to me about that. It doesn't require a parent. I'm the mother of a 13-year-old boy, and so I am very clearly aware of what the concerns are, and that's why I'm imploring you to get it right, because I know that, yes, there are people in circumstances, and we've heard about it from the Emerys, about some of the people that are going through struggles in regards to what the current legislation is and how this is being done. But that being said, we need to make sure that we're not rushing into something that's going to create more problems, that's going to cause issues with people feeling comfortable in their communities. And that being said, it's not just the users, but it's also the people that live there, that may be renting a home to someone who's going to be growing marijuana, or who be living in a circumstance where they feel like they're just not comfortable around other people that are using it. And that is the case. So I do agree that there is a level of urgency, but I also believe that there is time to be able for us to have conversations about what we all need in this process.
Mr. Carson, or if you want to, do you have an answer for that? Any preoccupation for that?
Yes, thank you. Thank you very much, Mr. Mayor. So, I think Ms. Holmes answered my sentiments well. In my case, it's more about getting it right for my 3 granddaughters, because anything I try to do at the municipal level, I actually do frame it on the basis of this is all about the future. So, we at FCM still are in a position, we've said this from the offset, that the actual legalization of cannabis is in fact a federal decision, and as you know, was something that was committed to in 2015. So we and the municipal sector feel that we are still committed to ensuring that it is implemented as long as we can be involved, and that it's done in a safe and effective way.
There are several people who've said this. In Colorado, for example, there was a case, and also in Washington. Do you think that overnight marijuana legalization will mean that most drivers on the road will have marijuana in their bloodstream? Will most people start growing marijuana in their apartments? Will most people start using marijuana because it's legal all of a sudden? Personally, I'm not a scientist, but I don't think so. There's alcohol, there's cigarettes, there's all sorts of other legal products that also can harm people, and people are aware of this, and they don't necessarily use them. So I don't think that the world's going to end as when marijuana is legalized. There'll be an before and there'll be an after, and the sky's not going to fall. So we need infrastructure. So that's what we're trying to establish, and we're going to consult as many people as possible. And your government does consult people. We haven't seen this over the past 10 years before it came into power. So what we want to look at is the security of our young people. And that's what I want to add, Mr. Chair. I have no questions.
With teenage use, the Journal of Adolescent Health 2017 reported that teens do not experience an increase in psychotic symptoms with cannabis alone. It happens when they use tobacco or alcohol along with cannabis is when they can aggravate the symptoms. And it's a very small percentage of people already predisposed who might be aggravated. The British Association of Psychopharmacology in 2016 said there's no IQ loss in teenagers, that even long-term chronic users of marijuana do not suffer any decrease in IQ, and we can see over history the increase in use of marijuana, but schizophrenia rates do not go up, IQ rates do not go down, and as I said, American Psychological Association in 2015 said that even chronic users, teenage users, don't have any further health problems later on in life. As for growing in the home, again, I'd like to touch on that since this is municipalities. The reason people are growing in houses is because it's valuable. That's risk and reward. So the more you prohibit or over-regulate something, people people are going to try and get around that, or it will increase the value. So with growing in houses, however, in February of last year, federal court judge, Justice Michael Phelan, did analyze growing inside the home and found that despite the testimony of Len Garris and other law enforcement officials, that cannabis growing in the home can be done safely, and in most cases is done safely, and that's why he offered a federal injunction to provide the permission to patients to grow cannabis in their home. And I came into this building, there's a giant green wall with plants on it. That's a hydroponic system. That's an indoor growing operation right here in this very building, but it's done safely. The vast majority of consumers and growers and even sellers of cannabis do not want moldy bud. They do not want bad conditions in the home. The worst case scenarios that you find with grow ops that have damage and destruction are not patients, they're not advocates, they're profiteers. And the only reason those profiteers are even involved in the growing and selling of cannabis is because when government overregulates it and criminalizes it, it increases the penalties, it increases the reward. So just make it extremely cheap, extremely available. Organized crime is not going out there selling you sugar because it's available everywhere. And if we had cannabis just as available, you take away the profit motive from organized crime, and they'll have to find some other job to do.
Mr. Karsten.
Yeah, thank you very much. Thank you very much for the opportunity to respond. So, Mr. Mayor, I appreciate your question, and I concur, and I believe that's pretty much evidenced by what the parliamentary budget officer suggests. I don't think everyone's just going to go in a car and smoke marijuana. I agree with you, sir. And the budget officer warns, in fact, as alluded to earlier, that revenues from cannabis sales may start out small. But I do want to suggest, as I alluded to, that again, when it comes to local governments, we will still face the significant administration and enforcement costs. And I'd just like to give you, if I may, in 30 seconds or less, the fact that in Colorado, municipal governments collected sales tax directly on cannabis, and these are the kind of conversations that we need to have. You know, it's just not right to roll it out and then come back to the municipalities and say, this is the way it's going to be without us being involved. So they receive an additional 15% on the state's marijuana tax cash fund. So there are other examples like Washington State, but the point being that the costs to municipalities, regardless of how the sales or retail end evolves, are going to be relatively large up front, and that's what we want to have the conversation about. Thank you.
Thanks.
May I just add one thought?
Yeah.
We have to make sure we understand that we're talking about two things when we talk about costs. We're talking about the startup costs. So all the work that needs to be done to prepare for the arrival of this legislation, to prepare for the policing, prepare for all the things, bylaws, etc. Then there's the ongoing administrative costs that will just continue on in perpetuity as the law is implemented. So we just have to make sure we're not losing sight of those two different kinds of costs that are going to be incurred by the municipalities.
Thank you.
Thanks very much. We have to move along now to Ms. Gladue.
Thank you, Chair. I'm going to be sharing my time with Dr. Carey. I'm just going to follow up on your comments from the Federation of Canadian Municipalities with respect to the smart revenue sharing model. So I agree that if municipalities have to bear a lot of the cost of putting this system in place, there should be something in C45 that would actually make it clear how that's going to be split. Do you have a recommendation, or would you like to see a 1/3, 1/3, 1/3 between municipal, provincial, and federal, or what would you recommend?
May I go first?
Sure.
Thank you. Oh, great. Thank you. I didn't catch that part. So at this point, we've not had enough conversations, quite frankly, again, on the potential taxation models to prefer a specific model. So I think you know where I'm going with this, that even though there's not a specific model in mind, we are asking that support be provided to municipalities for the ongoing costs of legalization through some sort of revenue sharing model. Determining how to tax and what form this revenue sharing takes is one of the many issues that, quite frankly, does require further discussion. This is why FCM continues to call on the federal government through those consultations that we have to engage all orders of government. Simply put, you've heard that message, I think, certainly from Ms. Holmes now and ourselves, that where implementation cannot proceed locally without further direction from not only federal, provincial, territorial partners, but also the municipalities.
Yes, it doesn't sound like it's going to happen in 288 days. Anyway, the other thing I want to follow up on was you made a comment about how some municipalities may want to prohibit cannabis sales. And I just wanted to make you aware that we had testimony from Justice that said if at the federal level it's legalized, that will then make it impossible for any municipality to ban it in their municipality, because that would be a violation of everybody's rights and it wouldn't survive a court challenge. So I just wanted to put that out there for you. I'm going to turn it over at this point to Dr. Carey.
Thank you very much. I had some questions in regards to the border issue and trade. We're undergoing negotiations with our biggest trading partner, the Americans, with NAFTA, but there's a concern that I've heard being out of sync with our greatest trading partners. And I was wondering if you thought that it should be made a priority that we should be explaining what we're doing in this regard, because if right now the Americans, if they just ask you, they can stop you from going into the U.S. and this trading issue is all about jobs and the economy. I was wondering if that affects the municipalities, and then maybe also Mr. Emery, that I think you're quite aware they're very high-profile Canadians who have admitted to smoking marijuana, have no problem going back and forth to the U.S., but how does that make you feel?
Well, that's unusual. Most people, if they a border official does a Google search and finds that you've got any relationship with marijuana, they're likely to bar you from entering, at least at that time, and up to 30 days, and possibly permanently. There are lots of examples of Canadians now permanently barred who were, in fact, the former mayor of Grand Forks, Brian Taylor, found himself barred from going back there. He used to go over there to buy milk and eggs, amazingly. I don't know why that's reasonable, but it's so close to the Grand Forks that he used to go and buy his. Now he's barred from doing so because he's had a relationship with marijuana. He's advocated as mayor. I will tell you this, though. The border states of Washington, Vermont, Maine, New York, Wisconsin, and Minnesota all have medical marijuana or legalization regimes. So the entire border, with the exception of Idaho and Montana and Pennsylvania, which is not so much on a border but across the lake, they're the only 3 states left that don't have some kind of medical or legal regime going on in the United States. So this argument that we're going to have a trade problem is diminished. What we're going to have is a border problem. One of the things they haven't thought of with the Ontario monopoly is that every single employee who works for the Ontario Cannabis Control Board is going to be barred from entering the United States. So as long as part of their employment they're willing to admit they're never going to the United States again, then that's fine. I'm sure they'll get employees. We in the free market already acknowledge this, that we're not going to be able to travel to the United States if we have a relationship with cannabis that's in any way public. So I suspect every government employee who wants to work for a marijuana shop might want to consider if they have family in the United States or if they ever go to the United States, because they're going to be barred.
Mayor Holmes, do you think this should be a priority issue discussed maybe between our Prime Minister and the American President about how this will affect our border? Because I'm hearing from Canadians who are worried. There's a lot of snowbirds go down, they own property in the States, and they're worried even inadvertently if they have a cookie or something at a party when it's legal. If they get stopped, if there's a swab or a random test that the Americans are doing, this could be a big issue. And are there any concerns municipally?
It's not an area of space that I have any knowledge aside from watching the TV show Border Security. So I think Mr. Carson's might have more.
Any other comments from?
Time's up. And we have to go to. Oh, I'm sorry. Did Mr. Carson
finish? I was just going. Thank you, Mr. Chair. I was just going to say maybe the mayor has a little too much time on her hands to be watching that show, but that's okay. So we don't really have a position on that either. Mr. Carey, I appreciate the question. What I would say in response, because we're talking U.S. versus Canada, I got to get this in, that every model in every state that's been researched by our policy folks have a specific carve-out or designated fund for municipalities. I had to slip that in. Thank you.
You did. Okay, we're going to go to Mrs. Sidhu now for 5 minutes.
Thank you, Chair. I'm sharing my time with John. This bill enables revenue sharing with provinces and territories. However, the legislation is going to be a finance issue. My question is to FCM. How is smoking, tobacco, drinking alcohol presently regulated for apartment building? What would the process be to add cannabis smoke to tobacco restrictions?
I'm pleased to jump in. So this is not really necessarily based on, I believe, policy work that FCM has done, but I can speak for my municipality and being councillor for now into my 4th term, that it would take a complete workup by staff on a bylaw, some of which potentially could evolve the public hearing process, that sort of thing. So it's a matter of knowing again what's allowed through the regulatory framework that would enable us to go forward with that.
And in your document, cannabis legalization, how can municipalities get ready? You suggested municipality consultation as a way to get ready. Do you know how many municipalities have taken that advice?
Don't have the number here today. We can certainly try to get it passed on to the chair and your committee for next week. We do know, and I know that's an abstract, there have been many members, many communities, many municipalities.
Okay, thank you. Pass it over, John.
Thank you. Thank you very much for sharing the time. Thank you for your comments and testimony today. I just wanted to say before we, I did want to, in the last few minutes of our week-long session on this, to thank the clerk and his staff. I was doing some research to see how many witnesses have come to speak to an act before. The Fair Elections Act had 74, C-51, the Anti-Terrorism Act, had 75, C-2, an act to amend controlled drugs and substances, had 20, and after that it's lower numbers. So I think we might have hit the benchmark with over 100 witnesses on this particular topic, which speaks to the importance of it to Canadians and the social change that's coming with it. And I guess my last question, or so the question I would ask, or more of a comment and reaction to the comment for the Emerys and for others that have been part of this very strong culture in trying to create change. The purpose of the Act is to prevent young persons from accessing cannabis, to protect public health and public safety by establishing stricter product safety and product quality requirements, and to deter criminal activity by imposing serious criminal penalties. The goal of the Act, so if you read that, it isn't about recreational marijuana users and optimizing their experience and optimizing their choices. It's a very different lens. And I think that's the social difference, or maybe the philosophical difference. So I understand and hear your frustration. I hear the background that you're coming from, but the Act addresses different social agendas than the one you've been speaking to.
Well, then it's inadequate. It's simply, but here's the thing. What's also important is there's no apology. The government has to admit that this policy's been wrong for 50 years, that demonizing, persecuting, arresting, and charging 2.4 million Canadians was wrong-headed. It was counterproductive, didn't do anything good for anybody except the police, who benefit by all these things. One thing I would like to point out, you're only a youth at age 15, 16, 17 for 3 years, and then for another 70 years on average, you're an adult. From age 18 to 85, which is the average length of life in this country now, you're an adult. So you shouldn't be writing laws for the 3 years prior to becoming an adult for 70 years. You should be writing the law for the adults. Autonomous adults who can get themselves abortions, who can fill themselves with alcohol. I can buy all the alcohol I want, fill my house. I can do a lot of things that are very, very dangerous, and this government and this society, a free democratic society, allows me to do that, and that's great, because most people handle responsibility well when given to them. But in this act, it's the opposite. It's like we're children, we're being condescended to constantly, told absurd, ridiculous things like your plant can't be higher than this. Who can control nature like that? These are plants, they grow. Right? They're going to be all sorts of sizes and stuff like that.
Thank you.
Everything in the legislation is inadequate.
I hear your reaction, but I just wanted to make sure that we clearly understood the intent.
But you said you were going to legalize. You didn't say this was a halfway measure to get somewhere. This was promised as a legalization by the Prime Minister at the last election.
For the municipalities, is there any final, like, I've heard a couple of areas of concern. A lot of the issues that you raised are with the provincial legislation yet to come. We're really dealing with some fairly limited blunt tools at the federal level. Are there any last words you would give to the committee as we're wrapping up this week that would facilitate your ability to prepare now based on the federal? I mean, you've got drafts of the Federal Act in front of you. To the extent they impact municipalities, you got a pretty good read of what's coming at the federal level. Is there, that's why I'm a bit, I understand you have a lot of detail yet from the provinces that you need to distill and understand, but is there any last federal direction that you're looking for clarity on, or areas that you're concerned about, other than the timing?
Is that for Lisa?
Yes, it's for you, Lisa, and for yourself, sir.
Okay, so Lisa, do you want to go first? I can't see you.
Sure, that's fine. Thank you, Bill. So in regards to the ask, I guess, is I would like it to include a municipal revenue source in order for us to be able to cover the costs that we're going to incur for this. And I think that that's a really strong point that's been made by FCM over and over again. As well, I like some assurances that we're going to be able to get the training in place and that that's going to happen and it's going to be covered through all different municipal police type of enforcement services. And then I would also I would ask that you implore the province that we sit down and have a conversation about what it looks like in a year, in 5 years, so that we're able to sit and say the outcome of this is what, and how can we all work together to get there.
Thank you.
So thank you very much for that question. Just in response to Lisa's comments, I would piggyback on that and say that, sure, let's have a continuous conversation over the next 5 years, but we do need to start as well to have a dialogue and conversation immediately. I don't want to repeat a lot that I've said, but certainly we have said all along that we want to engage as partners, and we can do the job of giving the tools and information resources to act now. So I just want to leave to be hopefully at the end of the day, and hopefully you folks are going to get your chance to hop on flights soon and head back to your respective hometowns. But I want to leave you this hopefully very valid and strong point that there are many examples and data that we can draw on from our neighbors in the south. And the Denver model, a municipality with just under 700,000, the costs associated with public health, education, enforcement totaled $7 million at the startup. Those projected numbers from 2016 for one municipality were about $9 million. So that is the plea for us to be engaged with you as a national organization on an ongoing basis immediately, and please consider startup costs and the ongoing model to provide municipalities the funds they need.
Thank you very much.
We have to move along now to Mr. Davies for the last question of the week.
Ms. Emery, I want to address this question to you as someone who's operated a dispensary. Prime Minister Trudeau also said this: the challenge of getting this important initiative right is one of ensuring we are broadly listening to partners, to folks in the medical marijuana industry, to municipal partners, to provinces, and drawing from best practices from around the world. We're going to get this right in a way that suits Canadians broadly. Now, I want to ask you a question about edibles and concentrates and other products that C-45 will continue to make illegal. We've heard evidence before this committee that Colorado, Washington, Alaska have all legalized edibles. Colorado appears to have a very mature and thoughtful regulatory regime about those products. And here's what the task force said about edibles. In weighing the arguments for and against limitations on edibles, the majority of the task force concluded that allowing these products offers an opportunity to better address other health risks. Edible cannabis products offer the possibility of shifting consumers away from smoked cannabis and any associated lung-related harms. This is of benefit not just to the user, but to those around them. This position, they said that access to broad range of cannabis products is possible via the illicit market, including through dispensaries and online retailers. So they recommend that the government regulate the production of cannabis and its derivatives, for example, edibles, concentrates, at the federal level, drawing on the good production practices of the current cannabis for medical purposes system, end quote. Do you see the omission of edibles in this bill and concentrates as a good or bad thing?
I think Canadians should have the free choice to consume cannabis however they would like, and I know that the Supreme Court of Canada sided with edible producers who literally made cookies and sold them in a dispensary. That's R.V. Smith, determining that cannabis patients do need access to oils, tinctures, extracts, hashish, whatever it may be. Edibles are extremely valuable, and we know that in Toronto, when the police cracked down last year, they really targeted edibles, and seniors are the ones who are hurt most. Elderly people, grandparents who come in and they're tired of these pills that they're on, they're tired of being unable to sleep, and all they know is that a couple bites of a cookie at night after dinner helps them feel better. No law should prohibit someone from having access to that. And if you'd like to see what branding and advertising in edibles look like, go to a cannabis event. Just follow my social media if you like, or check online, and you'll find that there are these marijuana events everywhere. There was an event called the Karma Cup that just happened. And you can see there are dozens and dozens of brands that are sophisticated. They've got logos, they've got products. They put a lot of time and effort into this because the producers of edibles in this country are not shady dealers on the street corner trying to get kids to use pot. They're conscientious Canadian citizens who are trying to provide a much-needed service. Edibles have to be legal. I personally don't believe the federal government should be managing all these little details. I think cannabis should be removed from the CDSA and let everybody figure it out as they may. But edibles must be legal. They must be allowed.
Thank you. Mr. Emery, the task force also said this about e-commerce mail order. Consideration should be given to ensuring that online retail sales have appropriate consumer safeguards to accommodate those who may not have access to storefronts, for example, small communities, rural and remote locations, mobility-challenged individuals. A direct-to-consumer mail-order system for non-medical cannabis should be considered. You're probably aware that C45 does not contain a permanent national e-commerce platform. Is that a positive or negative thing in your opinion?
Well, a lot of these things depend on your interpretation. As representing the free market / black market, I would say that's more business for us if the government wants to neglect that area. But what we're really looking for in legalization is a reduction in the price over time, because something that's legal should be cheap. And right now, the price of marijuana is artificially high, and all the derivatives are way too high. People are spending far too much money on marijuana, and that's created a lot of the problems, is that it's attracted gangs, it's attracted criminals, it's attracting government. All I've heard from these fellows from the municipalities, how can we gouge the public for more money? We need more money. And somehow legalization is going to cost every single bureaucracy more than it did before. The cities are going to spend millions. The cops are going to spend millions more. You'd think we were doubling up on the criminalization, which we may well be doing, and that's why we have to spend all this money. Because it doesn't sound like legalization from anything I've heard from a municipality, from a provincial government, or from anybody here. It sounds like you're all into control and gouging as much money out of a vulnerable population of pot smokers as you can possibly get. And that, to me, is the real reason for this legislation. It's not to legalize pot. If it was legalized pot, Mr. Trudeau would say, Mr. Speaker, we have a majority. We've just removed cannabis from the schedule. My health minister will direct that, and from now on, the provinces are free to regulate. And that would be the whole legalization campaign. Instead, you've got 300 pages of a Cannabis Act that recriminalizes everybody, makes a huge bureaucracy of government at all levels, which we don't need, spends a lot more money, gives police more power. That sounds like prohibition.
Thanks. Mr. Speaker.
Time's up.
Okay. Mr. Speaker, I'd like to move my motion now, if I may. As I've given notice yesterday, I would like to move that pursuant to Standing Order 1082, this committee meet for an additional 2 days for the purpose of the consideration of Bill C-45, an act respecting cannabis, and to amend the Controlled Drugs and Substances Act, the Criminal Code, and other acts, and that the chair be empowered to coordinate the witnesses to a minimum of 32 witnesses, 8 per stakeholder group, the resources and scheduling necessary to complete this task in accordance with the following guidelines.
Let's excuse the witnesses. They've been here a long time. Then we'll continue on with your issue. Okay? Is that all right with you?
I got all the time in the world. Unemployed.
But we invited the witnesses to be here.
You said, Mr. Chair, that I was the last speaker, so whether they're sitting there or not doesn't seem to really matter. But
I think we should thank the witnesses and for their contribution. They've all made a unique contribution, everyone. We value them all. They're very important testimony today. So on behalf of all the members of the committee, I want to thank you all for your contribution and your information. So with that, go ahead.
I'll just continue reading. I'll continue reading where I was. 1, witnesses are to represent the following stakeholder groups in 4 two-hour panel blocks per day. 1, existing Canadian licensed producers and dispensaries. 2, producers of edible cannabis products and other non-smokable forms of cannabis. 3, ordinary Canadians who made a written submission to this committee regarding C45. And 4, young Canadians 15 to 24 years old. Number 3, that witnesses for each panel block be allotted as follows: 2 Liberal, 1 Conservative, 1 NDP. 4, that witnesses be directed to prepare oral remarks for 10 minutes in length, and that the witnesses be invited to submit written statements prior to appearing. And 5, that the meetings be held prior to September 30, 2017. Mr. Speaker, I'm going to speak to my motion and give the rationale behind it. C45 is groundbreaking legislation in many respects. It changes a century of legal, social, economic, and cultural policy in this country. It's 131 pages long. It's 226 sections plus schedules. It deals with a number of complex issues about cannabis decriminalization. It involves cultivation, possession, age of access, health impacts, enforcement, production, packaging, labeling, international implications, edibles and concentrates, education, research, and other issues. Now, the Liberals proposed in June 5 days of hearing only to be conducted the week before Parliament resumed. They solicited the opinion of Canadians over the summer, when Canadians are probably least engaged in public policy. They have scheduled these hearings before Canadians could even be really fully engaged. In many respects, the hearings are over before most Canadians are really engaged in the hearings at present. By scheduling the entire week of hearing before the House of Commons, it avoids scrutiny in the House of Commons and restricts the ability of MPs to raise evidence that we hear in the House of Commons to question the ministers and government, as responsible government should allow us to do. It restricts the committee's ability to properly follow up on issues that arise from the testimony. And we've heard a lot of testimony this week that raises many issues that I think MPs on all sides of the table would like to be able to follow up on. Now, at that time in June, both the New Democrats and Conservative opposition objected to those 5 days. We said we need more days. And I want to pause to emphasize that this committee is the only phase of the legislative process where Parliament hears from the public, from stakeholders, from experts. It's the only opportunity for public input. And I believe that it's very important to hear those views as we do our job to study this bill. Now, at that time in June, when the opposition objected to the limitation of 5 days of hearing, the Liberals agreed. And they said that they were open to holding more hearing days if needed. Now today, after 5 days of hearing, it's obvious that there are glaring holes in this bill and that there are many issues that have been raised, and most importantly, that there has been an absence of critical voices. We have not yet heard a word from young people. We haven't had one witness aged 15 to 24. Yet, Mr. Speaker, we have heard from all sorts of people about how important it is that we get this cannabis legislation right for young Canadians, the health impacts on developing brains, how important it is that we talk to young people in a manner that they will accept and understand, how we're to be protecting the health of young Canadians, and yet we don't bother to listen to a single one to tell this committee about their access and how they feel about this issue. We haven't heard a word from ordinary Canadians, and there were many ordinary Canadians who wrote this committee with submissions and requested to appear. We didn't schedule one of them. Third, we haven't heard from any licensed producers themselves. The very people who have been growing legally cannabis in this country for the last 10 years. And fourth, we've heard a lot of evidence, and I think some exaggeration and maybe even some mythology about the impacts of edibles, but we haven't heard from a single edible and concentrate manufacturer or industry. Now, quite honestly, I think that these are glaring errors. Yet, for some reason, I believe that the Liberals do not want to hear from a single one of these groups. Now, Mr. Speaker, Mr. Chair, the New Democrats support legalization. We broadly support this bill. Frankly, we believe that this bill can be brought into force by next July, and we're willing to work with the government to do so. We want to work with the government to fix the holes that are in this bill that we've already identified. The absence of edibles and concentrates, the fact that there's a lack of a national e-commerce platform, the fact that this legislation does not deal with pardons, the fact that we have border issues and international considerations. There's all sorts of aspects to this bill that I think require further scrutiny. The fact that it still criminalizes many Canadians, including maintaining a maximum penalty of up to 14 years in prison for Canadians. So it is not the New Democrats' intention to be deleterious or to delay in any way the government's stated objective of hitting July 1. That's why in the context of my motion in the text, I said that we could hold those 2 days by September 30th. We know that the ministers are scheduled to appear next week on Tuesday, and we know at that process we're going to need at least after that we're going to need at least a week or two to prepare the many amendments before we start the clause-by-clause examination of this bill, where we're going to go through the entire bill line by line and discuss and debate and move amendments. We are into October no matter what. So I think it's eminently reasonable to say, let's schedule 2 more days of hearing to hear from those groups that are so important to hear from prior to September 30th, so that we can make sure that we have the broadest, most comprehensive evidence and information that we can get before this committee, and still allow the government to meet its stated objective. Now, I'm going to conclude by saying it's my understanding that the Liberals are going to vote against this motion. They're going to have to tell Canadians, explain to them why the voice of youth are not important to inform this bill, why the voice of ordinary Canadians are not important. And I want to stop and say on that this bill isn't for producers, it's not for dispensary owners, it's not for edible manufacturers. This bill is for the millions of Canadians who voted last election for the promise of legalization of cannabis. And to proceed with this bill without hearing from them is unacceptable. You know, the government side may argue, well, they heard from the task force. That was to inform the process. What I want to hear from are those people about this legislation. I think that they have a right, now that legislation has been drafted and tabled before Parliament, they have a right to now offer their comment on the actual proposals that have been before us, particularly when the government has ignored several recommendations of the task force in this legislation. So I really hope that the Liberal government will see fit to include these important voices. And if not, I hope they have a good explanation as to why these important voices are not important to be heard at this committee. Where, I will conclude here, the difference is this. It's not enough to say that people can contact MPs on their own, or we can hold town halls, which many of us have done or are doing. To testify at this committee is to testify in front of the entire Health Committee, in public, recorded, televised, and in both languages. And that provides a unique opportunity to hear that voice that is not fully accommodated in any other fashion. So for all those reasons, Mr. Chair, I would urge my colleagues to support this very reasonable motion so that we can bring Canadians the best, safest, healthiest cannabis legislation that we can possibly craft as Canadians. Thank you, Mr. Chair.
Ms. Sidhu.
Thank you, Mr. Chair. Mr. Chair, I'll be speaking against this motion. And I want to remind this committee, my colleague, Mr. Davis, voted in favor of this motion when we set up the 5 days uninterrupted study. We are doing this. Our government ran campaign on this issue in 2015. 2016, Cannabis Task Force worked for 6 months, consulted over 30,000 Canadians, and traveled across the country and to the other jurisdiction. Committee heard over 100 witnesses this week, including over 40 hours of testimony from government, law enforcement, medical community, researchers, scientists. Committee also received 100 written submissions. All three parties worked over this summer to build their witnesses list in preparation for this study. In addition, provinces and territories are doing their consultation. And I just want to thank you, Chair. Thank you all the colleagues. I think it's important piece of legislation. We should move forward.
Okay, Dr. Carey.
Thank you very much, Mr. Chair. And I want to thank Don for bringing this forward. I think well said, Don. Thank you for that. And he reiterated that in June we did vote against this. The Liberals wanted to kind of pigeonhole us into 5 different days with different topics, and we did want to hear from different groups, and Don has brought forward the names of some of those groups. At the end of the day, I think Canadians expect us to be looking at after the health and safety of Canadians. That's what this committee is all about. And if you listen repeatedly to the Liberal talking points, it's consistently they want to keep this out of the hands of kids, and they want to keep the proceeds away from organized crime. Throughout these witnesses we've heard, even from Liberal members, it's obvious that there are huge gaps in this bill. And if we don't get it right, we've heard it over and over again, this could actually make things worse for everybody in Canada. So I know we're going to hear the government come up and they're going to say, well, we've heard so many witnesses, the number of witnesses in that, they're going to compare it to other studies they did. Well, I'm not interested in that. These other studies, sometimes they were shut down as well. We were promised that the Liberals were open to more witnesses, and what this has done for me is really given me a perspective on how complicated this issue is, how different levels of government, they need to get the boots on the ground. They got to get these all prepared. And I think, as my Liberal colleagues have noticed, there are huge gaps in this bill. And I think we need a little bit more, let's say, perspective and make sure we get it right. That's the least we can do for Canadians. So, Don, we'll be supporting your motion.
I do.
Thank you, Chair. I just want to speak also in support of the motion. I was very disappointed this morning that when I suggested adding more meetings for more witnesses, that the Liberals shut that down. They keep saying they're not rushing, but it looks like they're rushing. And we haven't heard from Uruguay. It's the only country in the world other than us that's ever legalized marijuana. We should at least hear what they have to say. There are a number of other things that have come out through the testimony that have pointed out gaps that we would need to close, the border issue, the international treaty issue, a number of different things that are not addressed, the revenue sharing, things that we would need to hear more testimony on. And so thank you, Don, for bringing that forward, and I will be supporting.
Mr. Davies.
Just briefly, in response to Ms. Sidhu's comments, again, the original motion by the Liberals was to have 5 days of hearing only, and after deliberation, this committee changed that motion to say that there would be an initial 5 days of testimony plus the possibility of additional days, if necessary, and the Liberals agreed to that. Now, after 5 days of hearing, the Liberals are saying no, there's no more possibility of further days of hearing. So, if anything, it's the Liberals who are backtracking on the commitment made in June. And second, I'd like to say that, again, hearing from Canadians on the task force is not the same as hearing Canadians comment on the drafted legislation, particularly when the legislation deviates from the task force recommendations. And my one example is edibles. The task force said, for various reasons, after listening to 30,000 Canadians, studying the experience for the jurisdictions, they came to the considered and evidence-based position that this government should legalize edibles, and that's what Canadians told them, and then the government tables legislation that ignores that. I want to hear what Canadians have to say about that.
And finally, again, I'll just say this, that, I don't need 50 and 60-year-olds telling me how to talk to a 16 and 17, 18-year-old. I want to hear from the 16, 17, and 18-year-old what they think about cannabis. And I think to shut out that voice and not hear risks us doing a great disservice to all of the stated concerns that people have stated about the health of young Canadians. I'll just stop there, and I'm happy to proceed to a vote if
All
my
right.
colleagues want that.
Seeing no more speakers, we'll call for a vote. All in favor of this?
I'd like a recorded vote, please.
I have a point of order too.
Yes.
Mr. Chair, that here in Health Committee we have certain members that are part of this committee, and I think it was tabled in the House, and I think officially Mr. Kang is still a member of this committee, and I'm not sure if the Liberal government can substitute another Liberal member. I know Mr. McKinnon's here, and I appreciate his input, very good input into the committee, but technically speaking, if the government party can actually substitute a member in for an independent, and then if that member actually has the right to vote, I was wondering if you could let us know the rules on that.
Okay. My ruling is that he can be substituted, and Mr. McKinnon is legitimate as a voting member of the committee. Mr. Davies.
I'm sorry, Mr. Chair. I just want to make sure that I'm requesting a recorded vote, please, on my motion.
Okay, we go to a vote.
Monsieur Ayoub? Oui, sur la motion de Monsieur Davies. Dr. Ailson?
No.
Mr. McKinnon? No. Mr. Oliver?
No.
Ms. Sidhu? Dr. Carey? Ms. Gladue?
Yes.
Mr. Davies?
You betcha.
Nays contre 5, yes pour 3.
Motion defeated. So that's the end of meeting 68. Thanks very much, everybody.